Okay, welcome back. We're going to recommence our public comment with our emails, which Mr. Stokas and Ms. Beaupre will be.
And Mr. Merker.
Mr. Merker. So we have a 3-tag team. I like it. Okay, Mr. Stokas.
All right, Mr. Chair, first comment, Owen Bradley. If you allow BLM protests en masse, you can allow the celebration of our independence. Go ahead, Mike.
From Carol Goss. Nothing is perfect, but if each of you vote to mandate masks in Martin County, as our medical professionals locally and nationally have been begging you to do, you will make it so much easier for all county residents to comply. Unanimity on your part will set the best example of good citizenship. Protect yourself, protect each other. If everyone is required to wear masks in county offices, then all should be required to wear masks. Every building open to the public. Thank you.
This is from Deborah Hutchins. Yes, mask wearing in public should be mandatory. Businesses, offices, restaurants, etc. will require people to wear shirts and shoes without it being perceived as a political statement. If there are known precautions that can be taken to prevent the further spread of COVID, they should be taken. If you don't want to wear a mask, don't go out.
Next comment from Tom Pine. Good morning, Commissioners. Today I feel confident you will pass an emergency order that will require all residents and visitors in Martin County to wear a face covering while out in public. I would ask that you consider face shields as an alternative for at least 3 reasons. Number 1, people with respiratory problems would have an alternative. Number 2, those with a concealed carry permit will be able to carry their guns and not be in violation. Number 3, it's summer and wearing a face covering while working outside dealing with the public will be very difficult in this heat. When this passes, it will be another example of the double standard in Martin County, one standard for the general public and another standard for the good old boys. Because of the face covering laws will be enforced on the public, but the state emergency law requiring 6-foot social is still ignored when it comes to restaurants like the ones in downtown Jensen Beach. At the June 19, 2020 Commission meeting, there was many professionals that spoke of the urgency for the public to be required to wear face covering in public. There was one especially stood out to me. She gave Hong Kong as an example of wearing face covering should have an immense difference in the infection rate of COVID-19 in Martin County. Hong Kong has a population of 7.451 million people, and as of June 19, 2020, had 4 COVID-19 deaths. Comparing that to Martin County, we have a population of 146,319, and as of June 19, 2020, we had 19 deaths. In 2003, Hong Kong had a test run for a pandemic. It was called SARS. That was when face coverings became the go-to protection. So when COVID-19 hit, they were ready. Will we learn, or will the virus win? Another issue is the CARES Act. Businesses that have been blatantly violating the most basic precautions, such as social distancing, should not be getting a public assistance. There are many businesses that are working hard to help this community beat the deadly virus. Those are the businesses that need our help. Those businesses that continue safety in back seat should ask their enablers at the county for help. Next comment.
Comment from Rebecca Boissevain. Please do not mandate masks for our county. As a 19-year full-time voting resident of Martin County, I have full confidence that we the people are smart and can make smart decisions for ourselves and our families. Please vote no on taking away our rights to make choices for ourselves. Thank you.
Next is from Diana Mack. Please keep beaches closed during this 4th of July.
Next comment, Jane Logan. As an ex-smoker, I remember when smoking was banned in indoor public places. I'd be stuck in a meeting, unable to go outside, and would experience the agitation and discomfort associated with withdrawal. Unable to light up in order to achieve physical comfort, these same arguments were used then that many are using now. That ban was a violation of their constitutional rights. Government was mandating their choices when it came to using their own bodies, and were making medical decisions for them. The public was told that scientific studies had shown that smoking didn't just impact the smoker's health, but could also impact the health of those around them. Like now, there were those who challenged the science and discounted the evidence that proved the dangers of secondhand smoke. Like now, those challenges were putting people's health at risk. Today, the evidence is clear. Face coverings reduce the risk of COVID-19 being spread from one to another, period. Almost without exception, we are having we are hearing from our health agencies and medical professionals saying face coverings are a critical part of the controlling the spread of this virus. Unfortunately, this has not convinced people in some places, the majority of people, to cover up. So also, unfortunately, is clear a county mandate is needed to accomplish what seems like a simply safety measure. Please vote today in the interest of public health and safety and implement and enforce face covering mandate. Thank you.
From Denise Punger, doctors oppose mandatory masks. Masks damage children's psyche, cause more harm than good. They suffocate people, hurt businesses. They are pollution on our ground and waterways. They don't actually do anything to stop the spread of the virus. I can't make complex medical decisions when I am suffocating, lowered O2, and have this face barrier. Why is this all about the mask? Get nutrition, extra supplements, fresh air, exercise, stop smoking. Denise Punger, MD. P.S. Keep Florida beaches open. Being outside is the best thing. There's plenty of beach and coastline in Florida for all.
This is from Beth Baxter. I believe it is important to require masks be worn both indoors and outdoors when social distance can't be maintained.
Next comment, Sharon Powers. Let's discuss what the state and local government, that's you, have done in the past few months. You have taken away our ability to work in our own businesses. You have taken away our most basic tenet of cultured society, our education system. You have taken away the growth and creation of families by not allowing weddings. You have taken away the grace of saying goodbye to loved ones as they die and robbed us of the most basic human rights. These are not privileges given to us by the government. These are rights. It's time for you to sit down and let us live our lives before we take these rights back by force, because we are done sitting down and taking this quietly.
From Katie McCarthy. I don't envy your jobs and the seats you are in today, but with your job comes the responsibility to make hard, right decisions on behalf of the community. Decisions that will be applauded by some and despised by others. Having said that, when seen unemotionally, the choice is simple. One choice can help save lives. One choice can cause loss of life. I implore you to make the hard, right choice before you and mandate use of masks for all residents.
Next, from Jane Lacombe. Please, please, please make masks or face coverings mandatory in Martin County. I am a registered nurse at Cleveland Clinic Martin Health and have been fortunate enough to be working remotely at home due to COVID since the end of March. I've been self-isolating and sequestering away from my children and grandchildren, but would love to see them and hug them someday soon in person. FaceTime just doesn't cut it. By selective or optional masking, we are really only prolonging this horrid non-discriminatory virus. I don't want to get it, and I want to be able to go out in public, go to the store to get groceries without the fear of potentially getting COVID from others who are asymptomatic or pre-symptomatic. Please make masks mandatory. It's not going to go away all by itself anytime soon. Thank you.
Next comment, Mark Roberts. We are at an interesting crossroads in our nation. There is violence and rioting. There is anarchy and destruction of historical monuments. There have been many innocent people killed and even more assaulted in the last several months. No wonder America was growing restless and the oppressive mandates given by government at state and local levels. The inability of local governments to have common decency and to care about the residents has been forsaken. And if you think that the violence you watch on the news at night is not able to come to our town, then you're just passing these oppressive emergency orders and watch it come to our doorstep. How can you not see this? The United States was a powder keg waiting to explode, waiting for a reason to let loose. But make no mistake, the real reason the country is restless is because we are being asked to commit actions that are not sustainable to enjoying life. 2 weeks was sustainable. We are past 4 months now of oppression by our government, including our local governments, and that's you. And we are tired of it. It's over. We will not close our businesses. We will not withhold education from our children. We will not let our loved ones die spending their final days alone. We will not allow our babies to be born and not to allow the fathers to be present for the birth of their children. We will not wear masks. We are free Americans.
From Dante Wallace. I ain't going to wear no mask and be racially profiled and followed around. This is for the birds, all you mandating black people to cover their face up and be a target out in public.
The next one is from Christopher Billiot. Do not close. There is no contact tracing data that supports COVID-19 exposures having occurred at any Florida beach. Data on the virus suggests that outdoor locations are highly unlikely to be epicenters for spread, even if distancing is not entirely maintained. In other words, the county can actually save lives by keeping the beaches open and not forcing the gathering of people indoors.
Next comment, Christine Grosso. It is my opinion that people in this country should be required to wear masks when being physically distant is not possible. This week I have received news of many people I know of who live in our country that have tested positive, it was our county, that have tested positive for COVID-19. If we do not begin to get a handle on infections and contact tracing, there is a slim chance of school returning in the fall. This virus will not magically disappear. It will take everyone's efforts to stop the transmission. We cannot do that unless the public takes the threat seriously. As we continue to weigh the possibilities, we have more and more infections, and the likelihood of us going back to normal existence of work, school, general life gets pushed back. We are wasting time. The time to act is now. We have just over a month before school starts to get on track. Please require everyone to wear a mask.
From Amy Price, mandating face coverings goes against our constitutional rights. There is no proof that they work, and they can actually be harmful. Where are the studies on children wearing masks? And what about those who cannot wear a mask due to an existing medical condition or disability? You put them in an awful predicament when they are turned away from businesses and services. You are creating a situation where business owners and the general public are becoming law enforcement officers. People are being discriminated because of their disability health condition. It's happening. That is not fair or even legal. Mandate masks for the public, and this will get worse.
From Bridget Kerouac, COVID infections rates are spiking. Our hospitals can only handle so many sick people at once. Masks should be mandatory for everyone when they go out in public. Also, beaches should be closed for the holiday weekend. People are obviously not responsible enough to follow CDC guidelines. Beaches south of us will be closed. These counties have very high rates of infection. Their residents will come to our beaches if they are open. Close the beaches to protect Martin County residents.
Next comment, Sarah Alves. We are living in a world where freedom of speech has been snuffed out. Our education system was demolished overnight. Our business that we worked our entire lives for has been stripped out of our hands. Healthy people are determined to be sick even when they're not. Normal citizens are racist even though they're not. You are not allowed to celebrate Independence Day because our independence is being taken away from us before our very eyes. Couples are now allowed to have weddings. Our loved ones have been refused to have funerals. This isn't the culture of safety. This is barbaric. And now you want to take the very last vestige of a person's character. You want to take our smiles. Living a life without seeing a stranger smile in life is a life not worth living at all. It is any wonder suicides have skyrocketed. I will not wear a mask. I would rather die than live in a world without seeing a stranger smile.
From Silke de Alessandro. I urge you to immediately make masks mandatory for everyone in Martin County while outside of their own home. Martin County's recent positivity rate of 23% is classified as uncontrolled spread, and we currently have one of the highest positivity rates per 100,000 residents in the entire country. This is putting all of us at great risk. Masks are only effective if one wears them. This is why it needs to be mandatory. I would also be in favor of fines for violators.
From Susan E. Parks, thank you, county administrators and commissioners, for using prudent judgment during these unprecedented times. Your guidance and action have been well noted and appreciated. As we move forward into the summer and the upcoming holidays, please consider closing our beaches and parks to all but Martin County residents. The influx of additional individuals from locales during these times overburdens our locations and the facilities. Please save these locations for our residents, the county taxpayers. These are times for making positive memories in an uncertain time for our already stressed families. We just want an enjoyable family holiday outing. Please institute the residency requirement for beach access to our parks during these most difficult times.
Next comment, Brianna Apostolopoulos. Mental health matters too. Masks can be extremely triggering for trauma survivors. People who have panic attacks, anxiety, people with hearing disabilities, people with autism, and people with airway restrictions. Physical health matters, but so does mental health. It should be a choice to wear a mask, and there are people who have worked years to be able to go out on their own and do simple tasks. Don't create more barriers for those people. Also, why can't we report the number of people who are positive for the virus and are asymptomatic and or doing just fine managing mild symptoms? Why are we not putting a positive spin on daunting numbers? Thousands of people in our county are not clogging up our hospitals. Yes, there are some affected in terrible ways, sometimes even death. However, our county should be doing a better job to give the full picture of the situation. Not reporting the full picture locally has a huge impact on people's mental health.
From Mike Turner. As we know, and as the governor has stated several times, many of those testing positive were tested positive due to being in the hospital for other reasons and were given a COVID test. These patients show no symptoms and they have no ailments from COVID. These are counting as positive tests and hospitalizations, but they never would have known they had COVID since there were 0 symptoms. And the hospitalizations are not from COVID. Tough questions need to be asked of Mr. Lord from Cleveland Clinic on what Cleveland Clinic is currently seeing. We have all heard the reports from Dr. Fauci and Dr. Birx of COVID tests coming back as false positives and to get tested twice to make sure. CDC has reported antibody tests showing a false positive, and even agencies recording the antibody test as a positive case instead of an antibody report. Cases have increased, however, the rate of hospitalizations and deaths have dropped off a cliff. Why is this not being focused on? Why are you not asking Cleveland Clinic to give reports on how acute the cases are to determine if they are mild with barely any symptoms or if they are as severe as they were back in March? You all are failing us and not getting enough information upon which to base decisions, and yet asking residents to give more and more of our liberties. We're sick of it.
From Charlene Gelka, mask must be made mandatory by all citizens when out and about to help curb the increases in COVID.
Next comment, Laura Joyner. I went to the beach with a couple friends last weekend. The beaches were full, but everyone stayed to themselves. Everyone brings their own chair or towel. No one is touching doorknobs or sharing chairs. Everyone is in the open air and sunshine, which is so good for your health. Now that it's Independence Day weekend, you have closed Martin County beaches. How outrageous. How ironic that on the day we celebrate our freedom, you decide to close the beaches, especially for that. Just let the people be. Stop controlling everyone. Let us be free. We've had enough. The beach is the most unlikely place to catch the virus. The salt water, the fresh air, the heat. Commissioners, you are not doing the will of the people by closing the beaches. We want our beaches open.
From Scott Bolden. I refuse to be masked or muzzled. Vote no today.
From Samantha Ramlaw, please mandate masks in public places and close the beaches from July 3rd through 6th. Thank you.
Next comment, Donald Grandone. I am vehemently opposed to any mask wearing requirement. Throughout this COVID event, the ongoing media blitz based on faulty statistics has caused hysteria unlike any of this country has experienced. Prior to the COVID appearing, all medical sources said masks do not help in the prevention of transmission of pathogens. This was repeated after the appearance by COVID by our experts, but magically, very recently, they became effective. So, they have credibility issue on mask wearing. Additionally, in the beginning of this mayor, we were told, stay safe at home, which everyone was forced to do in order to prevent the overwhelming of medical facilities. We all dutifully complied, and now that it is clear we are in no danger of that happening, the focus has shifted to preventing more cases, which in many instances are conveniently asymptomatic. Asymptomatic cases will make it easy to have a perpetual mask requirement, as anyone supposedly transmit at any time forever. Is this the intent? To make these dehumanizing masks a permanent feature in our lives? It appears so. This Board of Commissioners, who have all been in office for too long, should think long and hard before creating more tension and anxiety by the local population by trying to protect us from the virus that seems to do whatever the media needs it to do on any given news cycle.
From Jack Dorrell. It is now very clear to everyone that is paying attention that this is all about creating a miserable and dejected population completely dependent on the government, willing to accept anything, willing to accept anything and living in fear. I will not live in fear. I will not wear a mask. I will go to the beach anytime I choose. I will go to work every day like I always have, and I will enjoy my freedoms as an American, and I will not submit to any contact tracing or similar invasion of privacy.
From Kathleen Toll, please mandate the wearing of masks. You will be doing the responsible thing that will actually save lives. If some people yell at you, so what? They'll get over it.
Next comment, Sharice Stevens. I encourage you to vote for the county to wear masks. This is a consideration for all. Thank you.
From Jane Muller. Just because there is pandemonium and lawlessness throughout the country does not give any of you commissioners the authority or the ability to remove the rights of the residents of Martin County. I'm specifically talking about the vote to close the beach and the vote to mandate average citizens to put a piece of cloth over their faces.
From Beckett Dawson, I'm writing in support of increased mask wearing while out at public places locally. While research and information is evolving daily, we know from epidemiologists that wearing masks does decrease transmission when all parties participate. With the local numbers exploding exponentially, I'm asking that we mandate this simple yet effective strategy. Many other states have done this proactively with positive results. We need consistent, research-based leadership to keep Martin County safe. Please consider temporary increased mask mandates so we can effectively and consistently reopen the economy in an attempt to get back to some sort of normal. Thank you.
Next comment, Frank Morrow. Shame on you for voting to close the beaches. This is a time when families need to celebrate and we all need time to relax and try and get away from the stress and insanity we have been going through in these past months. Shame on you. You could not care less. Excuse me, who decided that during a time of financial crisis, when families have lost their jobs and families are getting evicted from their homes, that you have the right or the authority to close beaches and cancel Independence Day celebrations?
From Grace Sanford. July 4th is Independence Day, and this Independence Day, the Martin County Commissioners have rewarded the residents with oppression. My husband was a World War II veteran who stormed the beaches in Europe to maintain the freedoms that Americans hold dear. I've lived 91 years on this earth, and I am not afraid of COVID, though I am of the age which is most at risk. The government at all levels, from national to state to our county commissioners, have shown mismanagement, fear, and poor decision-making consistently from the start of this crisis. And I use the word crisis loosely because it is evident from the data that this virus never had the capability to kill the amount of people the media said it would. Let me just say it's okay to make mistakes. We did not know what we were dealing with, and we did not have data available on this virus. Very poor decisions were made, and we all will see the effects of those decisions for years to come. However, it is not forgivable to realize that mistakes were made and to not acknowledge those mistakes. That is where the current state of the government is at. Governor DeSantis is doing a better job than most governors in acknowledging those mistakes. However, it is high time to amend the poor decisions and take immediate and decisive action to correct those mistakes. Giving into fear and trying to find some pointless public display of fighting a virus with a piece of cloth on your face is silly. It's time to get your act together, commissioners. My husband did not fight and die for our freedoms just to see our liberties be discarded at the drop of a hat and our lives turned into a political game. Use this Independence Day to take charge and lead our county back to unity and working hard and enjoying our God-given liberties. Stop the fear-mongering and get everyone back to work. Get our children back in school and get this town united in celebrating our independence. Our independence and freedoms were bought with the blood of patriots. If you haven't been paying attention, many in our county, our country, are trying to turn this crisis into a cultural revolution. If you do not help turn this around and get our small town functioning as a society again, and soon, we will lose.
From Nicole Ramirez, please vote yes on mandatory masks in retail stores, restaurants, schools, gyms, and public places when distancing is not possible. Masks make it safe to open and stay open.
Next comment, Alexandra Chase. Good morning. First of all, if today's meeting goes anything like St. Lucie County's did yesterday, I want to give you a huge thank you and appreciation to the commissioners for sitting through hours of false data, Facebook facts, QAnon conspiracies, and being yelled at by community members. This does not negate the good you do in our community. I wrote you last week urging you to vote on mandatory masks. Thanks for taking action. I have friends all over the country reaching out and asking, what is wrong with Florida? Last night I clicked on the interactive map that shows you county by county where hotspots are located and was shocked to see Martin County, my home that I love, lost in a sea of bright red among the rest of South Florida. Thank you for closing the beaches this weekend. I think it was a smart decision. My family had plans to visit the beach and go fishing on Friday and Saturday to celebrate our favorite holiday, the 4th of July. When we heard the beaches were closed, we thought, oh yeah, that makes sense, good. We didn't cry and moan and take to Facebook to curse the commissioners. We get it. It makes perfect sense and hope that some lives and lungs are saved because of it. Even well-meaning, intelligent, and cautious people can do something silly, like make plans to hit the beach on a major holiday. We are bored. We are Floridians. This is what we do on July 4th, but I'm glad the beaches are closed. The beach will not empty. There will not be thousands shoulder to shoulder and sharing droplets. It's easy to forget your mask if it's not required. My family wears a mask whenever we go. However, I can see why people feel they need to wear a mask since so many others are not as well. And for some reason, it's not an American duty not to wear one, whatever that's about. I don't think that 100% of residents will wear a mask when mandated, but I would wholeheartedly believe that most will. The people who are against masks are not the majority. They're just the loudest voice right now. I know you all will do the right thing for this community. Please ensure that all low-income individuals and families have access to masks during the mandated period. Thank you for your time, and have a wonderful holiday weekend.
From William Furpo, this is more about compliance and has nothing to do with safety. If masks worked, the virus would not exist in states where they have been mandated since early April.
From Carol Paprotna, please mandate masks be worn by everyone when in a public space, including grocery stores. The only exception should be if you are sitting at your table eating out. Even in restaurants, people who get up to use the restroom should have to put their mask back on.
Next comment, David Kalanis. First and foremost, I want to commend, we're going to cast that. I implore the county commissioners to do what is required by implementing a mandatory face covering policy that is enforceable and has teeth. The county commission should be following and implementing the guidance from qualified medical experts and not passionate grunts of the ignorant who spent 30 seconds reading an article on the Blaze or a post on Facebook about masks and an OSHA expert. None of this opinion, it's all rooted in scientific fact from the medical community and scientists. You all need to ask yourself, do I want to do the right thing and trust science and medicine, or do I want to defer to the ignorant of our community and allow them to continue to spread the virus unabated? I believe the choice is clear.
From Peter Skumanich, no mandatory masks. As a 72-year-old American, resident of Martin County and a retired deputy chief of police, I am appalled as to what is happening in today's society. Cities across this nation are in turmoil. There is chaos, destruction, buildings are burning, law enforcement is under siege, citizens are being physically assaulted, and leaders in these cities are not controlling this madness. My father fought in World War II to preserve our rights and freedoms against those who wanted to control the lives of millions of people. Thank God those forces were defeated. Many medical opinions differ on how to avoid contracting COVID-19. However, Dr. Anthony Fauci and Mark Siegel have indicated on television that masks do not completely protect people as they should, nor does ear loop masks protect against COVID-19 or other viruses as indicated in the labeling of the product. I am not downplaying the seriousness of the virus, but the differing opinions and opinions to treat this virus only adds to the hysteria and fear it has created. As the nation crumbles around us, you are deciding for the citizens of this community as to whether or not to mandate the wearing of masks for business owners and patrons as well. If a person wants to wear one, that is their choice. A mandatory wearing of masks in all probability is illegal. That will only infringe on our rights as a free people and is only one more step in eroding the rights afforded to us under the United States Constitution. As citizens, we have the right to decide whether we want to wear a mask or not. A mandate decided by only a few is not a democracy, and it would be an injustice to all Americans, respectfully.
From Hetty Bressler. First, I want to thank the board for extending the mandatory mask requirement to include patrons of commercial establishments such as restaurants and supermarkets. It is for the safety of everyone. Second, in light of the increase in COVID cases in Martin County, would the board reconsider the requirements for golf courses to again require golf clubs, to have each golfer ride alone in a cart, and to disinfect each cart prior to use? Thank you, Hetty Bressler.
No, next comment, Wendy Skinner. No mask requirement. This has gone far enough with an overreach of power enforcing in any state. People have rights, and some of those include things others may not agree with.
From Stephen McIntyre. To watch a patient suffer and die as they asphyxiate on their own secretions is a terrible sight. That they do so without the comfort of their families and loved ones by their side is a tragedy. The last days of these patients' lives are spent fighting for breath with a tube down the throat, alone in a sterile room except for the clinical staff treating the patient. May God bless the nurses, technicians, and doctors on the front line. This is the reality of COVID-19. It is the fate of many of our neighbors and maybe some of our family members. The question is, how many have to die this way? Much of what we know about COVID-19 is scientific fact. 1, it is an RNA virus spread through respiratory droplets. 2, it is highly infectious and can remain infectious on surfaces for days. 3, the source patient often has no symptoms. 4, vulnerable populations, elderly, immunocompromised, multiple comorbid illnesses, fare worse, but even healthy young people can be fatally stricken. 5, public health measures limit infection rates and save lives, quarantines, contact tracing, social distancing, and masks. 6, wearing masks substantially limits the risk of being infected or infecting our neighbors. No one has the right to unrestricted behavior, whether it is speed limits, stop signs, or the requirements for licensure. Our society seeks to maximize individual liberty up to the point it threatens the safety and liberties of our neighbors. Please make the right decision for the safety of our citizens, neighbors, and families and require the wearing of masks in public. Respectfully, Stephen McIntyre, MD, Chairman, Department of Medicine, Cleveland Clinic, Martin Health System.
From Jama McInnes, yes, I would like to see mandatory masks in all stores, restaurants, grocery stores, drugstores. If you want to go out, use protection. Open-air bars, shoulder to shoulder included.
Next comment, Christy Bullard. Kids need to get back to school. Studies prove that most children are asymptomatic or exhibiting mild symptoms and rarely infect adult populations. However, their social development is desperately at risk. Masks should be optional. For those people who have weakened immune systems or are at risk should by all means stay in, wear masks, etc. The majority of people must keep society functioning. Restaurants and bars are not the problem. If they are, then where were the outcries from violent protesters, rioters, and looters? Let's remember that the 98% survival rate of this virus and get back on with our lives. Herd immunity will only happen after the mass majority has been exposed and infected. That goes with this as well. A smaller minority of people who are at risk need to use proper precautions, not the entire population.
From Andrea Sickler. As a Martin County resident, I am 100% against our citizens being mandated to wear masks, face coverings anywhere. It is not the government's job to tell me how to keep myself healthy. There is scientific evidence that there are detrimental health effects to a healthy person wearing a face mask. If a person knows they are immune compromised or have a high risk level to diseases, then they can choose to protect themselves and wear a mask. Mandating the entire county to wear a face mask is an overreach of government.
From Barbara Abdu, please vote yes to mandatory wearing of masks by all citizens when in public places and spaces. The only way that I will feel comfortable patronizing businesses in Martin County is if the general public all wear masks. Please let us help one another live as safely as possible. Vote yes to wearing masks. It's terrifying to think about how flooded our healthcare system may become with the recent surge of over 20,000 new cases in the past few days. What if our healthcare workers just decided not to go to work because they're simply exhausted and you or your loved one needed care? We owe it to each other and especially our first responders to mandate the wearing of masks.
Next comment, Paul Laura. Dear Commissioners, I would like to indicate my concerns at the number of beaches that are being closed in Southeast Florida, putting more pressure during the 4th of July holiday to come to Martin County. The out-of-county residents seeking public beaches will increase the density of bathers on our beaches and potentially increase in the incidence of contagion. Would recommend, as Vero Beach has done, to limit the beaches to Martin County residents and also limit the number of Martin County residents allowed on the beach to preserve social distancing. Should there also be some guidance of wearing the face mask on the beaches? Thank you for your consideration of this request.
From Kurt Matney. By closing the beaches, you have deprived hardworking Martin County families an enjoyable beach weekend that we have been looking forward to for months. My wife and I have worked very hard during the lockdown period, and since others were let go, we have worked many overtime shifts. We haven't been able to have much time with our kids and definitely haven't had any beach days with our 3 young kids since the beaches have been opened back up. We finally have off for a 3-day weekend, and every single day we are off work, you have decided to shut down the beaches. This is outrageous. We are year-round residents of Martin County and deserve to be able to use the beaches. You have no right to close down our beaches. Can Martin County Sheriff's Department not handle parking control? When a parking lot fills up, there's no more parking. It's simple. And don't start with the excuse of people will just park on the grass because you can pay a few high school kids to stand outside the beach parking lot and make sure people don't park on the grass. This is beyond ridiculous, and you are stealing memories from my family and hundreds of other Martin County families by your actions. These are memories that we need to bring us together during these extremely difficult times.
From Jessica Berger, I believe masks should be mandated in public spaces at this time. They're not perfect, but they are the one tool we have against the spread of this disease that is taking off like wildfire. They're not practical in restaurants where people are eating and drinking, but retail stores, offices, etc., when groups of people are together, masks should be required. I work in the hospital, and things are far worse now than they were 2 months ago. This is one way we can help protect ourselves and each other. This will also help to assure we have hospital beds available for those who need them. We need to slow the spread. Excuse me. Thank you for your consideration.
Next comment, Melissa Stanley. It should be mandatory to wear a mask in public, period.
From Nancy Borrell, please watch, and then she submitted a link to a YouTube video.
From Barbara Billingsley, please vote to require masks in public. There is no reason to continue to risk lives for the inconvenience of wearing a mask. Thank you.
Next comment is from Maureen Roganinsky. As the people of Martin County, this is information from over 150 people stating that they are not in support of mandatory masks in our county. Recommendations from the public are accepted. However, unconstitutional mandates will not be tolerated. As the board knows, there are many counties across this country, quite a few in Florida, that are having lawsuits filed against them after attempting this overreach into civilian constitutional rights. This is bound to happen if this attempt to mandate masks is passed here. Please understand that we are for proper hygiene, public safety, and accurate data representation. The numbers that were shown in the beginning of this meeting even showed that vented patients have been steady, not increasing. Provide us the data of the COVID patients that were admitted for COVID, not for ones that are resuming elective surgeries and care that was put off for months due to lockdowns and now subsequently testing positive. Otherwise healthy people with no symptoms, cleared for surgery, and already in the hospital for inpatient surgeries are now being counted as COVID positive. There are many studies that are being refused to be acknowledged because they are against the agenda to control the population and succumb to media pressure and show that the inefficiency of face masks. The packaging of the mask even states that they're not to be expected to prevent COVID-19. Please stick to the recommendations and forego the attempt to mandate the people of Martin County wear face masks, and attaches a list of 150 names.
So I was just thinking, listening to this zoom through here, that whoever is doing the closed captioning, doing it this quickly, can we maybe pause in between just a little bit? I would think that, I can't imagine that person is keeping up with what's going on, so that's,
Do you
I
want
hate
us
to
to-
slow the process down, but,
Do you want us to slow down, or do you want us to pause in between them?
well, at least pause in the middle, yeah.
Okay.
So,
Otherwise, it's nonstop typing for that person.
yeah, I just,
Okay.
okay, now you can go.
From Stephen Hopkins, aside from the unconstitutionality of Palm Beach County's mask mandate, it is also ultra vires, which is Latin for beyond the powers. Let's get familiar with government's limited emergency powers under Florida law. Keep in mind also both state and local governments may not enact ordinances or mandates inconsistent with or violative of the Florida Constitution.
From Carol Ann Leonard, it's my opinion that the emergency order should be passed. I go out only as needed. I see many people wearing masks, but some are not. With the rising rates of the positive cases in Martin County and counties to our south, north, and west, it's not a question of our personal freedom. It's trying to prevent the virus from infecting ourselves and others. Per Dr. Fauci, we have a societal obligation. Face coverings should be worn by all persons in buildings open to the public. Face coverings should be worn by all persons in all public places where social distancing is not possible. This should include outdoors when social distancing isn't possible. An exception is when eating and drinking. Certain medical conditions may be an exception. Written proof from a doctor should be be mandated and shown to authorities as needed. This sounds strident, but it can prevent unethical use of the exception.
Next comment, Kim Kaza. OMG, are you kidding me? The healthcare people that we are to trust with our care are telling us to wear a mask, wash our hands. I agree with the gentleman that is for the mask on the board. We need to keep our economy going. Are you that are on the board against the mask willing to give up 90% of your pay to become a society that takes care of everyone equally? If more businesses go out of business, there will not be enough people paying into the system to take care of those losing their jobs. This is a temporary mask wearing, losing our economy because people are not wearing masks does not make sense. I am a Republican, I am a mother, and my kids who are over 21 are wearing masks and social distancing. I am a concealed carry person. I am willing to leave my gun locked up at home when I need to go to the store. We need to lead by example to keep our community as safe as we can. Please make this countywide to wear masks.
From Dr. Moti Ramgopal. Dear Commissioners, my apologies for not attending as my team of infectious disease physicians and providers are overwhelmed with the enormous number of patients we are seeing at the hospitals in our community. Presently, we do not have a vaccine, we do not have a cure, but we have masks and social distancing that can reduce the number of infections as we saw in April and May. Let's act now to reduce this transmission. Let's protect our community. COVID-19 infects everyone, not just the elderly, but the young and the working population. Those who survive now may not survive the next wave as the lung damage may be permanent. Let's act now. Thank you, Dr. Moti Ramgopal, MD, FACP, FIDSA.
From Carolyn Wexler. When a small gesture can create a huge return, why would anyone refuse to do it? By not requiring everyone to wear masks, you will be keeping many of us home. We will not be frequenting businesses unless they and other patrons are wearing masks. It is simply not fair to healthcare professionals who care for the sick to risk themselves by coming in contact with COVID patients so someone can demand their freedom by exhaling infected droplets on them. This is a no-brained. Require everyone to wear masks.
Next comment, Zach Teller. These are questions for Cleveland Clinic's Mr. Lord. 1, how many of the deaths in Martin County are from hospice and nursing homes? 2, what specific precautions is Cleveland Clinic taking to prevent positive tests from being submitted from the same person through tested multiple times? For instance, patients tested on arrival at the hospital and again during their stay. Another instance would be employees who test positive and need retesting before they come back to work and simply test positive again. These are questions for commissioners. 1, with so many reports of current positive cases still coming from our nursing homes, why is more attention not being given to protect our parents and grandparents in our own community? The test results from staff isn't returned for over a week, which makes the test pointless when the nursing home staff continues to work with the elderly during that time. 2, with multiple lawsuits springing up all over the state of Florida and around the country over mask mandates, what is the BOCC doing to prevent unlawful mask mandates and thereby lawsuits that cost taxpayer dollars?
From Diane Polachek. With the COVID positivity rate in Martin County over 20%, masks in public absolutely need to be mandatory. What are we waiting for? After all, there are laws for seatbelts. This is one of the few things we can do to protect ourselves, our families, our friends, and neighbors. Be on the right side of history. Make masks mandatory. It's really not that difficult to endure.
From Dawn Rowell. I strongly support the wearing of masks in public to help prevent the spread of COVID-19. Please do the responsible thing and mandate this action.
Next comment, John Neeme. Headlines from yesterday report the Texas governor halting elective surgeries in order to preserve hospital bed capacity for COVID-19. Floridians are now facing travel restrictions to such hotspots as New York. The number of cases in our area continues to rise. There are children as young as 5 months old being hospitalized locally for COVID-19. I have patients afraid to go out in order to have necessary testing and procedures done, for which some has resulted in significant worsening of their health. Yet, we continue to take no meaningful actions to prevent the spread of COVID-19. As for the direct economic effects, I hear consistently from my patients that they have no desire to go out to stores or anywhere else, especially due to the large number of people they encounter not wearing masks or social distancing. These citizens are therefore not able to contribute to the economic recovery so desperately needed by our local businesses. The county, along with the state of Florida, has mandated the requirement of frontline workers, such as those in supermarkets, to wear masks. We have stated previously that the main purpose of masks is not directly to protect the person wearing them, but more importantly, to protect those around them. There is no mandate for those individuals entering grocery stores to wear masks. If you acknowledge that these frontline workers must wear masks to protect the public, you are now negligent in not requiring the public to wear a mask to protect our treasured frontline workers. If we listen to every naysayer without proper consideration of the facts, we would all believe that the earth is still flat. The healthcare community has presented to you extensive information showing the effectiveness of masks in reducing the spread of the virus. Let us not continue to ignore the truth. The reality is the United States is falling behind the rest of the world economically, ethically, and intellectually by not making meaningful changes to combat this pandemic. You have the power locally to start turning this around. Be a leader and an example for others to follow. Do the right thing and mandate the wearing of facial masks and proper social distancing while in public by everyone.
From Jose Rivero, no mandatory mask, I cannot breathe.
From Christina Scomro, mandatory masks again, why are you just not going along with Governor DeSantis's phase guidelines? We have enough freedom taken away from us. Now we have to put up with the worry of people being the mask police. I have seen people attacking other people. I am 74 years old and so far have never felt the need to protest till today.
Next comment, Casey Darling Niffen. I want to start by thanking the commissioners for unanimously voting in favor of mandatory masks for employees in local establishments. This was an important start to limiting the transmission of COVID in Martin County. I encourage the board to continue to public health experts and mandate masks for all persons in public spaces where physical distance is not possible. The scientific evidence is clear on mask wearing being an effective measure to limit the community spread of COVID-19. Please do your part in curtailing the spread of COVID-19 in our county and mandate masks.
From Megan England, I understand the decision has likely been made before this meeting. I appreciate the time spent on hearing the hearts and voices of the people you represent. I want to implore our great Martin County to make decisions based on fact, not fear. It takes courage to stand when others run. Face masks are clearly confrontational. There is absolutely nothing wrong with an individual choosing to wear a mask. My concern is that too many are putting their trust in something that will not save them. It is far better for a healthy person to not have a mask on, thereby remembering to keep appropriate distance and wash their hands, than to trust a mask which is easily used improperly or has been proven to be of little value. By putting our trust in something that is ineffective, aren't we really making it worse? Do we really want to chase people down for not wearing a mask? Aren't we making it socially unsafe for those who can't wear a mask for health reasons? It just takes a bit of courage to say no. No mandatory masks for Martin County.
From Andrew Caton, wearing masks is not a political matter, nor is it a constitutional rights issue. It is pure and simply a public health issue. The positive test rate for COVID-19 in Martin County, as last reported for June 26th, is 22%. That is staggeringly high. It indicates that COVID-19 infections are widespread in this county and that resulting hospitalizations could overwhelm the county's ICU bed capacity. By every measure, we have a public health crisis. Wearing masks saves lives and prevents human suffering when everyone, not just workers, wear masks. Make it mandatory to wear masks indoors when in public and outdoors when social distancing isn't possible. That's a responsible decision to make, not a political one. Plus, it works. Thank you.
Next comment, Ashley Braden Knowles. Thank you to the county commissioners and county employees who during this extraordinary time are putting in many hours to resolve issues brought upon by COVID-19. As you consider a public mask requirement, please remember many who are in favor of it are not in front of you at this meeting, as they do not want to commingle with other residents making drastically different health choices. Because our faces are not in front of you, do not let us go unheard. I have been very disappointed in my fellow Martin County residents who have chosen to ignore medical professionals' advice to wear masks in public. I do not like the idea of government regulation. However, in this case, because of my co-residents' lack of prudence, I voice my strong support of an ordinance mandating masks in public. As a church-attending Christian, I ask this to include houses of worship. As a society, we have been praising and supporting doctors and nurses on the front lines of this pandemic. Let's show it in deed and not just words. Thank you for your time.
From Brandy Ross. How about you do something contrary to what you all have been doing for the past few months and listen to the residents of Martin County who elected you and not cower in fear of what T.C. Palm will write about you in the paper. The residents of Martin County deserve to use our beaches anytime we want. That's why we live on the coast and pay our taxes. We demand you open the beaches. If you are unable to represent the residents of Martin County, then you are welcome to resign. We will accept your resignation. And since you all have followed the lead of every decision Palm Beach County has decided upon the past several months, then there's no real point to keeping the unneeded expenses of your salaries.
From Kimberly Manzer. Please consider letting the public make their own choices regarding face coverings. According to OSHA, there is no effect. Let us keep our civil liberties. Please do not give in to pressure and make a decision that has no merit and will be impossible to enforce.
Next comment, Jessica Meisner. In regards to mandating a mask, me and my family will not comply. If this is truly mandatory masks about safety, then we should begin to mandate healthy eating, exercise, probiotics, gut health, sun exposure, go out in nature, laughter, and etc. Masks put the wearer's health at risk when worn for extended periods of time. My rights don't end where your health concerns begin. If you are at risk, population, elderly, or immunity infirm, do what you must to feel safe, but I will exercise my freedom to go mask-free. If that freaks you out, stay at home. My rights are not contingent upon your comfort level. I'm not for government overreach and mandating common sense. I see future lawsuits if you proceed with making masking mandatory.
From Cheryl Flint. So in the midst of the nation's most trying times and divisive attitudes, you commissioners chose to worry about a thin paper mask covering up people's faces and smiles and withholding us from going to beaches. Brilliant. You are all brilliant. There's not another holiday we hold to that unites us like Independence Day, and you all shut it down. No fireworks, no beach, no sports, no weddings. And don't think it's any excuse that the city of Stuart is typically in charge of fireworks. You all could have easily organized fireworks in Martin County, but you were too worried about cars parking on the grass at the beach. Each and every one of you is simply brilliant. Do none of you realize that families are hurting? We all know that none of you are affected financially by these shutdowns and economic oppression. How about you all stop receiving paychecks from now on, and then maybe you'll start making good decisions? How long do you think normal residents have been waiting in anticipation for Independence Day? We have had the worst year we can remember with some of the most trying times in our lives, and you commissioners decide there's no need to put any effort, zero effort, into giving back to residents just a little hope for the future and something that can unify us all. You have failed us.
From Linda Bienvenue. Please mandate masks in all public enclosed spaces. Encourage masks in outdoor spaces when social distancing not possible. Please close Martin County beaches for the July 4th holiday weekend.
Okay, hold that, George. We had said an hour, and then we're going to do 5 minutes for the closed captioning. Yeah. So to give the lady typing or whoever typing right now a break and to get caught up, we're going to take a 5-minute break. And we'll do that every hour.
Laura, how many do you have left?
Pardon?
How many emails do you have left?
How many do I have?
Mr. Chair, next comment, Maureen McNally. I would rather wear a mask than have the county go back into shutdown. We are heading in the wrong direction. With the increase in positive infections, our numbers are rising significantly. And other than staying home, this is a small inconvenience to save our economy and many lives. Too many restaurants and stores are needing to close due to infections. Counties around us have taken a stand to protect its citizens. It's time for Martin County Commissioners to do the same, put politics aside, and listen to the good medical professionals. God help us if you don't.
From Ann Parker. Wearing a mask is a personal choice. You don't get to tell a healthy person what to wear on their face. I don't do well with it on, and I panic very quickly. This is America. We are about to celebrate freedom this weekend. Please do the right thing.
From Myra Mazzano. In these troubling times, I urge you to make mask wearing in public mandatory to protect us all and lessen exposure. Older residents and healthcare workers deserve our respect. Thank you.
Next comment, Barb Twig. I am vehemently opposed to mandatory masks in Martin County. Businesses, schools, stores, and the general population can and should be required to make their own decision. Mandating anyone that goes against our freedoms, please do it that you uphold our constitutional right to freedom.
From Carol Rosado. By closing our beaches, you are doing absolutely nothing more than hurting Martin County families. Only a lunatic would think beaches being closed could help in any way to the prevention of a disease. Did you not get enough negative attention the first time you grossly overstepped your boundaries by closing the beaches and you felt like punishing residents again?
From Laura Hayden. Please make wearing a mask in public the law. Make it mandatory to wear a mask. Protect Stewart.
From Nanette Longman. Why are you not speaking to OSHA about how masks are highly harmful? The 95 masks only work on the inhale. When you exhale, you are spewing it all out of the mask. The blue masks that everyone are wearing are for sterile environment. It's against the Constitution and my ADA rights. I am a claustrophobic.
From Sean Witten. 1,000% no on mask mandates. I just learned that the data being shared on the county site reflects cumulative cases. I also found out that people who have tested positive are tested again, then added as a new case, yet it is in fact the same people. This is outrageous. False numbers create undue fear in our community. Post only active cases and hospital admissions, or don't post at all. The numbers are misleading. How can you make accurate decisions when you don't have access to real numbers? Hospitalizations look extremely low. I have not seen any spikes. There is no need for any more tyranny.
From Stanley Hayden. Masks are essential in slowing the spread of coronavirus. Please vote yes.
Next comment, Amy Pritchett. Healthy people do not need to wear masks. Please consider all people, not just fearmongers.
From Patricia Calhoun. Did you commissioners think that by voting to close beaches behind closed doors that you would somehow avoid the outrage by Martin County families? Not all of Martin County is made up of scared retirees who haven't ventured outside in the past 4 months and haven't gone to the beach in years. This is outrageous, and you will never live this down. If you and the Martin County Sheriff's Department cannot do the job that we as residents expect and pay for you to do, then you may step down. Especially Commissioner Sarah Hurd, who has not been in favor of the rights of residents. I have to skip that, right? Yep.
I forgot, that's fine.
From Julie Fisher. Please vote no on mandating masks for Martin County.
How is it you get the one-liners?
Yeah, really.
Were you the one that like separated the three
Yes,
files?
I selected them all.
Smart girl.
Next comment, Ann Wolpert. Good morning, Commissioners, and thank you for your time. I have followed every meeting regarding the COVID-19 from the beginning, and I know that you are tasked with many challenges. Personally, it boils down to one thing and the one thing only, and that's safety of our community. It's your job to make our community as safe as possible, and not your job to please everyone or to make the wrong choice out of fear of public backlash. You have heard for weeks from our doctors and local health department, and those are the opinions that you should be listening to, not the opinions of armchair epidemiologists and not YouTube doctors or know-it-alls. The medical professionals globally and locally have said over and over and over again that the best way to tackle and slow the spread of COVID-19 is by wearing masks in public places, social distancing, and avoid large groups. It's very simple, and yet this has been dragged out and debated for far too long. The time to act is now. If people want to choose to not wear a mask, then that's fine. They don't need to go into public places. But for those that will comply and want to get back to life, we will make the small sacrifice of using a cloth covering over our nose and mouth. It's just not that big of a deal. If a medical issue prevents one from wearing a mask, I would say it's safe to assume that the person should not be exposed to the virus, period, and shouldn't be out in public during a pandemic. I have watched coworkers die from this disease, and have also known many sick with COVID, and I can tell you this is not the flu, and nobody wants to go through this. It only makes sense for you to mandate that all Martin County wears a mask in public dwellings. If our hospitals become overrun with COVID, what happens then? Until these people crying about freedoms being lost have more concern about losing what they feel is a right or choice, actually lose someone close to them, they just won't get it. And it's not your job to appease them or to make them understand. It's your job to make Martin County safe. Pediatric cases are climbing, kids are on ventilators, and the same ones crying over rights will be the same ones crying when schools can't safely open. This has gone on long enough. Mandate masks now.
From Harley Stevenson. Let me ask you something, esteemed commissioners of Martin County. Are you prepared to use taxpayer funds to defend an unconstitutional mandate of forcing the public to wear masks? Because I will personally be funding and filing a lawsuit against your unlawful mandates. I don't have a wife. I don't have kids. I have a lot of money and will spend it any way I please. I'm mad and I'm going to sue, and I'm going to enjoy it.
From James Powell. First of all, I can't even believe that in my lifetime that we would be discussing how much the government is infringing on our personal freedoms. Are we still living in the United States of America? It almost seems as if we're talking about Russia or some other country of extreme government intrusion. I'm asking each of you to carefully consider your vote and how much you overstep your bounds in government regulation. For each medical expert you have to support mandating, I can find a medical expert that says building immunity is important, so don't require masks. It is obviously showing that herd immunity is what is needed and is working. It's a virus, so immunity works. God made our body an incredible thing, so I really don't desire to get into this tit for tat. What I want is to address our freedoms. I ask you again, do we still live in the United States? We have had our churches shut down, businesses limited to allowing only so many in their stores, all because it came from CDC, WHO medical experts that supposedly know what they're talking about. Depending on who you listen to, when you listen to them, masks were not needed or COVID wouldn't be an issue. Then, all of a sudden, it's a big deal supposedly. Dr. Birx, within the last month, just stated she feels the numbers of cases are inflated by as much as 25%. Again, we can all find an expert to support our desires. To remind you, Florida does have an anti-mask law. It was originally for protests, KKK, etc., but the law still stands specifically into any state or county-owned property. Florida Statute 876.13 declares that no person or person shall in this state, while wearing any mask, hood, or device whereby any portion of the face is so hidden, concealed, or covered as to conceal the identity of the wearer, enter upon or be or appear upon or within the public property of any municipality or county of the state. So basically, any public property owned by Martin County. The problem this places on you is the preemptive law in Florida states about a lower power can't override a higher power. Again, I'm asking you to have trust in us as individuals. So I go back to freedom. Why not believe in the people you represent and let them choose? Remember, you're working for us. Also, we will remember in the next election, where you're up for a vote. Vote no to mask mandate, a deeply concerned citizen.
Next comment, Elizabeth Buttless. I have grown up in Martin County and have had several businesses, and my father being a doctor in this town for 45 years. My concerns are about mandates on masks. I suffer from chronic inflammatory lung disease, and to wear a mask puts me at risk. Passed out and hit my head within 20 minutes of dealing with this absurdity. I see the very bottom of the mask, it states, at the very bottom of this mandate, it states for someone with lung conditions and so on are exempt. But then there's the mask shaming. Also trying to work so I can pay my bills after being shut down for 2 months, being called non-essential. This is an infringement on my constitutional rights. People should have the right to make their own choices. For those of you who are afraid that they should just stay home, I, on the other hand, will not live my life in fear. Yes, be careful. Yes, pay attention. As I always have been taught by my wonderful, brilliant father, how to sanitize and stay safe. Suppressing everyone doesn't help the path of any virus. Things have to run their course. More people become sick from all the stress that has been brought on our town and our nation to ruin livelihoods, like myself and many others, is an outright crime. I wonder how some can sleep at night knowing lives are being destroyed. I don't get to work from home and get paid regardless. Please allow people to make their own choices on the mask scenario. We have a right as Americans.
From Brian McLaughlin, I do not believe masks should be made mandatory. Doing so will encroach on our rights. They are placebos and will not prevent the spread of COVID-19. It is an infectious disease and will spread despite any mask mandate. Even if required, their use is impossible to enforce, and enforcing a masks via fines or jail is an abuse of power. Mandating masks will prevent schools from operating and opening, and nearly every working parent is not able to both work and teach their own child.
From Cindy Edgett. I am asking for you to vote no on mandatory masks for Martin County. To begin with, the stats do not warrant mandatory masks. Do not warrant mandatory masks. Martin County has a population of 161,000 people as of July 2019. I believe that number is higher, but that is the most recent number given by government. As of yesterday, MC had 1,979 cases since the beginning of COVID in October, with 25 deaths. That's 0.013% of our county's population. Yet the CDC says that the flu season running from October 2019 to March 2020 caused up to 62,000 deaths nationwide. I am not minimizing the deaths in Martin County because 25 families' lives are changed. I get that. But how many more lives and livelihoods will be destroyed because of this decision? Many people are out of work because of the restrictions on businesses. Now you want to make more? Are you trying to destroy the economy that we are trying to put back together? The stats do not warrant making masks mandatory. Secondly, the CDC has just admitted that less than half of the antibody tests are correct, which brings our numbers significantly down. The death rate has gone down, not up. The hospitalizations are going down as well, and patients entering are coming out within 2 to 3 days, not weeks. The cure rate for COVID-19 is 99.2%. The virus has weakened, says scientists. It's now almost July. July and August are extremely hot, too hot for the virus to take over like it did, and people are overheating from Florida sun and heat, and you want to throw a mask into the situation that has the wearer breathing their own carbon dioxide. I personally had the flu in February for a month. Guess what I did? I stayed home. Common sense. I went out for the first time after being sick and wore a mask. I went into the grocery store with a mask on. I was there for almost an hour shopping. I felt lightheaded, felt as though I was going to pass out. I was sick feeling the rest of the day. That's only wearing the mask for 1 hour. It has been scientifically proven to not be safe for the wearer. And finally, I'm asking for you to vote no on mandatory masks for Martin County because at the least this is political. If protesters get a pass, why in the world would you restrict your hardworking constituents by imposing a mask order? Then what are you going to do about the people who cannot wear a mask? As this is political, I know that voters are paying attention to who is voting for and against these rules, and it would be reflected in the next election. We vote you in to work for us, not against us. If people want to wear a mask, let them. but certainly don't make it mandatory, especially when Governor DeSantis said he would not. Please stand up for the citizens of Martin County, not the politics of the day. Be the leaders that bring growth and prosperity to Martin County, not financial debt and loss of great potential income, as the summer is the best time for tourism. Please do not vote for mandatory masks.
Next comment, Becky Bazzelli. It has been proven that wearing masks compromises the health of the mask wearer. Oxygen levels drop dramatically. Bacteria grows in the mask, creating a perfect environment for mold. We are destroying our upper respiratory systems by mandating mask wearing in public. N95 masks are the only effective masks that should be used for short periods of time and should be disposed of after every use. Anything else is false security and just breeding ground for bacteria.
From Sonia Peace, MD. As the Chief of Quality, Safety, and Patient Experience for the Cleveland Clinic, Florida, and a local anesthesiologist on the front lines at Cleveland Clinic Martin Health, I speak for our caregivers in support of universal masking. We must continue to flatten the COVID curve. We must protect our at-risk population. We know scientifically that wearing a cloth mask lowers the risk of an asymptomatic person spreading the disease. We are in this together. We must protect each other together. We need caregivers to care for patients. We need patients not to be afraid to seek care. We need businesses to open responsibly and put customers first by protecting them like we do for our patients.
From Nanette King, request for, again, another walk-in or walk-up COVID-19 test site for patients meeting the new rules requiring 72-hour COVID-19 tests prior to surgeries and medical procedures who do not have transportation to go through the drive-through testing sites. ASAP, needed walk-up COVID-19 site at Federal Highway and Cantor Highway, intersection in the large parking lot where all the Marty buses have stops and transfers. I need George Stokas to read the letter I've drafted to the county commissioners. Understand we need this ASAP, and I am one of the patients whose doctors are trying to get me tested to perform medically needed surgery and procedures on, as well as the multitudes of other Martin County residents who have underlying illnesses and diseases that need procedures, yet are unable to go through the drive-through 72-hour COVID testing sites. Just one loss of life, and the county is liable due to their inaction. Contact me ASAP. Sincerely and respectfully, Nanette King.
Next comment. Rachel Walker. The Martin County Commissioners have overstepped by mandating that workers at restaurants, retail stores, and grocery stores wear masks. The business owners should make that decision for themselves whether or not they should wear masks. It is their own private business, and they should make decisions for themselves. If someone feels that wearing a mask protects them, then they can wear a mask. That is their choice. If someone doesn't want to go to the store, into the store because they feel unsafe, they can stay out and wear a mask, like they all have been doing. I find it very angering and outrageous that the Martin County Commissioners think they have the power to mandate mask wearing for these businesses. That is something a king would do. Commissioners are not kings. Commissioners cannot mandate something like that. It is not in their power to do so. I am asking that you do the right thing and talk to other Martin County Commissioners and take back this mandate. You have gone too far. Now you are talking about making it mandatory for all people in Martin County? You better vote no, or you will be voted out. The people of Martin County will not stand for this mass control over the people you're trying to exercise. You have no authority to mandate masks for anyone. That is unconstitutional. This is about protecting people. This is not about protecting people. This is about control. If this was really about protecting people's health, you would mandate healthy eating, exercise, and sunlight exposure, but you obviously cannot mandate these things either. Again, that would be unconstitutional. I will not stand for this, neither will Martin County residents. It is not up to commissioners to decide what is best for me and my family. That is my decision. My freedom does not end where your fear starts. Thank you for your service.
From Dean Forster. Will eye protection be mandated as well? All of our eyes have exposed mucous membranes. Viruses are commonly spread this way. Do you see how silly cheap masks are yet? We are being programmed by media outlets to believe fear is a virtue. The human body has a wonderful immune system. Please vote to keep masks optional.
From Jacqueline Collins, the mask mandate is clearly an issue that is dividing our county, and to mandate masks would be catering to one side of this argument. People still have the choice to wear a mask, much like they have the choice to choose what food to feed their families, what doctors to visit, their activity levels, and so on. This is the land of the free. It's discouraging to see people at the grocery store wearing masks, but filling their carts up with the processed sugary foods that feed sickness and disease. But that is absolutely their choice, even though I may not agree with it. I am responsible for my health. That is not the government's job. I invest so much time and money into keeping my family well that I will not feed into other people's fear. It is my choice to not wear a mask. Please, as the people who we trust to be looking out for our best interests, protect our rights. Thank you and God bless.
Next comment. Lauren Daddario. I am writing on behalf of my family to ask that, in light of the continuing record-breaking spikes of confirmed viruses in our county, the Commission pass a resolution like that recently adopted by Palm Beach County, requiring everyone, not just employees, to wear masks in all indoor spaces, open to the public and outdoors where social distancing is not feasible, with limited exceptions. We understand the argument for some people that wearing a mask should be a personal choice. I would concur if these people only put themselves at risk by not wearing a mask. However, that is not the case. The scientific community has found at this time wearing a mask is the best way to prevent passing the virus onto other people. It has been estimated that over 33,000 lives will be saved in this country between now and October if people would only wear masks in public. As our elected leaders, we ask the Commission to protect residents before the situation gets even worse than it is. Discussion of the next step at the June 26 special meeting was promising. Please recognize the urgency that this situation and that adopt a resolution along the lines of that passed by Palm Beach County today. Thank you.
From Mary Robinson. Have any of you gotten out among the residents and asked the employees who are mandated to wear masks for an entire shift what their experience is? I'm not talking about the people who wear a mask for 15 minutes in Publix and rip it off as soon as they exit. You do realize that the emails you're receiving are from retirees who venture out into Publix a couple times a week and are outraged that they witness maskless persons. Then they get back into their Buick and drive home to their air conditioning and don't care one bit that the employees that help them with their errands have to work like slaves in the summer heat and sweating in their mask until it's soaked and their faces become raw. Or have you not given that any thought?
From Jana Burnett, please keep beaches open.
Next comment. Tanvir Chaudhry. Dear County Commissioners, I am a local anesthesiologist here in Martin County. I am pleading with you to please pass the bill to enforce that the public wear masks to protect our community. With the cases rising daily, locally, this is our window to make a change that can impact the spread in our community. We have to take action before our hospital system becomes overwhelmed. I am here to serve our community and care for the sick, but the people in our community need to do their part to protect our elderly and vulnerable. Please pass this bill. Thank you for your consideration.
From Amy Smith. I have lived in Martin County for over 30 years and have seen it grow into an amazing, charming community that I was thrilled to call home. I am disheartened at the alarming growth of COVID cases in our county, and I'm deeply concerned about the economic impact this is having on our local businesses as well as the strain on our healthcare system. My husband and I used to dine out several days a week and shop downtown. We no longer feel safe doing so. We are healthy but have seen the devastation that this disease is capable of. I understand that there is opposition to a mask mandate for the public and have seen the viral videos of individuals berating their local officials for trying to protect them. I know this is a difficult decision and enforcement is a challenge. Hundreds of municipalities have figured it out. There is no vaccine and no effective treatment. Masks are the only intervention that we have. Recent studies have shown that transmission is reduced significantly if everyone wears a mask. I know you believe in science. No one likes wearing a mask. They are hot and uncomfortable. We all need to do the right thing to get through this. It's not that difficult. Please pass a mandate requiring masks for all in public places. Be on the right side of history. Thank you.
From Sean Froling, please protect the rights of individuals to choose for themselves where and when wearing a face covering is beneficial for their individual health. Please consider, 1, breathing the same air increases carbon dioxide and can lower the immune system, which in turn leaves a person more vulnerable to catching an illness. 2, the CDC gave 6 recommendations. Face covering under certain conditions is only one of them. Imagine if we policed people for not sanitizing their hands or cleaning their car door handles. 3, policing such a mandate is untenable. And 4, this is a dangerous step toward the slippery slope of government overreach.
Next comment, Rachel Boland Perez. Unfortunately, the COVID numbers are getting out of hand fast. And since what we are doing isn't working to slow the spread, we need a much more conservative approach to protect our residents. The proper wearing of a mask is to reduce your own droplets, possibly containing COVID germs, from spreading past your mask. It is not intended to prevent others' germs from getting to you. To better understand this, think about the people wearing masks in a surgical suite. The physicians, nurses, and staff wear masks so their germs don't contaminate the patient. So wearing a mask is to benefit others, and them wearing it is for your sake. When I wear a mask for more than a few minutes, it becomes quite damp from my breath and talking. This means those droplets stopped at my mask, and they aren't transferring to other people. I have seen several recent sources say that an unmasked COVID patient in contact with a masked healthy person has a 70% transmission possibility. However, a masked COVID person in contact with an unmasked healthy person only has, a 3% transmission possibility. Sorry. When both sides are masked, it reduced down to 1.5%. This is how we make a difference in the spread of COVID. It's also important to note areas that have left the mask option as strongly encouraged have had a significant, to the tune of 80% new cases, increasing in COVID counts, including Martin County. And an area that has mandated masks has seen a reduction in new cases. Martin County went from 10 deaths through late May to 25 deaths in the last 6 or so weeks. That's more than double the amount of deaths in a fraction of the time. Math, science, and historical data should be factors driving this decision process, and not the opinions of people who have no credentials and aren't willing to inconvenience themselves temporarily for the greater good of our community. All the infectious disease and medical experts agree masks are a critical component to reducing new case totals in addition to social distancing. The majority of people complaining that masks do nothing are the people who really have no factual data or credentials to speak of and are not versed in this topic. Please make mask requirements in all public indoor areas, regardless of social distancing, and in public outdoor areas where people cannot social distance by more than 6 feet. By waiting any longer to do this important step, in protecting your constituents, it is a liability in and of itself. You are concerned with being sued for requiring masks, but it may be wisest to be more concerned about lawsuits stemming from not enacting this sooner, as neighboring counties have done.
From Jason Stabley. As a medical professional in this community, I kindly urge you to vote for the health and welfare of the community that we live and work in by requiring mandatory universal masking. This is probably one of, if not the most, important decisions you will make in your role on the Board of County Commissioners. This is not a choice between allowing or restricting the freedoms and liberties of our citizens. This is a choice of promoting health and life over the spread of disease and death. Please mandate a proven method that helps to prevent the spread of the COVID-19 virus now before it is too late. Each of us needs to take personal responsibility to reach the goal of reducing the expanding spread and ultimately containing and eradicating this virus within our community. But without unified leadership from you, we will fail. Our ability as caregivers to deal with this disease in an effective manner will not happen without a concerted effort from you. Thank you for your commitment to Martin County and to our local healthcare providers. Jason Stabley, DO, neurologist, medical director, neurology, Cleveland Clinic, Martin Health.
From Vincenzina Colaro Jackson. I am voting for no mandatory masks. It was proven that it does not protect us from the virus. It should not be mandated. It should be an option. Oxygen levels are also lowered when wearing them, which can cause more issues.
Next comment, Andrew Harris. I wrote to you individually a few weeks ago regarding the wearing of masks by food service workers, and etc., and commend you for your recent action. Your concern and response to this public health crisis is a breath of fresh air. I write again with regard to urgently use your powers to impose mandatory wearing of masks by all persons when out in public. There is clearly deliberate and blatant disregard for social distancing in environments that carry the most risk. My request is for you to focus on the majority, not the vocal minority. People are free to behave as they choose in their private homes. In public, we need to be courteous and respectful of others, which at this time includes wearing a mask. We have asked workers of all kinds to wear masks to protect patrons, patients, and clients. And now, we need to protect them by mandating public mask wearing. When our numbers have improved, this mandate can be revoked. I can assure you that the inconvenience of wearing masks is substantially less than the inconvenience of breathing with the aid of a ventilator. Be on the right side here once again.
From Jamie Stokes. I wanted to say from the bottom of my heart, thank you. Thank you for choosing for me to wear a mask and to not celebrate Independence Day. I have never enjoyed personal liberty or freedom, and I'm glad you all have removed the ability of our entire county to celebrate as well. It's a dangerous path to more and more freedoms. We have a wonderful blueprint from more advanced countries such as China and Russia and North Korea on what individual liberties should not include. And it's finally time for our local leaders to acknowledge that personal liberties are dangerous and should be abandoned. Thank you for canceling Independence Day once and for all.
From Christine Hurl. I support Governor DeSantis in not having to wear masks. They should not be mandatory in Martin County. Thank you.
Next comment, Pam Arthur. The number of people in Martin County who have COVID-19 has been skyrocketing. The latest information I have seen says that 1 in 83 people in the county have tested positive for the virus. As county commissioners, you must put the health of your constituents first and foremost and vote to make face masks mandatory for everyone in the county. My husband has worked in healthcare for over 40 years, and he and his colleagues stress how important it is that everybody wear face masks. I have always patronized locally owned businesses, but I have not done so since this pandemic began. Now, I order everything online and have it delivered. If it was mandated that everybody wear face masks, I would feel safe shopping downtown Stewart again. I have talked to many, many, many friends who feel the same way. I do who won't shop locally, own stores the way it is now. Please do the right thing and vote to make everybody wear a face mask. It will be better for the health of Martin County residents and also the local economy. Thank you.
From Richard Grodzinski. I saw Kyle Green speak about using face shields as another option over using masks. I think this is a great way to show the creative spirit of our local business owners. Our local business owners don't want to make people sick or kill them. That's just bad for their business. Whoever they also don't want to have police their patrons and violate HIPAA laws by finding out which ones are exempt. Find the businesses that are not taking any precautions, but let the ones that are using precautions continue to operate without masks if they choose. I'm sure most of them would be willing to compromise and post a sign in the door stating if masks are mandatory in their business and what precautions they are taking if they are not forcing the public to masks. Again, please don't force masks on everyone.
From Julia Garcia. As a resident of Martin County, I respectfully ask that you make it mandatory for everyone to wear a mask while inside of any public space. As a mother of 3 young children and the spouse of a physician at Cleveland Clinic, I have concerns on many levels. For one, I want my kids back in school. They enjoy going to school and miss attending classes with their friends. I was asked to serve on the school district's parent task force for determining when we can return to school. It is clear that we will not be returning to a normal schedule when school starts back up in August. My concern is that schools may not be able to be held in person at all because, according to their decision tree, a substantial spread in the community will not allow any students to return to the classroom. At this point, unless more is done to prevent the spread in our community, we may reach that substantial spread before school begins. If we put measures in place today, we could cut down on spread and thus allow schools to open with measures put in place to limit spread in the school. My second concern is for my husband and the other staff at Cleveland Clinic. Are there currently enough beds to handle an increase of patients being admitted for COVID-19? Yes. But do we as a community want to get to the point where we are turning offices into hospital rooms to handle an influx of patients because of COVID-19? No. Not only could that increase more hospital staff contracting the virus, it would increase undue stress on them that could cause them to break mentally. Did you know that physicians are committing suicide at alarming rates? It is heartbreaking to hear the stories of people having to die alone without their family by their side because of how contagious this virus is. As hard as it is on the families, believe me when I say it is hard on those who have been charged to care for these patients in the hospital. My husband carries his grief well, but I can hear in his voice as he recalls a patient's story, the sorrow and sadness that they left on his heart. I fear for the mental health of the nurses, doctors, and other hospital staff if, God forbid, our hospitals begin to be overwhelmed. I thank you for your consideration on this matter and doing what our federal and state officials have failed to do. Please know that I and others with whom I have spoken see how they have put you in a position to be the bad guys instead of them. Please make it mandatory for the citizens in this county to wear masks while inside of any public space. Thank you for your time and mental energy you are putting into this. A concerned citizen, mother, and wife, Julia Garcia.
Next comment, Brian Arthur. For the health of Martin County residents, you must make wearing a mask mandatory.
From Ray Oxford. Instead of keeping the beaches open and residents setting off fireworks on the beach like usual, people will now be setting them off in their neighborhoods. The potential for injury and accidental fires will be much greater. I was a firefighter in Martin County for 20 years and cannot count the number of fireworks-related injuries and accidental fires our units have responded to. However, not once have we ever responded to fires starting on the beach from fireworks because there is nothing to catch on fire. But with BOCC closing the beaches, go ahead and count on there being multiple accidental fires from fireworks this year. And remember, all across the country during the month of June, complaints of fireworks have increased exponentially. Fireworks sales have skyrocketed and already surpassed any other year. Due to the county and city not scheduling a designated display of professional fireworks as we have every other year, there are bound to be a record number of residents setting fireworks off on their own. Also, I'm one of those residents and probably one of the few safe ones. I spent $1,000 on fireworks on Tuesday and had planned on using them at the beach. Now I am going to be setting them off somewhere creative instead. Your actions have unintended consequences that you are not considering. Good luck.
From Beth Castle. Please make face masks mandatory for our county. The numbers are soaring, and our community and our children are going to suffer if the numbers continue to rise.
Next comment, Rich M. With regards to masks being mandatory for consumers, if you are even considering this seriously, do not put the enforcement on the business owners and if you are in employees. What you do is put them in danger. This is obviously a hot topic with emotions running very high. Do not make it up to a young employee or employer to tell someone that they must wear one and deal with the possible issues that come along with it. This can be dangerous and has been seen throughout the country. You will not be on the receiving end. They will. I am speaking from 30 years of retail experience. It's hard enough right now. Thank you.
From Bryce Stevens, vote no on this order. If you have to pass this, please exempt the schools and also children. Kids are extremely low risk for this disease. Thanks.
From Stevie Martin, I write to voice my support to the proposed rule mandating that all patrons in public places follow CDC guidelines and wear a mask. A team led by Dr. Christopher Leffler of Virginia Commonwealth University studied COVID-19 mortality and mask usage by the public in 169 countries and found that per capita mortality rate increased by 43% each week for countries that did not have widespread mask usage. Per capita mortality increased by just 2.8% for countries that had widespread mask usage. This pandemic should not fall on partisan lines. The virus has no affiliation. In the face of irrefutable research and data, unfortunately, people have shown us that they will only act when they are personally affected. Masking is encouraged because the evidence shows that people are the most infectious right before or at the onset of symptoms. That's why, that's part of what makes this pandemic so hard to get a handle on. You could feel totally fine, but you're exposing everybody to your infection, which is why we want people to wear masks all the time, to protect others from you, not to protect you from others. Economically, it makes sense to mandate mask wearing. A recent study by Goldman Sachs found that a national mask mandate could save the U.S. economy $1 trillion. New research suggests a national mask mandate would slow the growth rate of new coronavirus infections and prevent a 5% GDP or $1 trillion loss caused by additional lockdown measures. If a face mask mandate meaningfully lowers coronavirus infections, it could be valuable not only from a public health perspective, but also from an economic perspective, because it could substitute for renewed lockdowns that would otherwise hit GDP, the researchers wrote. We all have a duty to wear masks and stay home, but we cannot depend on citizens to be our main defense against COVID-19. As our elected officials sworn into office to represent the best interests of the people, I'm asking that you support this rule.
Next comment, Tricia Konopelko. As you sit in the seats for county commissioners, I hope you take into consideration that you are our voices. Those of us who have had kids home since March, those of us who have not gone out with friends, those of us who have had people at home with health issues are counting on you. Those of us doing the right thing are counting on you to help control the spread of coronavirus and one day get us back to a point where we feel safe. Please make mask wearing mandatory.
From Seth Williams, vote no on mandatory masks for the public. It's not practical, and the police will have no way of enforcing this. In Miami, everyone is tattling on everyone. Is that what we want here? This will fracture our county even further. Please vote this down.
From Rachel Baker, I do not agree with the mask mandate. I believe masks do more harm than good. I have to wear a face covering all day at work, which gives me headaches from the lack of oxygen. I also believe that we have healthy immune systems that work for us. We are hurting our bodies by not letting them be exposed to things. I also believe the masks should be the personal choice of each person with regards to how they feel about their immune system reflectively and their own impression of their overall health.
Next comment, Debbie Thornley. Please close our beaches for the 4th of July. We don't need to have everyone coming up here from southern counties or elsewhere crowding the beaches this weekend. Thank you.
From Heather Rogers, my family and I have been in our home since early March. In our zip code 34997, We will most likely hit a 1,000 positive COVID constituents by the end of this meeting. You are the leaders of our community. I have watched meeting after meeting, and with the common denominators from doctors and scientists' message being to wear a mask. It is that simple. Wear a mask. We are fighting a virus that we learn new facts about daily. By wearing a mask, we can actually save and protect people's lives. The thought of sending teachers, staff, and students back as numbers continue to climb is sheer insanity. As I look at the dashboard to the south and north of us, the hospital beds are filling up. We don't have testing for children easily accessible, and we don't have the resources to care for our community members as our numbers continue to spike. You were elected to lead, and thus far you have failed in this pandemic. I am asking you today to make decisions that support science. Our lives depend on it. Thank you for your time.
From Ellen Lambiasi. Thank you for your decision last week to mandate the wearing of masks by the public. One step in the right direction for the greater good of all. Now comes the part where you need to see that it is adhered to and give businesses the support they will need to avoid altercations, and lawsuits. Might I suggest at the very least that these things will be addressed? A sign be prominently placed at the entrance stating that masks are required and no one will be admitted without one. Disposable ones can be provided at the owner's discretion. Secondly, a fine structure should be put in place as is elsewhere for noncompliance. Thirdly, a dedicated agent should be assigned to field questions and accept reports from the public of noncompliance. Thank you for your service.
Mr. Chair, it's been approximately an hour. Do you want to take a break?
Actually, you got 10 more minutes for an hour.
Okay, very good. I'll keep going. Next comment, Nicole Ferguson. As a resident of this beautiful county, my family and I are kindly asking the county to keep the beaches open for the holiday weekend, and if any restrictions, to keep open for Martin County residents and guests visiting with accommodations on the islands. My family appreciates any consideration regarding this request. Again, thank you for your service to our beautiful county.
From Sarah Kensington, please vote no on mandatory masks. I'm a single mom and my kids are 2, 5, and 8 years old. All three are over 2 and would have to wear masks due to your executive order. They would pull them off so fast and I can't chase all 3 at once. I would just have to stay at home from now on. Please don't make this impossible for me.
From Alice Walker, mandatory wearing of masks needs to be enacted and enforced now throughout Martin County. This mandate needs to continue indefinitely until the pandemic has passed.
Next comment, Jessica Della Pietra. Beaches should close for the 4th of July weekend. Otherwise, our county beaches will be packed with people from the counties with closed beaches. It's best to stop the spread of COVID.
From Stephanie Van, I believe it's Slyke, S-L-Y-K-E. Vote no on mandatory masks. There is no conceivable way on earth that the sheriff can police everyone with this. This is not enforceable at all.
From Barbara Warren, face coverings are an essential part of recovery from COVID-19. It is probably the most effective and easiest way to help each other stay safe. Opening businesses, i.e. restaurants, gyms, movie theaters, etc., too soon can be a mistake that will cost many lives. I understand that businesses reopening are essential to our economy, but our lives come first. Unfortunately, if we don't close our beaches in sync with Broward, Palm Beach, and Port St. Lucie, we will be inundated with beachgoers from other counties. The sooner we band together and take the necessary precautions, the sooner we will be back to a normalcy we can all live with.
Next comment, Adina Topfer. Please make masks, slant facial coverings mandatory for Martin County in all indoor public spaces and outdoor public spaces that cannot support safe social distancing measures. This will help slow the spread of the deadly virus plaguing our county.
From Glenn Williams. This virus, it's literally dividing friends, family, our community, and this nation, politically, mentally, and spiritually. How much longer can we survive this way as strong and proud Americans if this continues? It is time that everyone work together to make humanity better not promote fear and bullying by using masks as a method to control each other. Vote no to mandatory masks.
From Mary Wynne O'Brien. With regard to the decision about mask wearing, which is an essential public health tool for an infectious disease, I would like to suggest that even if this is done as an executive order mandate, that the Commission start the process for an ordinance. This should take the enforcement issue largely out of the mix, at least as far as needing the sheriff for criminal penalties. If the ordinance is worded appropriately, it could be used not only for this virus now and when it returns in the future, but for other public health emergencies. That way, you would have on the books an ordinance instead of having to go to the executive order route for enforcement purposes. The ordinance would not need to be limited to masks, but could include following CDC guidelines, reporting requirements for positive cases, and other items that I am sure the Commission would like to have readily available going forward. Thanks.
Next comment, Darby Cameron. The data has proven that the areas where masks are worn, the COVID cases are reduced. Patrons should wear masks unless they are seated and have ordered food or drink. Obviously, patrons should not be expected to mask while eating or drinking. As for beaches and outdoor exercising, people should only mask if congregated in groups outside of household members. Everyone wants business to go on as usual, especially in schools. But if positivity rates and percentages do not decline drastically soon, then that just cannot happen. Decisions need to be made and lived with.
From Kelly Westerly. Just say no to mandatory masks. I don't want to see the county get sued again.
From Emily Jackson, no mandatory masks.
From Courtney, I say keep our beaches open to Martin County residents.
From Elizabeth McKnight. How do you expect me to force my toddler, 2 years old, to wear a mask? She won't even leave her hair bows on her head or clothes on most days. How about my 5-year-old? He has sensory issues and can't stand anything touching his face. Masks should be left up to each person and parents' choice.
From Chris Jackson, I vote no on mandatory masks. This is a violation to our freedoms.
Next comment, Megan Hillard. Please help ensure our safety and make masks mandatory in all public spaces for everyone.
From Lynn Wilkins. Please vote no to mandating everyone has to wear a mask. I have a pre-existing condition. I am not going to be allowed to go to the grocery store. I am going to be forced into using Instacart, which costs more money, as punishment because I can't breathe. I suffer from social anxiety and have panic attacks at the thought of confrontation. Even if you allow for health exemptions, how am I supposed to go in public knowing that I will have to handle both of these issues on a daily basis, doing basic errands and care for my family?
From Mary DiMatteo, please mandate the wearing of masks in public places. If those who do not believe wearing a mask are right, although all medical personnel back masks, they are only mildly inconvenienced, but if they are wrong, it can cost others their lives. Please do the right and brave thing and mandate masks in public. Thank you.
From Helen Runk. Please vote to mandate masks in public. Scientific evidence shows that bacteria from respiratory droplets emitted when someone sings, talks, coughs, sneezes, etc. are blocked when the person wears a mask.
From Josh Stein. With the rise in COVID-19 cases, it becomes apparent that numerous precautions need to be taken to slow down the transmission of this virus. One way to reduce the transmission is to wear a mask in public. It is not our cultural norm to wear masks in public like in other countries, but there is nothing normal about this virus. It affects everyone differently. Numerous amount of studies from different universities and countries have shown that mask wearing can reduce the growth rate of the virus over time. One example is the 2 hairstylists in Missouri who tested positive for COVID-19 after exposing more than 100 clients. Both the stylist and clients wore a mask. None of the clients got sick. Therefore, wearing a mask is beneficial, and myself and my family are in favor of wearing masks. Thank you for taking the time to read this. Joshua and Claudia Stein.
From Marlene Stone, I support wearing of masks for all indoor activities except during a meal. Outdoor activities should not require masks unless it is impossible to maintain social distancing.
Okay. One more hour down. 5-minute break. Thank you. Stacy, you doing all right?
Oh,
Mary Kay,
Kay's getting
you're-
hers up.
Okay, Mary Kay's ready, so who do we leave off with?
You are unmuted.
Okay, George?
Mr. Chair, next comment. Sidney Cromwell. Requiring citizens to wear masks is the intelligent and only responsible way to stop the surge of COVID-19 in Martin County. Protecting our citizens should never be a political issue, but a choice of keeping people alive and healthy. Vote smart.
From Jake Roberts. No mandatory masks for the public in Martin County. Our small businesses have suffered enough.
From Nancy Trudell. On Thursday, we expect a unanimous vote to mandate masks for all throughout Martin County. We have all appealed for weeks now regarding the reasons that it is the right and the only choice for our county since Florida has become such a hot spot for the virus, and Martin County in particular is not in a good place as our numbers are climbing, our hospitalizations increasing, and our available hospital ICU bed numbers are decreasing. In addition to the vote on making masks mandatory, it is imperative that this board is prepared to join the counties to the south of us and close the Martin County beaches over the 4th of July weekend. Broward Mayor Dale V.C. Holness said officials were concerned about people moving between counties to go to open beaches. The overriding sentiment is we have to keep our people safe, Holness said Sunday, and the beaches will be overrun because Miami-Dade is closing their beaches. Fort Lauderdale Mayor Dean Trentalis said the South Florida counties should be unified. I think if Dade County closes their beaches and Broward County closes their beaches and everyone goes to Palm Beach County, it's going to be a disaster, he said. Palm Beach County Mayor Dave Kerner told the South Florida Sun-Sentinel it would be highly irresponsible to keep beaches open. In order to keep Martin County residents safe, you must follow the wise leadership of the counties to the south of us. The damage that will be done by this inevitable virus spread and the lives that could be lost by not closing our beaches for this short period of time will be with us for a long time to come. Don't let Martin County be the place that everyone flocks to, and please don't put us in any more jeopardy than we are already in with this virus. Don't let Martin County be the community referred to as the highly irresponsible community. These are difficult times and require difficult and sometimes unpopular decisions. I hope you will come together as a board today and make the responsible and only choice to close our beaches over the weekend to protect our community. We rely on this board to make choices in the best interests and health of all Martin County residents. Thank you.
Next comment, Judy Dunlap. COVID cases are skyrocketing in Florida. Masks have been shown to reduce the transmission of the virus. It is the responsible thing to do. Please make masks required to enter any type of business. Do the right thing. Protect your citizens.
From Steve Rogers. No mandatory masks in Martin County. Brevard County, St. Johns County, and St. Lucie County all rejected mask mandates for the general public. We should follow suit.
From Brill and Bridget Losh. Please count the two of us in on the yes to mandatory mask wearing. Let's find ways to make masks available to everyone. For those who have difficulty wearing masks due to physical or mental health issues, face shields are their masks.
Next comment, Corrine Davis. Hello. As a Martin County resident and a mother of 2 elementary-age children, I am asking that you please vote yes to mandate masks for Martin County. Can we please just suck it up for a few weeks while we run to the stores, restaurants, etc., in hopes that we make an impact on rapidly growing COVID numbers? Let's do our part as a community. Thanks.
From Laura, Laura Pierce. I ask that the board does not make masks mandatory. The last few years, bullying has been a hot topic, but now in order to enforce a mask mandate, you will be encouraging people to bully and tattletale on each other. What are you going to do to protect the people who cannot wear masks if you mandate them? Will you put a fine in place for someone caught bullying a person with a pre-existing condition that can't wear a mask? Asking as a mom who has seen firsthand what bullying can do to their child's self-esteem. Laura?
From Jill Burton. Respect and protect. All citizens should be mandated to wear masks when in public. Those who do not may cause severe harm by transferring the virus. Seniors who have weakened immune systems, children who have asthma, younger adults that may have compromised immune systems, and all those that have underlying medical conditions. Those that do not wear masks may even be compromised themselves and could have an unknown immunity deficiency. This matter is not a political issue or about human rights. It's a public health crisis. Respect and protect. If you don't want to wear a mask, stay home and save lives.
Next comment, Lisa Davis. I am a United States Air Force veteran, a mom of 2 school-aged boys, and an active Martin County resident and voter, with overwhelming evidence from healthcare professionals and scientists that the widespread use of face masks greatly decreases the spread of COVID-19. I expect that you will use that guidance to vote yes on Thursday, to mandate the use of masks in public areas to protect our children, our residents, and our community at large. Respectfully, Lisa Davis.
From Dr. Melanie Van Amsterdam. Please consider mandating mask wearing as a public health measure to save lives and slow the spread of COVID. We cannot rely on individuals to voluntarily participate.
From Carolyn Shaw. I appreciate that the mask debate has been a difficult issue. I'm writing to implore you to listen to healthcare professionals regarding the need to mandate masks for all people going inside businesses. It was nice that you mandated masks for those who work in restaurants and businesses, but it was unfair not to mandate masks for the customers as well. The people who work in those businesses deserve to be protected too. They are indoors, breathing air that may well have been contaminated with COVID. I've been staying home since prior to the shelter-in-place order because I saw what was happening with the spread of this virus. I very rarely go out. I pick up medication and a few groceries now and then, but mostly have groceries delivered. I wear a mask whenever I am out and around people. I would like to go out to get takeout and support our local businesses, but with so many people out there who care only for their comfort or perceived rights and don't wear a mask. People who don't want to wear masks say I should stay home. I do. What I'd like to say to them is, if you don't care for your fellow citizens and wear a mask, maybe you should stay home. I think imposing financial penalties for not wearing a mask is justified. Perhaps those who don't care about their fellow citizens will at least care about their bank account. Palm Beach County is currently doing this. For those that argue they can't wear a mask because they have a concealed carry permit, I say leave the gun at home for a while. We will get through this and things will get back to closer to normal sooner if we all do what is necessary in the short term. Masks are part of what is necessary. Thank you.
Next comment, Kelly Holm. I would like wearing masks to be mandatory in all public places.
From Bethany McLaughlin. Please do not require masks in Martin County. Masks are for those who are already sick to provide a barrier for spewing large particles. As a mother of 4 young children who cannot wear a mask properly for any length of time, I am beseeching BOCC to vote no on mandatory mask. It should be a choice. I believe people struggle to wear the mask properly, therefore doing more harm and hindering the immune system from functioning at its best.
From Andrew Flanner. My name is Andy Flanner, and I am writing in hope that you will vote to mandate masks in public this Thursday. It is clear that some residents of Martin County willfully ignore wearing masks, which puts others at risk. I am mindful of the perception that such a motion is an imposition on citizens' rights. Given the unprecedented times, it is not an unreasonable imposition. Periods in our nation's history required many more sacrifices of individual citizens, e.g. World War II. Concerned citizen, Andy Flanner.
Next comment, Nancy Ulano. My name is Nancy Ulano. I am a retired medical social worker. My husband is a retired medical doctor with a PhD in physiology. I am writing to ask for a test on the mandate requiring masks. The science and research is there. Common sense dictates mandating for all who can't social distance in public. Look at our numbers. We need true leadership, even if it's not popular among people not following the facts. The virus doesn't care about politics. Do the right thing and lead by wearing a mask and respecting this disease. We are asking too much from our health providers. Please err on the side of caution. Thank you.
From Robert Shaw. Protect our constitutional rights. Vote no on mask mandates and keep them optional.
From Amy Kreitz, I disagree with making mask wearing in public mandatory.
Next comment, James Foley. I encourage all commissioners to vote in favor of requiring masks to be worn in public to reduce the spread of COVID-19. Not making this a requirement in Martin County is irresponsible on your part.
From Jennifer Nolan. There have been no huge jumps in hospitalizations over the last 2 weeks. Hospitals are not overwhelmed, and they never have been. There is a 99% survival rate. The 2,000 positive cases include retests from the same people. Can we all wake up now? Say no to mask mandates. We believe the human body needs sufficient oxygen to function. We know that wearing a mask greatly reduces oxygen levels. This has been proven by OSHA. We believe in nurturing our immune systems and taking responsibility for our own health. Masks should be left for personal choice only. We believe in bodily autonomy. Please do the right thing today and listen to your constituents. Please do not muzzle the community. Thank you.
From Tara Winchell, please do not make the wearing of masks in public mandatory in Martin County. This is unacceptable. I am pregnant and wearing a mask makes me feel sick as it limits my oxygen supply. I have tried various types of masks to no avail. I can't breathe well. Requiring mandatory masks in public is a detriment to my and my unborn baby's health. The decision to wear a mask should be the choice of each citizen, not a mandate by the county enforceable by fines, etc. Please vote no against the requirement to wear masks in public.
Next comment, Alyssa DiPolato. As a lifelong resident in Martin County, I have counted on our commissioners to keep my family safe. I urge our commissioners to vote for mandatory mask wearing in Martin County. Those who feel this is a political strategy, numbers are a hoax, and they have a constitutional rights, they are not going to wear a mask when it's only recommended. This is not political. This is health and safety. This is not a hoax. The rest of the world has also been affected and now watching us fail in our response to COVID-19. And public health and safety does not impede on one's rights. Our commissioners have an obligation to follow statistics, data, and recommendations by medical professionals who have spent their lives working in these specialized fields. Decisions should not be made on personal opinion, the opinions of citizens who fail to observe the data, and those not in position to analyze this information. The number of cases and positivity speak for themselves. Community bars are closed. Restaurants are voluntarily shutting down. We are on the brink of another lockdown. Requiring masks is an effective attempt at reducing the spread. If commissioners aren't even attempting to reduce the risk, what's the next move?
From Margie Tamblin. Martin County should require masks for all residents. The cases for novel coronavirus are on the rise across the state. The masks not only help to protect individuals, but also the community as a whole. Cases will continue to rise without the use of masks for all members of our community. Essential workers are doing their part to help residents of Martin County with access to stores while wearing masks. However, many customers are still not wearing masks, putting essential workers at risk every day. Masks have been shown to slow the spread of the virus down. Everyone should do their part to keep coronavirus cases down. Wearing a mask is caring about yourself, your family, and the many people you may encounter in day. I hope that Martin County makes the decision in the best interests of the public health and safety of residents.
From Jerusha, sorry. As a lifetime Hope Sound resident, I strongly ask you to vote against any measure that would mandate masks in Martin County. We have seen the good news that COVID-19 death rates are plummeting, and it is clear that the media is not sharing other pertinent numbers, such as comparison of the common cold and flu numbers, which would give a better and more factual context of the COVID-19 numbers. In your position, you are able to help dispel the panic and fear of many of the residents, and I ask you to consider these decisions carefully. Thank you for serving our community, and God bless you and your family. Respectfully, Jerusha Dykes.
Next comment, Anna Holtzhauser. I am a resident of Martin County, and I have always known of our commissioners to be reasonable and to put the well-being of their community first in their decisions. Reasonable to me and to most residents is, at a minimum, follow the guidelines set forth by the CDC and require masks to be worn by all while in public. Reasonable to me is putting the well-being of residents first by proactively following fact-based and science-backed guidelines set forth by medical leadership. A pandemic and politics are mutually exclusive. Response to a pandemic must be guided by medical leadership and nothing else. I would expect our commissioners not to allow for their decision-making to be clouded by interests of only a particular group over their interest in the well-being of the community and the commitment to keeping residents safe. I fully support an ordinance to require masks for all while in public, as I suspect most other residents do. It is a common-sense response, supported by a worldwide medical leadership, that is also a simple and reasonable requirement. Thank you.
From Karen Ronk. On Tuesday, June 30th, members of the Coronavirus Task Force testified before the Senate, and every one of them advocated for universal mask use. There was no equivocation. They were in agreement that everyone who is indoors in public spaces needs to wear a mask. There is no reputable or legitimate medical or scientific body that advocates against the use of masks as a means to slow the spread of the virus. And indeed, even Goldman Sachs released a study that said a federal mandate to wear masks would slow the spread of the coronavirus enough to save the economy from losing 5% of its value. We argue that a national face mask mandate could partially substitute for renewed lockdowns, analysts wrote. And a new study said that countries that quickly resorted to widespread mask wearing had far lower death rates and shorter outbreaks. There is overwhelming evidence that this is the right thing to do. There are no constitutional issues, as over a dozen states and hundreds of cities and counties have imposed mask mandates. There is only a lack of courage. When future generations look back at this time period, I believe they will be horrified at our country's response to this virus. But I'm sure the furor over masks will be a particular source of dismay and disbelief. The idea that public health policy could be derailed by people who believe in pedophile pizza rings and the deep state is, of course, absurd even looking at it now. And yet, this is where we are. This commission has not covered itself in glory over this issue, but you can redeem yourselves today. You must impose a universal mask policy that applies to every public place where people congregate with no exceptions. Your duty is to protect your constituents to the best of your ability, and that means hard choices. Even though this should never have been a hard choice, making it now can still make a difference. And if you fail again, I think you should all consider whether you are really cut out for public service. And one more thing as you make this choice. It took 63 days for Florida to hit 50,000 cases. It took 29 days for the second 50,000. It took just 9 days for the third 50,000. This is a runaway train, and we need grown-ups to take control.
From Stephen Shaw. To the Board of County Commissioners, respectfully, I strongly support mandatory mask wearing in close-quarter public settings. In an attempt to stay within the time limit, I'll get right to it. Reasons for not wearing face coverings. 1, masks aren't mandated for the flu. Why should I wear one now? According to the CDC, the average flu season is about 6 months long. In the 2018 to 2019 flu season, the death rate from the virus was estimated at between 24,000 and 62,000. COVID-19 cases started showing in March of this year, and the number of deaths attributed to the virus are approximately 128,000 so far. That means that in two-thirds the time, the number of COVID-19 deaths has more than doubled the worst estimate of last year's flu deaths. Number 2, you're violating my rights. This argument assumes the rights of the individual outweighs the rights of the many. That is not now and has never been the case. That is why a free society allows citizens to vote and the majority vote carries. Number 3, I have a medical condition. All these people have to do is produce a verifiable medical document. Number 4, this is a government conspiracy. When you know a couple of people who have died from this, you might feel differently. Number 5, I'm going to sue. These people know that fear of legal fees can slow or stop reasonable legal process. There are legal expense contingency plans in the budget. I don't want to spend the money either, but we can't be held hostage by these threats. On June 23rd, Palm Beach County voted unanimously in favor of mandatory face coverings in certain public settings. I assume you've talked to the PBC commissioners and have an idea of what went into their decision-making process. Let's use that knowledge and move on to our next step before our numbers go the way the PBC numbers went. At this time, our bars and beaches are again closed, this time for the 4th of July weekend. We tried it without masks. How about we try it with masks, because this way isn't working. It took over 4 weeks to vote in mandatory mask wearing in businesses. Last week, this mandatory public mask wearing issue was brought up and was tabled for another week for legal counsel to research it. With all due respect, shouldn't we have researched that already? Everyone knew this was coming. The COVID numbers aren't improving while we debate this issue. Please vote in favor of mandatory face covering in certain public settings. The majority of your residents will thank you for keeping them safe. Thank you for your consideration in this matter. Respectfully, Steve Shaw.
Next comment, Brigid Coughlin. With spiking COVID cases and the strain it puts on our healthcare providers, please vote to make it mandatory for face masks to be worn when in commercial buildings and when we cannot socially distance. Thank you.
From Lacey Hall. Each of you took an oath, excuse me, I'm sorry. Each of you took an oath to uphold our constitutional rights. Our rights are not suspended simply because there is a virus with a 99% survival rate. Please vote no on mask mandates.
From Leona Quigley. I understand that the BCC is considering mandating the public wear masks to decrease the risk of COVID-19 spread. I ask that you place a time limit rather than making this action ad infinitum. The idea of fines is unfair, especially to senior citizens who are often on fixed incomes anyway. Reminders or warnings should work and should be sufficient. This is America, not a Marxist state yet. I already adhere to wearing masks appropriately, so the rules don't apply to me. I'm speaking up, however, because there have been a large number of outspoken and mean-spirited people who refuse to tolerate any other opinions or control options besides their own. I am willing to defer to my Martin County BCC since you all have made wise decisions during the 51 years I have resided here. Thank you for the opportunity to comment on this issue.
Next comment, Melissa Burke. Please close beaches to non-residents of Martin County or else close completely until counties south of here reopen. Hope Sound Beach was packed at 7:30 p.m. Sunday evening with out-of-town plates. Second, make masks mandatory in public.
From Shana Caton. I am urging the board to mandate that masks be required in public spaces in Martin County. According to a recent TC Palm news report, the Florida Medical Association has come out in favor of mandatory mask requirements. The Florida Medical Association represents 25,000 board-certified physicians in the state. Dr. Ronald Giffler, the FMA president, said their association encourages local officials to adopt regulations requiring individuals to wear face coverings in public places. Dr. Giffler added, "The science is clear. Asymptomatic infected individuals can release infectious aerosol particles while breathing and speaking. Not wearing a mask or face covering increases exposure, whereas universal masking greatly reduces the spread of viral particles. The message is simple. For the sake of your health and the health of everyone around you, Florida's doctors want you to wear a mask. Please do what's prudent. Show us that you care for the safety and wellness of this community. Masks in public spaces need to be made mandatory."
From Regina Winchell. Please say no to wearing masks in Stewart/Jensen, Martin County, and keep the beaches open. It makes no sense to close beaches to locals where they can enjoy some vitamin C, vitamin D, relax and de-stress from all the craziness going on around us. It's open air, social distancing, shouldn't be hard to manage, and people just need an escape.
Next comment, Mary Lynn Howell. Please vote yes on the mandatory mask motion. Both the CDC and the WHO now recommend cloth masks for the general public. With the positivity rate for COVID-19 climbing at alarming rates in Martin County, now is the time to heed the advice of our health experts. Our local economy will be affected by this measure as well. Many citizens, including myself, do not feel safe going out and patronizing businesses. Please put the health and welfare of your constituents ahead of any political pandering. Thank you.
From William Carlson. My name is Dr. William Carlson. I am
Mike,
Yes.
we already read, that was read
Oh,
this
yes.
morning.
Sorry, thank you.
Thank you. They sent me a note that they submitted it twice.
You want me to skip to the next one then? From Shira McMahon. Miami and Broward counties have done it, and now we need to do it here in Martin County. Masks need to be mandatory in and outside of public places with fines enforced. People don't care enough about others to do this on their own, apparently, as our COVID cases skyrocket, so maybe if they have to pay, if they don't, they will be more inclined.
From Kayla Sullivan. As adults, people should be able to be trusted with their personal health and safety as well as that of those around them. Requiring face masks is treating the entire population as if we're already diseased. It is removing the option for choice. It is muffling the sounds of the world and can be seen as an act of a government that wishes to silence its people. I vote no for mandatory face masks.
Next comment, Barbara Brown. Please make masks mandatory.
From Robert and Nicole Orcutt. There are currently plenty of laws we all must follow to protect ourselves and others, such as wearing seat belts, not smoking inside restaurants, and obeying traffic laws. Others we follow for the comfort of others, such as wearing clothing in public. Mandatory masking is the least we can do for the comfort and safety of ourselves and others.
From Kendra Auberry. I'm writing in support of a face mask ordinance that will require all to wear a mask, not just employees at a business. Several studies have shown that a face mask mostly keeps a person's germs from spreading to others while talking, sneezing, coughing, or singing. I would feel more comfortable leaving my house if everyone were taking this personal responsibility to protect others more seriously, but unfortunately they are not. Face masks are effective when everyone complies. The coronavirus can infect individuals without their knowledge. Asymptomatic carriers could be spreading the virus and never know it. This temporary measure would allow our community the chance to slow the spread of this horrible disease and provide more time for treatments and preventative measures to be better understood moving forward. It would also help our medical system from being overwhelmed. I beg the commissioners to take the health and welfare of all under consideration at this unprecedented moment in time. Kendra Auberry, Hobe Sound, Florida.
Next comment, Arlene Wettenstein. Please make masks mandatory. This is so important for slowing the COVID-19 cases. If everyone wears them, it will allow our state numbers to start coming down and remain open. Thank you.
From Kim Cataldo. How many ways do we have to be shown that masks work? We are not being asked to cut off a limb to protect our neighbors, just simply cover our face. This is no more an infringement of our personal freedoms than obeying traffic laws.
From Doris Sanders. Considering the drastic and rapid increase in FLNMC, coronavirus cases just since your emergency order discussion for wearing face coverings mandated for employees, it is urgent that all Martin County residents and visitors be required to wear face masks. Please take action to protect your constituents.
Next comment, Monica Holler. Thank you for listening and really hearing these words written in love. The mask situation highlights our freedom of choice. God gave us the right to choose Him, so He also gave us the freedom of right to choose in all things. Then we live with this blessing or cursing of that choice. We have a constitution of liberty and justice. You have no right to make health and medical decisions for my family or myself, let alone anyone else. You don't know the individual health needs or spiritual beliefs concerning every person in this jurisdiction on this board. You are proposing to mandate the restriction of the right amount of oxygen to our lungs, therefore to the rest of our bodies. And may I point out, to healthy people, just one such result of this scenario could be a respiratory acidosis, which is a condition that occurs when the lungs can't remove enough of the carbon dioxide produced by the body. Excess CO2 causes the pH of blood and other bodily fluids to decrease, making them too acidic. As blood pH becomes more acidic, the parts of the brain that regulate breathing are stimulated to produce faster and deeper breathing. That increases the amount of carbon dioxide exhaled. Wearing a mask also increases the concentration of carbon dioxide, which go back into the lungs again and again. Then what about when kidneys work to compensate by excreting more acid in the urine? Both mechanisms can be overwhelmed if the body continues to produce too much acid. People could start experiencing headaches, drowsiness. Think of all the people that were told that they have to wear a mask just to continue working and providing for their families. Think a person who wants to work with a growing number of them. You think that that's easy or safe? What if that is a reason they lose their job? Then symptoms leading to a severe acidosis will eventually shock and heart problems and a coma. mercsmanual.com. That's in a healthy person. What do you think it would do to someone already dealing with issues? Almost always, treatment of acidosis is directed at reversing the cause, which would be removing the mask. Oh, and what is a treatment for extreme cases? Mechanical ventilation. Why create the situation in the first place? So picture yourself at the end of the day, or how about with your last breath, can you stand before God and say to Him that you did your job for all the people? You know, my children who will vote one day soon are seeing and hearing this all play out and are witnessing corruption and criminal activity on government seats. Hopefully that won't also be you.
From Carla Kearns. Please vote for mandatory masks in public. This seems to be the only way to slow the spread of the COVID-19 virus and hopefully contain it. Even if you don't enforce the mandate, many more people will follow if it's a mandate rather than a suggestion. I am constantly stunned by the number of people out at bars and restaurants, elbow to elbow, no social distancing even between tables, and no one wears a mask. I only know this because we will sometimes pick up take-out food. Apparently, the beaches will be closed this weekend because everyone gets too close together with no masks. Let's carry that thought forward and mandate masks in public for everyone. Thanks so much.
From Robert Kustars. Please do not make masks mandatory in Martin County. As a business owner and medical professional, not only do masks not prevent transmission of COVID-19, they also lead to cardiorespiratory stress. As a medical professional, my concern is for the public with undiagnosed medical conditions that following the mandate of wearing masks, not knowing they are causing damage to their heart health. Not only is forcing healthy, asymptomatic people to wear masks unconstitutional, the regulations need to be on the immunocompromised population. The human body has an immune system which adapts and protects the human body, and we know this through countless research on herd immunity. Our immune systems will end this pandemic through exposure, not by hiding.
Next comment, Elizabeth Skiles. The issue of wearing masks must be removed from politics. We have so much indisputable evidence from an overwhelming number of medical, scientific personnel who have proven how effective the simple act of wearing a mask in public reduces the chance of spreading this disease, which has caused so much havoc. With the lackness prevalent to wearing and politicizing of its wearing, the towns, counties, etc., must mandate the requirement that they be worn in public. Even my young adult grandchildren are lackadaisical in wearing them, as caring as they are. It needs to be mandated. This virus is not over and growing here in Florida. That in itself should be enough to require everyone to wear a mask in public. Please vote to require masks. Thank you.
From Perry Grandone. If you go over this cliff and make masks mandatory, you had better understand the ramifications. People who know that this is government overreach will not comply. Others who have positioned themselves as virtue-signaling snitches will now feel empowered to aggressively attack those not wearing masks. What will be the outcome of that? I hope Sheriff Snyder is ready to enforce the edict and to respond to the numerous calls MCSO will receive in the coming days and weeks. I also hope that Martin County is ready to fend off the numerous lawsuits that will be the result of this. You may have no clue as to the tensions and hostility brewing in the community over this issue. You will light the powder keg if you are not careful. All because so-called experts who have been wrong all along tell you that we must now wear masks, even though most of the literature before this pandemic said masks were useless. Government's job is to protect liberty, not to infringe upon it. You forget yourselves and are dangerously close to becoming little tin gods.
From Ralph Venuti, closing of the beaches is unwarranted and unnecessary. We are a free country where people need to be responsible for themselves and their own health. You don't feel safe, stay home. Also, there is so much misinformation on this topic, but what we do know is that the severity of illness has decreased significantly. The amount of hospitalizations has decreased significantly. Mask, no mask, can you get it on surfaces? You can't get it on surfaces. I won't even touch the mask topic in this conversation. Not to mention being outside, at the beach, in the salt water, or in the blazing sun, your chances are slim to none. Please, look at the numbers. Follow the facts. We are taking away our choice and destroying businesses for something that becoming less and less severe. It is just gonna run its course, and we the people need to take precautions for ourselves. We the people demand the beaches, parks, and other outdoor facilities remain open so we can live our lives the way we were designed to. Thank you.
Next comment, Tim Hodginson. I fully support the mandatory mask order for Martin County. We must act swiftly to stop the spike and prevent the loss of life. It's a simple solution to a deadly problem.
From Linda Eastman. We are in favor of mandatory masks for everyone in retail establishments and wherever social distancing of more than 6 feet is not possible. The number of COVID-19 cases in our state is spinning out of control with over 12,000 new cases in the last 2 days, 133 of those in Martin County, FDOH dashboard 7/1/2020. A preponderance of evidence shows that masks work to drastically reduce the spread of this disease. No matter how loud the anti-mask faction gets, it is your duty to enact policies that protect all of your constituents in a public health crisis of these proportions. We urge you to do the responsible thing and mandate masks in Martin County until the coronavirus has run its course. Respectfully, Mr. and Mrs. Charles Eastman, Hope Sound.
From Heather Carlin, an article published in the New England Journal of Medicine states, "We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic. But despite what you choose to believe regarding the efficacy of face masks, the important thing to remember is that we live in the United States. What makes the U.S. unique from every other nation is that we err on the side of freedom. As we celebrate our independence, I ask you as public servants to err on the side of our freedoms."
Next comment from Ishmael Khan. Please make wearing masks mandatory for everyone. That is the least we can do for our fellow human beings so they are not killed.
From Kristen Blanchette. Please mandate masks in public. I am a DPM in Palm City. The rising numbers are alarming, and masks are a simple, effective way to lower transmission rates.
From Flo Gaudino. The only way we are going to defeat this virus is to wear masks on public places, and social distance. It has been proven in other countries where the citizens have worked together and cared about each other. Please don't be selfish. There are many types of masks. Find one that is comfortable for you. Care about those around you. They will protect you as you protect them.
Next comment, Richard Miller. I urge the county to follow the CDC guidelines. Masks should be required for all staff and patrons of essential businesses and in any public space where social distancing is not feasible. I further urge that Martin County golf courses open to the public be required to continue one golf cart per player. In the event that the disease continues to proliferate in other counties, we should consider restricted access to Martin County businesses and facilities.
From Michelle Biarror. As a local ICU nurse and steward, I have firsthand experience with a very sick inpatient community. A simple gesture to mandate masks is imperative to take the burden off an already strained hospital system and make public safety a priority. Not one human should be in a position of fear of losing their life due to an illness that we can stop the spread by implementing public mask wearing. This is the simplest form of protection we can give to ourselves and others, and it should not be debated yes or no. Yes is the only answer to get this situation under control.
From Gracie Turner. As a local mom, caregiver for elderly grandparents, and primary care physician, I strongly support and encourage you to mandate masks in public to help slow the spread of COVID-19. Gracie Turner, DO, MPH.
Next comment, Dipesh Patel. Greetings, my name is Dipesh Patel. I'm a primary care physician with Cleveland Clinic Martin Health. I strongly believe that we need to have strong measures in place to help curb down the infection rate in Florida, and specifically in Martin and St. Lucie counties. As a community, we would highly benefit by mandating masks for the public. It makes no sense to have a select few people wear a mask and then have the public at large not accountable to do the same. It is very clear and evident that wearing masks, along with social distancing, can help us combat this virus and keep people safe. We all need to do this together. Otherwise, this pandemic will continue to cause senseless deaths and heartache for many unfortunate Americans. Please do not listen to the doubters. Doubt doesn't protect you from getting sick. A mask can. Please, let's do this together as a community to keep each other safe. Thank you.
From Ellen Stevenson. Floridians in general and Martin County residents in particular are behaving in ways that endanger the community at large. Without strong enforceable mandates to wear face coverings and maintain distance, we will never reduce the incidence of COVID-19. We closed too late and opened too soon. The commissioners need to be the grown-ups in the room.
From Dana Daniel. I agree completely with not wearing masks at school. It will be horrible for all. They will share masks, teachers will be so preoccupied, and we are not fearful. Thank you for your consideration. No masks, please. Normalcy.
Next comment, Marcia Collins. Please take under advisement the necessity of mandating mask wearing indoors by all who enter any indoor premises. It seems the only ones wearing masks these days are the elderly. The young generation are the ones with the highest positivity rate, but are totally unconcerned about the rest of us. Maybe it's time to make wearing a mask indoors a requirement for all.
From Victoria Custers. Masks should be a personal choice for all Americans. There is no research that supports mandating masks. In fact, when referencing healthy members of the community, masks are actually contraindicated due to their potential for negative consequences. There are many surgical mask companies that state on the box that their product does not stop virus transmission, including coronaviruses. Science tells us that the microscopic virus is smaller than surgical N95 and especially cloth masks are able to capture. In addition, rebreathing carbon dioxide can cause the body to become hypoxic. According to the Cleveland Clinic, symptoms of hypoxemia vary depending on the severity of the condition. They include headache, shortness of breath, fast heartbeat, coughing, wheezing, confusion, bluish color in skin, fingernails, and lips, and then she provides a URL. A 2004 peer-reviewed research study published in the American Journal of Pathology titled Physiological and Pathological Responses to Hypoxia states, not only is O2 homeostasis essential for survival, but hypoxia plays also an important role in the pathogenesis of frequent and severe pathologies, including myocardial and cerebral ischemia and cancer. This research goes on to state, hypoxia due to impaired blood flow has hazardous effect on organ structure and function. This is especially the case in stroke, cerebral ischemia, and heart infarction, myocardial ischemia. Hypoxia plays also a crucial role in regulating tumor growth and metastasis. And there's a citation. The World Health Organization states individuals working out should not wear masks. Sweat can make the mask become wet more quickly, which makes it difficult to breathe and promotes the growth of microorganisms. In Florida, and especially over the past few weeks where the heat index has been over 100 degrees, this statement is essential to remember, and provides another URL. In addition, on the same WHO website above, there is a graphic that states the best ways to protect yourself from COVID are to keep your distance from others and to partake in basic hygiene, including washing your hands. While there is also a graphic that discusses oxygen saturation, what I would like to point out is that the graphic does not discuss the heart rate and the fact that the body starts to create a chain of reactions that lead to a backup in cellular respiration and eventual cell death. It is my most sincere desire for all Americans to be able to make properly informed, educated choices. I thank you for your time today. Sincerely in health, Dr. Victoria Custars.
This is from Laura Pate. I am contacting you regarding the upcoming vote on mandatory mask requirements for Martin County. I cannot strongly enough state my objection to any ordinance regarding the use of face masks in public. There is copious research indicating that paper or cloth masks do absolutely nothing in regard to mitigating the transmission of viruses, as cited in the New England Journal of Medicine. We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over this pandemic, and she provides a URL. I believe everyone has seen the photos from the mask boxes that clearly state they do not provide protection against coronavirus. The question is, if masks do not work, why make people wear them? There is quite literally no scientific reason to wear one. It is nothing more than supplication to public paranoia, which in turn fuels the paranoia further. Education regarding hand washing, staying home when sick, and avoiding others who are sick would much better serve our community. And I ask that you remember the CDC, WHO, NEJM, the U.S. Surgeon General, and even the vaunted Dr. Fauci have said in the past that face masks are not effective defense against viruses. I understand there are those who are just as fervently argue for the wearing of masks, based not on science but on emotion. If there are those who wish to wear them, then that is their right. It is equally my right not to wear a mask if I choose not to do so. One study describes the negative effects from wearing masks. J. Immunol, 2015, 195, 1372, 137. The immunity of the mask wearer and his or her subsequent ability to fight off COVID-19 or any other harmful infection is actually harmed by wearing a mask. The drop in oxygen levels, hypoxia, noted in many studies, is directly associated with an impairment in immunity. The county already requires masks for employees of all businesses, which I do not approve of, but accept as an indicator of our times. I will not accept an order from the county, state, or federal government requiring me or my family to cover our faces, nor should any American citizen. This debate is not about public health. It is about arbitrary government control. I ask you to vote in favor of the freedom of the people of Martin County. Resist the urge to follow suit simply because other counties are imposing ridiculous, unconstitutional rules upon their citizens. I appreciate your time and attention to this matter.
Next comment, Joan Rowley. Everyone is very tired of being quarantined, but I believe we will not achieve our goal of winning our fight against this deadly virus. Everyone, young or old, should be required to wear face masks when out in public. Businesses must require distancing and masks when anyone enters their establishment. We have gone to phase 2 much too early.
From Jacob Sullivan. I am writing to inform you that I believe mandatory masks are not needed. Being an essential employee of Closets by Design, I find it very difficult to breathe while working in the heat with them on. I also feel that it is crazy to expect my kids to wear them to go in public. Let me ask this: how does a mask prevent anything after all the cashier touches all your groceries with no gloves and also your money, so you're taking all those germs home with you?
From Jennifer Wiggins, please do not take away my right and my responsibility to care for myself and my family. Thank you.
Next comment, Mark Kuzich. I understand universal mask policy will be discussed at tomorrow's meeting and wanted to offer a few comments. I, like you, wish that COVID-19 didn't exist and thus we would have no deaths from the novel virus, but the reality is it does and we will. COVID-19 will not be going away. Many people cite using masks to limit transmission. However, there is no data that supports this. A recent perspective article published by the New England Journal of Medicine is quoted as follows: the chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is reflective reaction to anxiety over this pandemic. End quote. Historically, masks have been evaluated for surgical perspective, and no evidence of benefit has been found that supports the use in the operating room to limit the spread of infection. Studies have also been carried out with respect to viral illness, namely influenza transmission, both historically and currently, and no evidence is present to support the use of masks to limit infection. This can also be seen in the CDC's initial recommendation against the use of facial masks during this outbreak. There are also real concerns with face mask usage. Speak to anyone who wears a well-fitting mask for more than a few minutes, and often you will hear the person complain of headaches, difficulty breathing, or sinus congestion. These may sound trivial, but can signify underlying hypoxia, hypercarbia, mucosal irritation, or inflammation. A recent study in the British Journal of Medicine looked at the mask use in healthcare setting and found the cloth mask use was associated with a high rate of influenza-like illness than usual practice group, which included people who had the option to not wear a mask. They also found that the penetration of the cloth mask by particles was 97%. The concern that cloth masks may trap viral droplets on the surface and aerosolize any potential viral particles, further leading to continuous exposure to the pathogen, must be taken seriously. We also must consider the size of the virus, the minimal infective dose, and whether a mask will significantly reduce the ability of the virus to infect the host. Again, the literature has not supported mask use to this point, and may actually support not using masks. Several other important factors should not be overlooked. Although Florida and Martin County are seeing an uptick in cases, this may also be attributed to
From Rose Paccioni. My name is Rose Paccioni, and I am one of the pulmonary and critical care physicians at the Cleveland Clinic, Martin Health Hospitals here in Martin County, as well as in Tradition. I am writing in regards to mandating public masks for the general public within our county. I believe that it may be difficult for the public to understand the seriousness of COVID-19 because they may not be experiencing it firsthand. As a frontline physician, my colleagues and I are risking our lives every day taking care of COVID patients. So it is our role to educate the public on the true public health hazard that choosing not to wear a mask is creating. Many COVID patients are slow to improve, feeling isolated and alone. They are anxious, they are scared, they miss their families and loved ones. Some do not improve despite our best efforts, but we go to work every day and try the best we can for each patient. All I ask from the public is that they too try their best by wearing a mask when around others. This can hopefully mitigate the number of new cases we are seeing in the community. This is an easy way to partake in combating a global pandemic. I cannot emphasize enough the importance a simple act can have on our county and state. Thank you.
From John McGuire, we are in a group in the Lost Lake area who had a meeting about many people not wearing a mask in public areas. We feel that we all have a right to have a gun, to drive a car, and to walk or run in our community, but we must do all this without hurting others' health and well-being. So since some people need a law before they conform, we feel the following is proper and fair. Number one, all people must wear masks in all public places, staff and public. Number two, anyone who is not wearing it in stores, grocery markets, will be given a citation and must respond in writing why not guilty and does not need to pay fine, money to go directly to COVID-19 Assistance Fund or other county medical group.
Next comment, Marshall Hollander. Martin County has already lost another week. It is time to vote for a mask wearing in every public building and business in the county. What are you waiting for? You have this for all county buildings already. How does it look that and not protecting the rest of us? Masks and social distancing right now are the only means to protect everyone. Why don't people understand this? It is a no-brainer. But it is not enough to pass this regulation without some level of enforcement. We all know the earlier regulation for businesses is often ignored because there are no consequences. This one needs to have teeth. But beyond that, we need education and creating a spirit where we feel we are all helping each other. That is the right and decent thing to do. I would also recommend it as essential, properly worded signage for each store. This is absolutely essential and an easy way of both reminding people and shaming them. With signs, people who might ignore mask wearing will make more of an effort. Perhaps the county could supply the signs. Without these steps, another shutdown is inevitable, something none of us want. Thank you.
From K. Traficante, I am opposed to mandatory masks. First of all, it's a violation of my constitutional rights. Secondly, there is far too much evidence that breathing in one's own carbon dioxide is dangerous and can cause health problems. Thirdly, and very importantly, only a medical doctor has the authority to advise a patient who is under their care to wear a mask, and even then, a doctor cannot force them to do so. Anyone giving this type of advice or mandating such without a medical license and a history with a patient is potentially putting that person in danger. Mandatory masks via executive order are illegal, and of all people, shouldn't you, the county commissioners, abide by the law? If this order is mandated, you are setting the county up for a lawsuit, and as commissioners who work for the people, you personally will be held responsible for costing the county thousands of dollars in legal fees.
From Irene Inslee, vote no on mask mandates.
Next comment, Mary Ann Williams. While I know that everyone is aware of the issues surrounding the wearing of facial masks as a prevention for spreading COVID-19, I hope that the county will vote to make wearing the masks mandatory. I choose to wear a mask because I know from a medical standpoint that there are too many people that are asymptomatic. I choose to social distance as well. However, there are too many people out in the public that are not wearing facial masks and refuse to social distance. This is what bothers me most. If you don't want to wear a mask, respect the fact that others do. And at the very least, distance yourself. I've been out rushing through my shop for my family and my 81-year-old parents. I social distance, follow the protocols that are set up within stores. Too many people walk into me or by me or up the aisle the incorrect way who are not wearing masks and refuse to social distance. As commissioners, you are in a position to help lessen the spread of COVID. Act accordingly and make the wearing of facial coverings mandatory in Martin County.
From Emma Caton. Martin County residents have shown that when left to their own volition, when it comes to public health, they fail their community. By requiring face coverings for all individuals in public spaces, you will be voting to show that you prioritize the health and well-being of your constituents. When someone with COVID-19 interacts with an individual who is not infected and they are both wearing a mask, the chances of an exchange of infection is only 1.5%. Masks are a proven and easy to implement precaution that reduces the spread of this deadly virus. Do the right thing. Make everyone wear a mask. Save lives.
From Jean Vickers. I appreciate the opportunity to once again comment on the public masking issue as a physician and a resident of Martin County. I would be before you today masked, but have responsibilities taking care of patients. I'm sure you are closely watching our weekly local infection rate rise above 15% of laboratory tests per the Florida DOH dashboard. This is a disturbing trend and well above the total Florida rate. My recommendation that my patients and the general public wear masks when closer than 6 feet from one another and in enclosed spaces comes from medical literature demonstrating clear benefit of wearing masks and maintaining distance. As our hospital census climbs, it is imperative that you act now for the benefit of all the county's residents. Not everyone can effectively isolate or work from home. As our elected officials, it is your fiduciary responsibility to take action to protect the citizens of Martin County by requiring public masking. You may do so with the confidence that your decision to require masking is supported by peer-reviewed medical literature. A recent article in the Wall Street Journal from June 29th highlights how the Czech Republic was the first European country to impose mandatory mask wearing in public spaces on March 18th. It has reduced the number of daily new infections to below 50 and has one of the lowest reported death rates in the world. Martin County has reported 57 to 135 new infections daily for the last 5 days per Florida dashboard. As we read reports of businesses closing their doors due to infections of employees, I wonder if a more effective way to support businesses and keep them open is by requiring masking. Please understand that because of the incubation period and the way that this virus spreads, each time you postpone this decision, our community's health is at risk and our health system remains under increasing pressure from the impact of this virus. Please do not delay your decision any longer. I assure you that the numbers will only continue to worsen, and you will look back on today and last week and the week before as the day you should have taken action. I leave you with a quote. On an important decision, one rarely has 100% of the information needed for a good decision, no matter how much one spends or how long one waits. And if one waits too long, he has a different problem and has to start all over. This is the terrible dilemma of the hesitant decision maker. Robert K. Greenleaf. Jean Vickers, MD.
Okay, George, hold on just a minute. We've reached our third hour, so we're going to take our 5-minute break once again.
Where's Commissioner Heather? Let's ask her to.
Okay. Mary Kay, you ready? Okay. I forget, Mr. Merker.
Our next comment is from Michael Romano. The COVID-19 pandemic has accelerated very rapidly in the last month. I don't want to see our businesses and schools have to close again. As the chairman of the Infection Prevention and Control Committee for Cleveland Clinic Martin Health, I am acutely aware that the number of hospitalizations for COVID-19 illnesses is rising in our county. Wearing a face covering while in public or business spaces is one of the few effective measures that we all can take that has a chance of controlling this pandemic. This measure is a proven medical and public health fact. All of the caregivers at Cleveland Clinic have been wearing masks at work for months. I urgently ask the Martin County Commission to universally mandate that all citizens wear masks at all times when in public or business spaces until the current pandemic is controlled. This is for the health and safety of all of our residents.
From Kyle McGinnis. Mr. Lord stood before you and incorrectly predicted a huge spike in cases in Martin County 2 weeks ago. That has not happened. He was wrong. The best thing Mr. Lord can do for the community is encourage hand washing, optional mask wearing, and to halt his fear propaganda.
Next comment, Frank McChrystal. This virus will run its course until all humans have been exposed and either A, have no symptoms, B, have mild symptoms, C, get very sick, or D, get very sick and die. And then it will mutate and we will start the whole process over again. So look in the mirror, get healthier, and build up your immune system. Stop doing the bad things to your body that put you in a vulnerable category. Quit eating the garbage that makes you obese and promotes early onset diabetes. Stop putting anything other than fresh air in your lungs. And those of you over 70, the real question is, why do you fear death anyway?
Mike?
No, I'm sorry. I'm recovering from that last one. From Christy Simmons. You cannot make people wear masks. If someone feels they are at risk, then they shouldn't be out in public, and if they must leave their home, they can wear a mask.
From Joette and Terry Rice. To mask or not to mask by mandate? That is the question. The answer is yes. We are living through a global pandemic. The alarming rise of COVID-19 cases in the South, including in our home here in Martin County, is a game changer for the face mask debate. A growing number of scientific studies show face masks are a critical tool in curbing the spread of this infectious virus. An analysis in Lancet on June 1st found that mask wearing significantly reduces the risk of viral transmission. Studies have shown a face mask is a low-tech disease control tool that could reduce the transmission of the virus between 50 and 85%. Thus, it follows that the higher proportion of people who wear masks means the lower the risk of virus spread through our community. On the other hand, saying no to a face mask mandate could inevitably mean the spread of more COVID cases in our community. A June 24th analysis by the Philadelphia Inquirer showed that 16 states that recommended but did not require wearing a face mask in public had an 84% increase in cases over the prior 2 weeks versus a 25% decrease in cases in 11 states that mandated wearing masks in public. A Pew survey conducted in June shows wide public support for wearing masks. 70% believe masks should be worn most or all of the time in public places. A recent Fox poll also showed 80% had a favorable view of mask wearers. We are asking our Martin County Commissioners to say yes to passing and enforcing a face mask mandate. You will not be alone. Mask mandates have already been passed in Broward, Palm Beach, Miami-Dade, Duval, Pinellas, Hillsborough, and Seminole counties. A face mask mandate in Martin County is critical to keeping people safe, keeping businesses open, and restarting the economy. Wearing a face mask in public will allow all Martin County residents to play an important role in this once-in-a-century fight against the novel coronavirus. Thank you, Joette Lorian Rice and Colonel Terry Rice, and they've included their address and phone number.
Next comment, Bill Reynolds. Which one of you commissioners have lost your job in the past few weeks? None. Which of you have been evicted? Which one of you have been have had to worry about the financial uncertainty and being able to pay your bills? Any of you? No. But the average, everyday residents of Martin County have. These past few months have been some of the worst months of our lives. And now, when we finally think we can break and relax, if only for a few days, to go to the beach and get some fresh air, away from the craziness, away from the masks, away from stress, no. You decide once more that you will force yourselves upon our lives and steal enjoyment from us, and not a single one of you is affected by your decisions. Closing the beaches because you are afraid means you are not fit to handle the duties of the office you hold and need to step down and resign. We will never forget this.
From Julie Marshall. First, I would like to remind you that the White House has only advised the use of face coverings in public. Second, Governor DeSantis has also not required that Floridians wear face masks in any setting. Third, the CDC and WHO have only recommended that face masks be worn. In fact, all agencies have left it up to the individual's own discretion whether to wear a face mask. So why would you, the Martin County Board of County Commissioners, think you have any authority to require all Martin County citizens to wear a face mask under any circumstances? You, of all people, should know that you lack the legal authority to create a mandate, order, ordinance, etc., for citizens to wear masks. The only entity that has the authority to pass an enforceable law to require all Floridians to wear a mask is the Florida State Legislature. If you decide to go ahead with a mandate, you will be opening Martin County up to litigation, as this mandate would be, at the minimum, in violation of the following articles of the Florida Constitution. 1. Privacy Clause, Article 1, Section 23. Every natural person has the right to be let alone and free from governmental intrusion into the person's private life except as otherwise provided herein. 2. Due Process Clause, Article 1, Section 9. No person shall be deprived of life, liberty, or property without due process of law. 3. Equal Protection Clause, Article 1, Section 2. All natural persons, female and male alike, are equal before the law and have inalienable rights, among which are the right to enjoy and defend life and liberty, to pursue happiness. Please remember that you have also sworn an oath to defend the Constitution and government of the United States and of the state of Florida. That oath is your contract with the citizens of this county, and we are going to hold you to that contract as we elected and put you in those positions. Any violations of that contract are unauthorized and without the consent by a large portion of the Martin County residents. Whenever you step outside of your scope of authority, you lose the cloak of sovereign immunity, and so do so with great caution. Please also remember that any law enforcement officer that, in turn, tries to enforce this mandate shall be violating Title 18 U.S. Code Section 242, denying an individual's rights under color of law. As U.S. Attorney General Barr recently wrote, the Constitution is not suspended in times of crisis. We must therefore be vigilant to ensure its protections are preserved at the same time that the public is protected. And lastly, the percentages for people who have COVID-19 in Martin County are very low. Out of 161,000 residents, 0.01277 have tested positive and 0.00015 have died from COVID-19. I believe this shows that Martin County residents have been doing a good job of social distancing, washing their hands, cleaning and disinfecting, covering.
From Shannon McAllister. Imagine being a child or being in the formative years of your life where every day and week you're learning more about body language and facial expressions and how to grow as a human, and being withheld from seeing people's faces and smiles for 4 months now. Have you not realized you commissioners are proposing children not see the faces of strangers in their daily lives? This is the essence of humanity. Imagine going weeks and months without shaking hands and hugging and feeling human touch. The weakest in our society are being abused by the government's oppression. Our parents and grandparents in nursing homes have been isolated as though they're in prison without the ability to meet with family members. And our children are yanked out of society and withheld from the most basic of rights, which is education and interaction with friends. Have you stopped to consider this? Have you thought what the long-term effects will be, or are you just concerned that you received another whiny email about masks or about what the local trash newspaper might write about you? I will not wear a mask, and my children will not wear masks. You are far out of bounds.
Next comment, Whitney Page. As a physician myself, I join with the many other local physicians in imploring you to rule in favor of public mask wearing. We need to slow the spread now before the number of infections exceed our hospital and local healthcare workers' ability to treat patients with COVID. Please make this potentially life-saving choice. Anyone who cannot or does not want to wear a mask in public can easily stay home. Let the rest of us support local businesses while wearing our masks indoors. If we can keep the workers healthy, we can keep the shops and restaurants open. Thank you.
From Jackie Simmons, masks should not be mandated. If you want to wear one, feel free, but those who do not want to wear one should not have to. If you are wearing a mask, you should not be worried about particles from people who do not wear one. Stay home and wear a mask if you want to. Live in fear, but I choose not to.
From Bill Taylor, mask mandates are unenforceable to say the least. Put yourself in the shoes of our deputies. They are only able to attend to a limited number of issues throughout their shift. Here are some examples of what they encounter and are expected to handle in their shift, and many of which have increased during lockdowns: shootings, home robberies, rape, child abuse, domestic violence, drunk driving, fatal car accidents, murders, missing children. And now we are magnanimously adding to that long list, enforcing normal citizens to wear a sock on their face. Does this make sense to you? Does this make sense to the deputies? It is unavoidable to see all over the country the animosity that is unfairly directed at law enforcement. Do you think that directing law enforcement to micromanage average citizens will help decrease or increase that animosity toward law enforcement? Imagine if that civil unrest and anarchy that you see on the news came to our town. Or do you think that our small town is somehow immune to what we see on the news happening in large cities and small towns all over the U.S.? Do yourself and the residents of Martin County a favor. Go ask a handful of deputies if they want to be a hero and help with actual crimes and help hurting citizens during these painful times, or if they want to be a hall monitor and tell people they encounter to put a piece of useless paper over their faces. I'll give you a hint. One action will help our community and the other will harm our community.
Next comment, R.J. Pazzi. I wish to point out how your actions, mandates, and oversteps negatively affect our community. These lockdowns of our beaches and now our body autonomy due to mask mandates are the continuation of the disturbing insanity of accepting lockdowns as our new normal. The term lockdowns 20 years ago was only used in the realm of discussion of prison management. We have since started to use it in our public schools due to poor government policy and mandates that led to the death and destruction in a place of enrichment and education. Even innocent soccer moms, educators, and grandparents are enforcing and championing lockdowns. Our children are being programmed by what we do and what our government and institutions model. Modeling and implementing lockdowns makes us all prisoners. We ended up enslaved by state of emergency orders or executive orders. That is the verbiage of overreaching legislators and lawyers, undermining our freedoms and liberties. Your commissioners have the opportunity to model a better, more healthy way forward. One where individuals are free to choose, businesses are able to survive, and municipalities can recoup sales tax losses due to lockdowns. Please pull back on your oversteps by nullifying the insanity and the run-up to more lockdowns in our county and society as a whole. Individuals, businesses, and beaches being locked down is police-state totalitarianism. That has no place in a free society. Please, at the very least, respect individual freedom and liberties. Step back, message, educate, suggest to your heart's desire, but do not mandate. Open up Martin County.
From Scott Watson. I am absolutely against the mandatory wearing of cloth masks and the liability I believe Martin County is assuming by passing such a mandate. I am not an attorney, but if I were, this would be my argument. The county is instructing you to wear a mask for source control, not as personal protection equipment, meaning the reason the wearer is wearing the mask is not to protect the wearer, but to protect others. By instructing you to wear a cloth mask and not personal protection equipment, the county is ordering you not to use PPE that might actually protect you. That is problem number one and liability issue number one. Next issue, the wearing of a cloth mask has not been properly evaluated for the detrimental effects it could have on the wearer, remembering this mask is not to protect the wearer. One example would be if a wearer actually has contracted the COVID virus knowingly or not. Could the mask in question trap some virus particles which could then be re-inhaled, causing further health problems for the already infected person? This issue has not been fully studied and could very well be found to cause damage to the wearer's health, and if this is found to be the case, as many sources have indicated, the liability that the county has assumed would be enormous. Remember, the CDC's guidelines are voluntary. The county is going the additional step of making the wearing of masks mandatory, and therein lies the huge liability the county would then be assuming, in my opinion. The third and final issue I will discuss, although there are many more, constitutional and otherwise, will be the design and performance of a cloth mask and handling protocols. I would love to know how the county has any idea the performance characteristics of cloth masks as someone might choose. Obviously, the county has no idea. Will the county be testing the masks, homemade or otherwise, to determine if they meet the minimum standards for available oxygen intake, etc.? I believe I can say with some certainty that the answer is no. So once again, the county is instructing citizens to wear a mask made of any cloth of any construction and without any regard to the performance on any given mask, or assuring that minimum safety standards for oxygen intake, etc. are maintained. If you were a private company doing this, you would be out of your mind, violating the law and opening yourself up to huge liability, and I believe the county is doing just that. The county, in my unprofessionally yet experienced opinion, must believe they can hide behind the CDC, etc. I don't believe this will be the case. The county is an independent decision-making body operating in this case under the color of law. The county has the duty to confirm the safety of any order or device they are requiring you to wear in the course of everyday life. There is no way they can confirm any of this is safe. To advise is one thing, to make mandatory is another. So with all that said, in summary, I believe the county is opening itself up to huge liabilities and possibly damaging our citizens' health by requiring something they can in no way prove is safe for the general public to use. I guarantee you there is an army of personal injury attorneys salivating over this misstep, for if they find an injured party or parties, it's going to be game on. I guarantee it.
From Mike Sheffield, we will never forget and we will never forgive each and every one of you for voting to close our beaches. They are not your beaches, they are ours. During a time when patriotism is at an all-time low and moral is at an all-time low, our city fireworks and celebrations are something our residents need. Each and every one of you is a disgrace to your office.
Next comment, Dr. Alma Reyes. My husband and I are both physicians in the community and have serious concerns about the marked increase in the coronavirus cases in our community. And no, this is not explained by solely by increased testing. If you look at the numbers, the percent positive rates continue to rise, even on days of decreased performed lab tests. We urge you to immediately mandate wearing masks in all public areas, particularly those that are indoors, in order to contain further community spread of coronavirus. Please do not buy into the widespread misinformation that is being disseminated by non-medical professionals. Science is clear that face masks reduce transmission of viruses and other infectious diseases. That is why they have been used as part of a basic sanitary practice in medicine, particularly surgery, since the late 1800s. Can you imagine if you are having surgery and a surgical team decided they did not want to be inconvenienced with masks because they are uncomfortable? They do not wear them for their own protection. They wear them because there is scientific evidence that shows it reduces the risk of infection to the patient. We still don't know the lasting effects of this virus on those who are asymptomatic or with minimal symptoms. But studies are beginning to show long-term and perhaps irreversible damage to the body. Please listen to the medical professionals and experts in our community and act now to mandate public masking before the start of this long holiday weekend. Our community is depending on you.
From Donna Lenz. For God's sake, please approve a mandatory mask order for all people in public spaces. Each of you knows that the responsibility for the residents' protection has been squarely left on your doorstep. No one from the state or federal government is going to take responsibility. Most new infection that occurs in Martin County has been for some time your doing for taking inadequate half measures, at least since our doctors and experts advised you of their recommendations and opinions and of the positivity rate and exponential spread here. You are intelligent enough to realize that the argument calling for freedom is ridiculous and not supported by the laws. Residents have a right to live and maintain their home and family, and your duty to take reasonable action in an emergency to protect them is paramount. In the long run, the only way our county businesses survive is if they adapt to the pandemic, and allowing patrons to waltz in and out of public places unmasked, obviously spreading the virus to workers who must work, is a sin at this point, in my opinion. The science proves that the workers' masks mostly protects others, not themselves. That weak link is the reason our spread is out of control, with nearly the highest per capita infection rates in the state, a staggering 17% positivity rate, and exploding case numbers. It will take weeks to undo the lost time from your foot dragging, and at this point, either you allow residents to leave their homes with some protection afforded them, or you in essence expose all to a deadly and at minimum destructive virus that you have no idea what damage down the road you are inflicting on even the asymptomatic carriers. Vote yes on mandatory masks for all.
From James Brightman, let's recap the past few months, shall we? Number 1, schools were closed, a mistake. Number 2, graduations canceled, a mistake. Number 3, small businesses closed, a mistake. Number 4, beaches closed, a colossal mistake. Number 5, state parks and hiking trails closed, a mistake. Number 6, playgrounds closed, a mistake. Number 7, making employees wear masks, an ongoing mistake. Number 8, weddings canceled, a mistake. Number 9, funerals limiting the number of people, a mistake. Number 10, fathers not being allowed to witness their children being born. This isn't a mistake, this is criminal. Number 11, canceling Independence Day when we need unity as a country, a huge mistake. Are the commissioners trying to make mistakes that affect the lives of Martin County residents, or is it your poor decision-making finally having the spotlight shown on it?
Next comment, Mark Winchell II. Hi, I'm writing in to share that I do not support mandatory face masks for our county. I believe every person has the right to make their own decisions for their own health. It is proven that some people can have health issues that could increase by wearing masks full time. It has also been proven that there are very few masks that can actually prevent the spread of illness. I have seen some very people wear masks that are totally unrealistic in preventing the spread of COVID-19. Would it then be mandatory that what type of mask we must wear, or is it really just a formality for people to feel safe with a mask on? It just seems like to properly achieve what is desired to prevent the spread of the sickness, this is a slippery slope of continued mandates that will limit our freedoms more and more and more without proven evidence that it will actually work. Thank you for your time.
From Jackie Transinger. Good morning from Jackie Transinger. There is not a lot to say except that there were 50,000 new cases of the virus yesterday, a record. If this does not inspire you to just pass the mandatory mask order, then you do not deserve to be a commissioner. My generation, I will be 86 soon, is not accounting for the majority of the cases any longer because we are smarter and wiser and less selfish, and so we are more careful than you younger people. We self-quarantine, wear masks if we go out, and make sure we are social distancing. We really do care about our neighbors. We lived through World War II sacrifices and defeated our enemies. No one ever said no to the government's demands on us during that war. No one would ever cite constitutional rights as an excuse not to cooperate. Pass the mandatory mask order today, or I fear that this enemy, COVID-19, will defeat us or be with us longer than World War II. We have already surpassed Vietnam War casualties. Just do the right thing, not next week or next month, but today. You have postponed this inevitable action for too long.
From John Montgomery, When you remove the ability to see a person's face, you remove the natural habit to treat them as a person. Why do you think the riots have gained so much momentum and are so violent? Do you actually think not being able to see other people's faces has nothing to do with it? I have watched and attended BOCC meetings and heard the pitiful reasoning for wearing masks. How about you hire some actual mental health experts and get their opinion before making decisions that you have absolutely no idea, what the long terms and even short effects will be? Because presently you have no idea. You are shooting from the hip and are making mistake after mistake. It's obvious to everyone except the Board of County Commissioners, and it's evident from your recent closet vote to close the beaches once more that you actually believe you are not making mistakes. Stop messing with our lives. Why do you think depression and drug overdoses and suicides have had an all-time high numbers in the past few months? How about domestic violence and child abuse? Do you think all these suddenly stopped happening because the only thing the media cares about is whether or not people wear masks? Our society needs to interact with each other and fulfill that social need that we all need. The actions you are taking as commissioners is deepening our gaps in connecting with friends and strangers. We need physical touch, we need smiles, we need laughter, and to just enjoy living. These are the essential things we need in our lives. Constant fear and public shaming is what is driving our society into the ground. Maybe you don't go out into public or hide behind a mask when you're doing errands, but I see it, and it's pervasive in our society. Masks or no masks will not kill people, but depression and fear-mongering and making society cease to function will kill people.
Next comment is from Linda Tripp. The issue of a mask mandate is one of the silliest things I've ever heard of. I have worked in healthcare for over 20 years in Martin County. I am well versed in proper usage of PPE, such as how to put it on, how to take it off without cross-contaminating. Even though these are simple to perform, if someone has not been trained, then they will cross-contaminate themselves and whatever they are touching all day long. And that is just with disposable PPE. Regarding reusable PPE, such as cloth masks, I have never seen anything so dangerous in regards to spreading germs. Nothing can compare to how dangerous that is. The cross-contamination is put to extreme levels, whether you are trained or not, because there is not way to get around it. When someone is using a cloth mask that is supposedly reusable, people will naturally put the mask on and take it off multiple times to getting more and more germs on the mask each time they go in a store. Not to mention the sweat they are soaking into the mask and wiping their hands off on their pants each time they put it on. The panic around wearing masks or not wearing masks is just another frantic move by the media to create hype around this virus. And if you vote to put forth some type of mandate for average citizens to wear masks, then look forward to positive cases to increase rapidly due to cross-contamination. It's just that simple. And I think I have the last public comment, Mr. Chair. It comes from Talina Howard. Please vote against requiring masks in Martin County.
Well, George, our prediction of 8.5 hours, we've did that in 50% of the time, so thank God we weren't in Vegas betting on that. So. Okay, so now I guess we'll turn it over to Ms. Woods.
Yes, if we could put the emergency order up. I'll try to be as succinct as possible as soon as we get the emergency order up. The first 3 pages are whereas clauses. I'm not going to read all of them. What they do is provide a history and a basis for the emergency order. I'll draw your attention to a couple of them. In the middle of page 2, I do have a change. We had a whereas. Martin County currently has, it's now 2,151 positive COVID cases with record-breaking positive COVID-19 test results coming in daily and an overall positive test percentage rate of 12.5%, one of the highest in Florida.
Can you pause for just a minute? I
Sure.
missed Commissioner Heatherton is wanting to say something.
No, that was before Sarah. That was on a different topic.
Oh.
I had a comment that was unrelated to this, and I don't know if you want to take it now or at the end, Mr. Chair.
Let's
But
let Sarah do her thing.
I'm sorry.
Let's let Ms. Woods do her thing, and then we can.
All right. At at the bottom of 2, there's been a lot of talk about the legal defensibility. There was a recent Supreme Court case, United States Supreme Court case, where California limited the attendance at places of worship due to COVID-19. Chief Justice Roberts upheld the act of the state of California, stating the precise question of when restrictions on particular social activities should be lifted during the pandemic is a dynamic and fact-intensive matter subject to reasonable disagreement. Our Constitution principally entrusts the safety and the health of the people to the politically accountable officials of the states to guard and protect. When those officials undertake to act in areas fraught with medical and scientific uncertainties, their latitude must be especially broad. Where those broad limits are not exceeded, they should not be subject to second guessing by unrelated federal judiciary. At the same time, recently, Alachua County issued an emergency order requiring face masks. The emergency order was challenged in both Florida Circuit Court and in the federal district courts. Both courts issued orders denying plaintiffs' emergency motions for temporary injunctions. The Florida court stated the protection of the safety and welfare of the public is inherent in the role of local government. The requirement to wear facial covering during the limited circumstances set forth is a minimal inconvenience, and its benefits to the public, potentially reducing the spread, outweighs any inconvenience. Likewise, the United States Judge Mark Walker said, plaintiffs have not demonstrated that Alachua County exceeded its broad limits, and this court, like the Supreme Court, will not engage in second guessing. So that kind of gets you your legal basis for an emergency order. There is also when we drafted this, and I want to thank Elise Elder, one of my senior assistant county attorneys, we carefully looked at the various lawsuits that have been filed recently, and the next to last whereas clause, I want to stress, any mask mandate would be for sanitary purposes to promote the health, safety, and welfare of all persons in Martin County and not for the purpose of mandating a medical recommendation or medical treatment. And then the final whereas clause is that the county believes requiring individuals to wear face coverings in public will significantly help to reduce the spread of COVID-19 and lessen the positive COVID-19 cases in Martin County. At this point, I want to just take a minute to address, there were a number of public speakers who brought up a Florida statute prohibiting face coverings. They picked 2 sections that talked about that. Unfortunately, they didn't read the section that provides that those provisions apply only if the person wearing the mask, hood, or other device with the intent of depriving someone of equal protection, with the intent of force or threat, with the intent to intimidate or threaten, or if they're engaged in conduct that would lead to a civil or criminal proceeding. And that's a lot of legal mumbo jumbo, but what it means is that unless you're in the commission of a unlawful act, that's the only time it's not that you would get an additional penalty for wearing a mask.
With the concealed weapon.
And the concealed weapon permit as well. We checked with the Department of Agriculture, who lists them. They referred us to the local authorities, but the general pole star of law is that you interpret 2 statutes or 2 requirements to be compatible. If a person had a concealed carry and they were wearing a mask and they weren't violating anything and they were doing both consistent, I'm not sure any law enforcement person would have a reason to stop them or to violate them. And so I think that was the reason the Department of Agriculture said, check with your local law enforcement. So I did want to mention that to clear up in case if there was any confusion. So now we get into the meat of the emergency order. It requires, as to face coverings, we first have a definition of indoor public places, businesses, and establishments. Must be worn by all persons while obtaining or providing, working in any indoor public place, business, or establishment. And I'm not going to read these verbatim. Everyone can read them. It also requires face coverings, obtaining or providing goods or services in outdoor public places where social distancing in accordance with CDC guidelines is not possible and not being practiced. And the reason we use CDC guidelines rather than feet is that that's what's defined by the Center for Disease Control. We want to make sure if those recommendations ever change, we would continue to be consistent with what they recommend. We require restaurant and food service establishments to be worn or face coverings by all persons in the restaurants, whether indoors or outdoors, except when actively consuming food or beverages. We then go on to say all persons accessing public government buildings for the purposes of conducting public business, visitation, contracting, maintenance, would wear a face covering at all times while present in the building. And for purposes of the emergency order, it meant government buildings of any Martin County or municipal owned and operated buildings, including the office buildings, fire rescue service centers, recreation, and libraries. We then follow with definitions of what a business establishment is, and it's a long list. It has a definition of indoor business and establishments include any area that is outdoors that has a roof overhead or other overhead covering where business is conducted. There's a definition of face covering, which is any covering which snugly covers the nose and mouth and is secured in place. It then has the standard language which you had in your previous emergency order that encourages folks to review the CDC guidelines regarding proper and safe application and removing and cleaning. And again, cautions the public that medical and surgical grade masks should be reserved for our healthcare personnel, our police, our firefighters, and other first responders. There's a definition of indoor place. Any indoor public place is any location where the public has or may obtain legally permissible access, whether publicly or privately owned, that's under a roof or overhead. Definition of outdoor public place is similar. Here's what's most important, and perhaps will put many of our citizens at ease. There's a comprehensive list of exemptions. So face coverings are not required for the following. A, children under 6 years. The age limit came as a result of some input that I received individually from individual commissioners. The CDC says 2 years, 6 years, that really is up to you what you'd like to mandate. And it does say that it does not apply to any child while under the custody of a licensed child care facility, including schools, summer camps, and daycare centers. So we're clearly not trying to enter that arena. We exempt individuals prohibited from wearing face coverings by federal, state, safety, or health regulations. Public safety, fire, or other life safety personnel that have personal protective equipment requirements are also exempted. Persons actively engaged in exercise and who are social distancing in accordance with CDC guidelines, also exempted. Persons receiving goods and services from a business or establishment for the shortest practical period of time during which the receipt of such goods or services precludes the wearing of a face covering, including consuming food or beverages, receiving dental services, facial grooming, or treatments. So that is exempted. Here's one that is probably most important to many people who voice concerns. Persons who have a medical condition or disability that makes the wearing of face coverings unsafe. Expressly exempted, don't have to wear a mask. Persons may temporarily remove face coverings while assisting, and we've got a typo here, it should be persons who are hearing impaired or who rely on reading lips in order to communicate. An exemption for persons in private rooms of lodging establishments such as a hotel, motel, or a vacation rental. However, face coverings must be worn in the common area as prescribed by this order. And then finally, there's an exemption for people engaged in outdoor work or recreation with appropriate social distancing pursuant to CDC guidelines. We then go, and this was part of the board's discussion last week, we go to require all businesses and establishments subject to the provisions of this order shall conspicuously post signage as follows. And then we have restaurants and food establishments. You'll see that there is a link. We have a template sign, and you can look at that once we get through this. We then go on to talk about the sign requirement for county and municipal government facilities, indoor public places, other than restaurant and food establishments. And again, they shall post the sign designated indoor public places, business and establishments. And there's some signs. There's a requirement for outdoor public signage. The signage required should be at least 8.5 by 11 in size and printed in color if possible. We request that signage be posted in multiple languages, including English and Spanish. And as to where the signs would be placed, it says signage must be posted conspicuously for easy visibility at all entry points. The enforcement, I think the preamble is most important and reflects board direction last week. It is the intent of this order to seek voluntary compliance with the provisions contained herein, and to educate and warn of the benefits of compliance and the dangers of non-compliance. However, in the event voluntary compliance is not achieved, then it provides for the statutory, civil, and misdemeanor penalties that are provided under our emergency management statute. The Section 7, which is the only really other one that is pertinent or important to note, our order specifically does not apply to the internal operations of local governments within Martin County, the Martin County School District, the state university system, the state college system, the state of Florida, federal agencies, or public utilities not associated with Martin County, who are encouraged to adopt their own rules and procedures consistent with the matters set forth herein. Section 8 repeals Emergency Order 2011, which dealt with workers or in restaurants and other businesses. And with that, we can put up examples of the signs. I'm happy to answer questions. I want to thank Laura Beaupre and Martha Ann Canese and that department. They prepared, along the board's desire for education, we have frequently asked questions for the face coverings. We have a long section of questions, and then we have a section that provides a quick reference guide so that we can hopefully inform the public. Most notably, this emergency order does not put the onus on the business owner to enforce, and we wouldn't encourage a business order. They could inform, they could educate, but there's no penalty, as you might find in some other counties in Florida. There is no penalty in our order or requirement that the business owner or the other owner of the event has any liability if their patrons are not wearing the mask. And with that, I'm happy to answer any questions.
Commissioner Heatherington.
I have a question.
Go ahead.
Yeah, can you hear me okay?
Yep.
Yes. Ms. Woods, last week we had a discussion at our meeting, and it included bringing an ordinance, an emergency order, and an education plan. And I only see here one option, which is the emergency order, and that comes along with a misdemeanor penalty, which I'm not interested in imposing that kind of penalty. I'm interested in public safety. So watching St. Lucie County yesterday, they considered everything from an ordinance, and a proclamation. And it was brought up there from their attorney that an ordinance required a 4/5 vote versus a simple majority. I don't know if that's accurate, but number one, why aren't we discussing other options? Because I thought that's what we discussed last week. And can you clarify, is there a difference in approval by this board in an ordinance versus a emergency order like was discussed at St. Lucie County?
Yes, ma'am. I don't recall the board asking me to come forward with an emergency ordinance. I believe at the time we talked, we were talking about an emergency order. It's fairly simple to describe. Emergency order comes from the county's authority under the Declaration of Emergency under Chapter 252 in Florida statutes. And so there's broad powers that are granted first to the state and then to each county when there's a declaration of emergency to address those issues. And emergency orders, by operation of that Florida statute, are then enforced with these civil, either up to a $500 fine or jail time if appropriate. Again, those would all be subject to having due process and going before court and having, it's not an absolute. When you pass an emergency, Florida law requires, obviously requires advertisement and a public hearing in order to pass an ordinance under our ordinance powers in 125. There is a provision for the passage of an emergency ordinance, which is what St. Lucie did yesterday with their, and that only applies to employees, I believe. And that is where the 4/5 requires. You have to have 4/5 of your commissioners to approve an emergency ordinance. Under an emergency order, that's actually issued by the emergency management director. That's the way our current ordinance works. The board, of course, gives direction to our emergency manager and the county administrator. The plus, and I believe the reason that they used an ordinance in St. Lucie County is they wanted to be able to use a citation through their code enforcement division. Where the one downside of it is that we've got case law here in Florida that supports an emergency order. It's more temporary in nature. It's dependent upon a declared state of local emergency. It comes with all of the protections of during the state of local emergency. So at this point, we felt that the more legally prudent way to go with this was a declaration of local emergency. At the same time, and I'm not sure if you're asking this question, we're reviewing our emergency management ordinance, and we're looking at how it's set up. We were reviewing it anyway. Quite frankly, it was always aimed at what we used to know as being emergencies, which were hurricanes. And so we're tweaking it. We'll be bringing that to you the end of August, I believe, which would, in that section, in our ordinance, we could add in a provision that it would allow civil compliance with code enforcement. But that isn't currently in our ordinance. And we currently, and I'll defer to the county administrator, don't have the staff for the compliance to do code enforcement work right now. Again, overall,
that we hearing an ordinance and an emergency order, and we're only hearing one thing today, and that involves misdemeanor penalties.
Either
Is that correct?
Yes, ma'am.
Emergency order is a misdemeanor penalty. It's enforced.
The emergency order is the penalties and the enforcement are left up to local law enforcement, and so it would be up to law enforcement as to whether they wanted it to be with a penalty, a monetary penalty, or going to jail. I'm not aware of that type of action being taken with any of our other emergency orders. I think it's an action of last resort, which is why we put in the language in Section 5 that it was the intent to seek voluntary compliance at best. But again, I'm happy to,
Is it defined in the ordinance, and maybe I missed it if it does, of warning, first offense, second offense? Because the only thing I see is it's a misdemeanor violation. It doesn't say if it's first offense or second offense. It just simply says that if you violate this ordinance this emergency order versus an ordinance that I thought we were also going to consider, that this would be a misdemeanor penalty. Doesn't say how it would be applicable versus first, second, third offense, warnings, etc. So can you explain that a little bit?
because it's an emergency order, which is temporary in nature, and we're going under the process that's set forth in 252, and what's provided for in we have 252, and then we have our emergency management ordinance. And both of those, as currently written, particularly ours, just have the enforcement provisions under the two Florida statutes for either a fine up to $500 or the 60 days in jail. So that's all I have currently for that. If you wanted to go with an emergency ordinance, we could, again, that's more of a citation. Typically with violations of law, there's not written into, and I'm not a criminal lawyer, there's not written into a warning and then a second warning. We certainly could add language to this to request that citizens be given a warning and education prior to any action being taken. But again, enforcement really is that of our sheriff, and so we don't normally give him direction of that.
So the enforcement would be $500 fine and misdemeanor.
Or. I believe it's and/or. I don't think it says
Up to.
up
And that would
to.
be
And again, it's up to,
by-
Commissioner, it's not $500. It's up to $500, up to 60 days in jail. So again, that the penalty and the what was happened, again, that's following due process, that you're found to have violated this, you're able to go before court, you'd have to be found guilty, and then the fine would be imposed. It's
So how would an ordinance work then? There's a civil citation and an ordinance. Explain what an ordinance, how an ordinance would differ.
The ordinance is like any other ordinance that we have here in Martin County that we would enforce. We could have the same provisions, but then it would be enforced as a violation of our code, and that would be up to you how you wanted to say what the penalties would be and how many that would be. But again, violations of the Martin County Code are enforced by code enforcement. They're just a civil penalty, and they're done by our code enforcement, which heretofore are pretty much just violations of not zoning violations, but our building department and some of our other health and safety issues. We've never embarked on anything like that.
Signage and
What?
like signage
Yes,
and other things.
when somebody's violated the signage, or I know with Mr. Massing's building department, if we have nuisances, we'll take that in, or if we have a condemned building, that's normally the times when we're doing animal control, parking violations, when we write a parking ticket. But again, even with that, they're written a citation, and they still, of course, in accordance with law, they go to court. It's not a absolute. They still get a chance to have their day. If it's a county code violation, they would go to county court, just as you do if you got a parking violation or a animal control violation.
So it's a civil penalty. And what the enforcement, it doesn't have, some speaker mentioned today an exit strategy, and I don't see a sunset provision in this ordinance. It only links it to the local state of emergency. Is that what you intended for a sunset provision? It's linked to the local state of emergency?
No, ma'am. In general, just as you passed your previous emergency order requiring employees to wear masks in places of business, a emergency ordinance can be repealed immediately once the board direction. So there's not, if you would like a sunset provision, we can certainly put it in. Normally, emergency orders are tied to the local state of emergency. On the other hand, for example, the emergency order that was passed the other day, closing the beaches temporarily for the July 4th holiday, that had a distinct period. I didn't have any board direction as to how long this would be in place. The board certainly, though, just as you did when you closed some other facilities, could give us board direction at any meeting to rescind or terminate the face mask emergency order should it be put into effect. Don't we have?
So would it automatically be reconsidered, or would it expire on a certain date, or would it just linger on until as long as we are in a local state of emergency?
Well, the local state of emergency is good for 7 days. We renew it every year, and every 7 days we renew our local state of emergency for the COVID-19. So this emergency order is dependent on there being a continuing local state of emergency. So hoping that the local state of emergency was allowed to expire and was not renewed, this would likewise terminate.
Okay. Again, I would have liked to see the ordinance. I have more comments. I'll let somebody else. Thank you.
Commissioner Smith.
Yeah, Commissioner Heatherington, all I was going to just add in really quickly, and I think you asked it, I don't know if it got answered. My guess is if there is to be a motion with this, whatever is crafted with that motion will govern the timeline. You could add into the motion anything you want. If you wanted a sunset provision in a motion, whoever makes the motion could say, just hypothetically, this emergency order would sunset in 30 days.
Absolutely.
You could do it tied to the run out of the emergency order, declaration of emergency order by the county as a whole. You could put in any other provision on the timeline that you wanted to have. So, I mean, that's just up to you or the board or whichever one of us, if a motion is made on such a thing, it can be tied to whatever parameters that the board wants to put into it.
The current language states that the order would expire upon expiration of the existing state of local emergency, as same may be extended by subsequent order or duration, unless earlier terminated by a subsequent order. So,
but there's a however. If the board made a motion that
Yes.
said delete that last paragraph,
Yes.
if that's what you wanted to do, Stacy, if that's what came up in a motion, you can add any timeline, any criteria, or I assume, Sarah, any alterations to the emergency order that the board wishes to add.
yes, of course.
No, I'm stating the obvious, but
Yes.
it just, in case you didn't know.
This was just a recommendation by staff trying to fulfill the board's direction.
I myself am struggling with this, and I think it's so divisive because of the same reasons I'm so frustrated with our situation and the data that we, the public, and we commissioners are provided. The cumulative data that we're getting that's 5 months old that says hospitalization, whatever that number is now, what the heck does that mean anymore, right? So, and what does the 2,000 number mean now? I ask, why don't we have a recovered thing on there? Well, we don't have a definition of recovered. But we do have a definition of when you can return back to work. Isn't that the same thing, right? So these things are frustrating people. I think that a lot of the people that were here adamantly against this, if we actually had some raw data that really proved that they didn't question, we may be having a different conversation. You know, and mixing traditions numbers in with what we've got going on, it just, you know, and the different, we got the WHO telling us one thing, OSHA saying something else, the Attorney General saying something else, our local medical professionals with their hair on fire, and it's frustrating. You know, I don't believe there's a doctor in the room, but so we're relying on who we trust. Who do we trust? You know, I question the positivity rate. I had to quarantine because of a false positive. I experienced that myself, and we may have another one.
Here's one.
Right? So it's, you know, I ask how many people that are tested positive are asymptomatic? We don't have that data. Why not? You know, if the majority of people are asymptomatic, is it? So anyway, this morning I asked Rob Lord a question. I do not want to upset him. I consider him a friend. But I asked him about elective surgeries. You know, the medical community is in here with their hair on fire that we're reaching critical mass in this, and they're still continuing elective surgeries. They're loosening visitation. And then went on to say, and I don't know that this is the adjective he used, but they have ample capacity. So I was forwarded and I sent them to you too, the Miami emergency order. Did you guys read that? I can read it if you'd like.
Yeah,
So
I read it.
obviously Miami dealt with the same, or was as frustrated the same, and the hospital seemed to be maybe reluctant. Like, I feel the hospital is reluctant to give us actual by-the-minute data. So they passed a emergency order, 1820. This order is effective, Each hospital shall report to, and an email address, on a daily basis by 10:15 a.m. and 7:15 p.m. the following information to the county. 1, current staffed inventory of general acute care beds. 2, current staffed inventory of intensive care unit beds. 3, total number of unused beds at the hospital which could be converted into ICU beds. Total number of beds that can be converted into general acute beds. 5, total number of ventilators available for immediate deployment. 6, total number of ventilators on standby. 7, total number of respirators and or anesthesia machines that can be converted to serve as ventilators. 8, total COVID-19 patients admitted. 9, COVID positive patients in ICU beds. 10, COVID-19 positive patients non-ICU beds. 11, COVID-19 patients currently on a ventilator. 12, new COVID-19 admittance since the prior day's reporting, which I think is the most important. And 13, COVID-19 patients discharged since the previous day's reporting. I don't think that's unreasonable information to ask. I mean, it does get pretty deep there. Maybe we don't need all of it. But is this something that if we had this information, this conversation we're having today may be completely different. Completely different. So I just wanted to throw that out there. I mean, I think that if we can do something like this and get this type of information here on out, it would make everybody in this county, the 161,000 people that the 5 of us are responsible for their health, safety, and welfare, right, and well-being, it would make our jobs a lot easier than using information that I'll honestly say I question, right? So, anyway, I'll stop there and ask for somebody to comment on it. Yes, ma'am.
Just to try to clear up some of the misunderstandings, I know that people were talking about positivity rates and about the state double counting, the Department of Health in Tallahassee said in writing that the repeats and duplicates in testing have been filtered out. And they say in writing that the numbers represent the total number of individual cases. So we have to rely upon that. Those are their numbers, and they are backing them up in writing. We are in an emergent health crisis, and these protections that are contained within this emergency order are clearly warranted. Our frontline fighters in Martin County, their advice was unanimous, has been unanimous. They have urged us without exception to press forward with these additional protections because they will save lives. They'll save us from protections, and they will save Martin County lives. We need to be guided by science and by scientists. Our infection rates are soaring. Infections here have more than tripled in fewer than 30 days. We currently have the highest or one of the highest rates of infection in Florida. Our current rates are 12%. Miami-Dade is 11.4%. Palm Beach County is 9.6%. Broward is 7.8%. The state is 7.6%. Indian River County is 4.9%. You have to consider these statistics. Those statistics are not lying to you. They're telling you that we have a pandemic here that's infecting and killing way, way too many Martin County people. And we have a tool that we can use in order to lessen, in order to flatten that curve for the first time. And it is imperative that we act upon it. Any equivocation will result in many more infections and deaths in Martin County. Therefore, I will move approval of the emergency order.
I appreciate all of the feedback that we received today. There were some comments this morning that we were sitting up here with expressions on our face like we wish we didn't have to hear this. I disagree. I specifically sit with a neutral expression on my face to not make anyone that comes forward feel that, at least in my situation, the decision had been pre-made. Although I've been working and researching and studying this issue, I'm sure like my colleagues, for a long time. I wanted everyone to feel welcome, and then if we had to sit here until 10 o'clock at night listening to public comment, I'm glad to hear it. That means people took time out of their day. I think this, I've only been at this 2 terms, but I think those of us that have been here longer and staff, I would safely say this is probably the most public feedback on any specific item that we've ever had. It was more than 6 hours of public comment. And in the beginning, I tried to keep a little hashtag, a score sheet on, who was saying what. And even when I read the emails that we receive, because we've received hundreds of additional emails that were not discussed or asked to be read here. We all have personal experiences, heard from people directly. I had people that came this morning here to the room to speak, both for and against, that I would consider and that are close friends of mine, and they were for and against. And it makes it a difficult decision. I hear what Commissioner Jenkins is saying about, how do you wade through the numbers? I've had some debates, if you will, with constituents in person, over the telephone, that you can look at numbers to suit how you personally feel. For me, the deciding factor comes from, there's a lot of talk about the World Health Organization and the CDC, and then there's medical journals, and I think most of that, there has been some waffling, no doubt. And I've been listening to the state's Surgeon General and to the Surgeon General for the United States of America, and there has been some waffling. But for me, what tips the scale for me personally is two things. One, I don't like to use the word literally unless it genuinely defines what I'm trying to say, but I would literally say, I've heard from every medical professional that has anything to do with my family. My doctors, dermatologist, pediatrician, gynecologist, chiropractor, everyone in the medical profession. I will tell you that my chiropractor is opposed to masks. But every other person that reached out to me, implored me to move forward on this, implored me. So if we wonder, who do you trust? I have to, in this particular case, trust the people that I entrust my own personal health to, my health of my family members, in every medical field, every practice. Even folks that I know that are doctors, that are not my doctors, have all unanimously and universally said, except for maybe a tiny fraction, that this was the right thing to do for the time being. And last week when we brought it up, I said that I would rather fall on this side of history simply because none of us know exactly what to do here. We could trade seats with anyone, and that we could put them up here, and they have to try to have a bigger picture. I will tell you what I tell most of my friends or anyone that's interested in giving me feedback, and there's been plenty, is that all of those people are entitled to their personal opinions. And I don't think anything any of us are going to say here today are going to sway a majority of the people. I don't think anyone that took the effort to stand outside in the heat and then come into the room are going to be swayed by anything that we say. My original goal was to say nothing, literally nothing, and then just, side one way or the other. But this is such an important issue. I want to send a message to the people that are paying attention that we understand. And this morning and all throughout the day, when we heard people that were, reasonable people and great citizens and friends that had genuine concerns about PTSD or about, would I have to wear a mask or won't I have to wear a mask? And as the conversation continued, we started to believe that the folks that are saying, hey, if you are afraid or if you have underlying medical conditions or you're nervous, just stay home. And then we heard from people that said, wait a second, I don't want to wear a mask because I have underlying issues, or, I don't, and then there were comments from the other side that said, well, you just stay home. And they're entitled to that personal opinion, but I don't think the five of us are. I think we have to look at a bigger cross-section of the community and decide where do we fall. And I don't begrudge my colleagues on how they vote today one way or the other. I know that everyone has tried to really pay attention to this issue, but for me, I'm going to lean on the side of the feedback that I receive from people whose medical opinions mean a great deal to me, and from the information that we are hearing at the state level and at the federal level. I try to wade through the noise of all of the controversy, and I will second Commissioner Hurd's motion.
So I guess my turn. I guess I would start off with when I came in this morning, and it's always interesting listening to the comments and to the public, because it does really make a difference. What you say, we do listen to, we do process it. I think to Ed's comment where we try to keep a straight face so that we don't seem like we're prejudicing our opinions one way or the other. I think we all try hard at doing that, because you all deserve the opportunity to come to the microphone or to be read over the emails, the opportunity to express your opinion without assuming that we are going to move one way or the other relative to what everybody's saying. I will say this much. I came in this morning and I absolutely had a very firm decision in my mind where I was going to go on this vote. I, like all of us sitting up here and Stacy at home, have heard from lots of people. We will, all of us, well, maybe not all of us, some of us, will lose friends over this decision. This is a very black and white discussion. I have lost friends over my term of office over many decisions, and that's part of what comes with this job. You take this job, you understand that there will be days like this, although I would agree with Ed as well. I think in my entire term of doing this, this is probably the most difficult, hard decision that I've ever made. No question. Because the issues are both, for me, very compelling. And as I said, I came in this morning firmly believing that the decision I was going to be making today was already made in my mind, and I was more than happy and open to listen to people. But from what I had digested from everybody I've communicated with, and where you are or where anybody is on this issue, I was like, no, I think I have this down. However, this morning, after 2 or 3 hours of public comment this morning, I absolutely moved, in my opinion. And it really comes down to, I think, 2 issues. One is your right, people's rights to believe that that they are in this country have a right to do certain things, and that was made abundantly clear this morning. And on the other side of that equation is the right of those who feel that someone in our position or somebody in the governor's position or somebody in the president's position is making the right to protect us from issues that may be more far-reaching than we all can get our hands around. And so literally, this morning, I shifted 180 degrees. And I went in the direction of saying, and Ed, and this is where Ed and I are completely 180 degrees apart, at least in this morning's discussion. I appreciate the medical community's opinions, and I really do. And I may even lose a doctor over, depending upon how I vote on this. Because the medical profession is so, I won't use the hair on fire side of that, but I mean, they are very firm in where they stand on this issue. But you also have our public, who in my opinion deserves just as much deference or just as much importance in this decision as does the medical community. That can't be discounted. In a lot of decisions that get made across our country, it is absolutely this is my right, this is what I believe in, this is how I should be able to do my thing, and then there are others over here that say, no, sorry, the science or the rules or something should say this. And at some point in that discussion, someone has to make a decision and say, I'm going this way, I'm going that way. So that one was interesting. We broke for lunch, which was probably pretty good to do. Left, gave me some time to sort of start thinking about the entire process all over again. Talked to a couple people on the way. It was interesting. People were kind of reaching out and talking, and everybody has their opinion. Then came back in this afternoon, and we went through the 4 or 5 hours or 6 hours worth of our email comments. And the opinion shifted again. Because, again, it was really listening to what people were saying. And what was fascinating, and where this probably won't be helpful to anybody listening, one way or the other, I did keep track out throughout the entire day of where everybody was. I would say within probably 10 people, it's 50-50. So 50% of the people believe that there ought to be a mandate, and 50% of the people are, leave me alone, don't tell me what to do, end of story. And so, whatever decision or however I do vote on the motion, I will lose 50% of my friends, because it is that Black and white, there is no gray on this issue. Some very well-respected friends believe really hard on one side and really believe hard on the other side. I think, unfortunately for us as a community and as a state and as a nation, this is exactly what's happening to our country. It is ripping us apart. And I don't know that there's a really good return from this. And that's a huge problem. And if that's what I really pulled out of this morning's conversation, or comments from the public that came to the microphone, was that this isn't going away. And there are people that are very firmly believe that we are overstepping our bounds. And that is going to drive a wedge even further in our community than where we are today. So how do you make a decision? I mean, we have some commissioners that and fair enough, you all have your opinions, and you know, I don't believe that no matter what I say, I'm saying this because I feel I need to say it, I don't believe that I'm going to change Sarah or Ed's mind whatsoever. And that's fine. They're entitled to their opinion. They're entitled to how they got to their answer. But like Harold, I think, I am very conflicted in what's the right answer here. And unfortunately, for all 5 of us, no matter what we vote on, will divide our county even further, which is unfortunate that we have been put into this place in the first place. What's troubling is that for the counties that are listed that have passed an ordinance, I don't know how many have not passed an ordinance, or an emergency order, rather. What's troubling is that it's pitting even our counties or our ideologies against the rest of our 67 counties. And that we don't have state direction to say, well, we do have state direction. The state direction from the governor says we're not doing anything about this. We're not intervening as a state into that decision. We're putting it back on counties to make that decision. Fair enough, but that is driving a wedge for us locally. So I would say this much about the motion. One thing that I completely disagree with, and Sarah, I don't mean that you didn't do what you needed to do. This is what I'm going to say about it. The whole penalty side of this thing, I think, is incredibly problematic for me. I think the idea that someone, whether it's the public, whether it's a shop owner, whether it's another merchant or another competitor, is going to call someone of importance somewhere, and that maybe, depending upon what our sheriff, if that's the way we go, ends up having to enforce, is that we're going to start writing people fines or penalties for something that is mandated that a lot of people do not firmly believe in. I think that is going to cause just another enormous wedge for us. I think it's going to make people angrier. I think it's going to drive further apart. And again, I don't know how we recover from that. Stacy, to your point, there is no sunset provision, and again, I don't fault you for not having that. If I were to support what's in front of us, I would absolutely want to see a timeline that in 30 days we would sunset it, we would review it, and see if we've made any gains, strides, or not. And Harold, I think to a lot of the questions you asked about the Miami issues, I think we should know. I mean, there's a lot more probably data we should have on that. And the last part about this, I guess there's 2 last pieces to this. You know, this does come down, and I forget if it was Harold or if it was Ed that said this, but this does come down to trust. And who will people trust moving forward? Do they trust us? I would say based on the comments this morning, you know, maybe not so much. Do they trust the state and the governor? I don't know, maybe not so much. That's not good either. Because we pride ourselves, and regardless of where you are on issues in Martin County, on land development issues and other things that we do as a community, by and large, I think I come to work every day. I know our staff comes to work every day. we try to do the right thing and we try to do the legal right thing. We have a county attorney that goes to great lengths to keep us out of trouble and to also make sure that we do something that's justifiable, legal, and we can back up. And for that, I know a lot of our people that we deal with are very appreciative and love the place we live in because of that sort of standard. And then lastly, I think what comes out of all of this, not only have we divided and will we further divide it, it'll create a larger set of fear in people's minds. No matter what side of this equation you're on, if those that believe that we are stepping into a place that we don't belong in, the fear from that piece of the equation will say, well, what are they going to do next? What are they going to take from us next? And what are they going to impose on us next? The other side of the equation is, if we don't do it, the fear from that side is that more people are going to get sick, more people are going to end up in the hospital, and we will not have done our job, therefore neither one will trust us because of the decision we made. It's a really bad place to be in. And for those of you who, and rightfully so, that believe that your decision is simple, it's not simple. I think it's got to have a timeline in it. I think it's got, I'm much more supportive of having a sunset in it at some point. I think the provisions for penalties have to be taken out. If for those that believe that having a mandatory ordinance is going to protect us all, then if it's mandated, people will do the right thing. If they're not, somebody will tell them to leave the store or leave the place that they're in, and end of story. I know this isn't part of this motion, but I want to throw it out there because a lot of comments today were made about the beaches. I am 100% supportive that we should not close our beaches for Martin County residents. We did it once before. I am ridiculously troubled that we've done that, and I just don't think that we should close our beaches, and we've done it for Martin County residents before. If it's an overtime issue, if it's a staffing issue, I'm fully supportive of whatever it takes from the county to fund that. But on a weekend where people expect to want to be out and enjoying themselves in one of the last places, because here's what's equally interesting. If this mandated mask ordinance passes, I think what that says is we all feel good about ourselves. Not all of us, that's not true. For those of us who don't want masks, they won't feel good. But for those who believe that mandating masks are good, and that will allow us to be out in public and be safer, then why in God's name can't we have the beach open and wear masks at the beach if that's what the rule is? Because you have to wear the beach or your mask out in public. I mean, we're kind of almost contradicting ourselves by closing the beaches, but mandating masks, because we're saying that if we mandate masks, it'll be safer for everybody to be out and about in the public space. So I, for one, would certainly support not closing the beaches for the weekend. And I guess when the chair calls for the vote on what we're going to do relative to the ordinance, I'll make up my mind at that moment. Thank you.
In my mind, the beaches have nothing to do with the virus. Oh, I'm sorry. Go ahead. Well, let me finish. It's complete logistics. Everybody else is closed around us. We cannot take every other county in South Florida at Martin County beaches.
Yeah, but Harold, very clear, for Martin County residents, period. I didn't say for the rest of the state, Martin County, period.
The sheriff has indicated that's problematic for him. He
Yeah.
doesn't have the manpower for that. It's not an
only that,
overtime
is
issue.
The sheriff, every deputy's got to stick his head in somebody's car to see their driver's license. I'm not going to...
That's fine. I'm just sharing with you how I feel. And
I get it, but I don't agree with it. So I also disagree. I'm not done yet. I also agree with Commissioner Smith about the penalty enforcement part of this. I have no interest in giving somebody a criminal record over a face mask. I would much prefer it to be something that is more like encouraged, but we're crossing the line with me creating a criminal record on somebody. So Commissioner Heatherington.
Commissioner Heatherington.
Realize again. Can you hear me? It feels so detached being here but not being with you. So I had a list of things. And on Commissioner Smith's point on the beaches, I totally agree. And I would like to make a motion that we open Martin County beaches on Hutchinson Island through July 15th to Martin County residents only. Hope Sound Beach, which borders Palm Beach County and has a limited amount of parking, will be closed until Monday, July 6th, I believe that is. And social distancing shall be enforced. I believe that we could open our beaches on Hutchinson Island to Martin County residents for this weekend. So that is my motion on that.
There's a motion on the floor.
Yeah, we
You have to wait for that
have to
motion,
wait on that
Stacy.
one. Yeah. Stacy, you need to wait on that until we're done with the motion that's on the floor. Do you have a comment on
We were
that?
just, again, that's the hard thing about not being here because we were just discussing that, and then we shifted back to beaches and back to masks. So you want to wait till the end to take up the beaches?
We just need to get the motion off the floor that's currently on the floor. Commissioner Smith talked about it, but he didn't make a motion. So let's.
Okay, so I would echo some of, both of your comments. There's a lot of data that could be brought forward. Some of it's common sense. I see people, they're riding in their car with their mask on. You don't have to do that. You don't have to wear your mask, but perhaps you should wear your mask. And you should whenever you're in the grocery store to protect others. A lot of this is common sense, and it is a struggle. I agree with Commissioner Smith. What we're talking about here is, I think it subjects our law enforcement to an untenable position. How are they going to enforce this? The fact that there's misdemeanor penalties for it, we can do a lot more, I think, to gain compliance and engage our citizens. I'll tell you what, my 4 generations here in Martin County, someone said it earlier that Martin County is a unique and special place. It's my hometown. I don't even recognize it anymore. The issues of mask versus no mask, it's pulling our community completely apart. I love the people in this community, regardless if they support masks or no mask. And I think Commissioner Smith had it right. I completely agree with the medical community. People have valid reasons. People that don't want to put their children in masks, they want to make their own choice. I want everybody to be safe and healthy. I refuse to let a mask be the symbol that is a political divide and a cultural divide that tears our community apart. We have one common enemy, that is a virus. We absolutely, it's an issue that we have to address. We want our public to feel safe. We want our residents to be safe. We have one common goal. This divisiveness is just, it's the worst thing I've ever seen living in Martin County. We should be fighting against the virus, not against each other. There's a lot more I think we could do other than these misdemeanor penalties. I think there's a lot of education, and I'm not in favor of these penalties for our residents. I absolutely believe in wearing a mask, and ironically, as I sit here, we're in quarantine because my son was exposed to the virus at his job. So we're all in quarantine awaiting our test results. It's a serious issue, but we have to do something together, not divided. So I'm in favor of looking at anything except for these misdemeanor penalties. So.
Mr. Chair. Yes, Mr. Campy.
Ms. Woods, I'm not a big fan of the misdemeanor as well, but I did hear your explanation to Commissioner Heatherington, the difference between an ordinance and an emergency order. You and I have had an opportunity to speak during the week on this. Do we have an option? Because I'm not looking for people to have a criminal, in my mind, when we talk about a mandatory mask requirement. If you remember, originally I wanted to, as time has progressed, my position has had to evolve. But originally I wanted it to be for employees only. If you remember, I said the food services people, and I wanted signs put outside, which is some of the folks we're talking about today. And but I don't know if we've really seen, I've been out and about in big box stores and little stores and supporting restaurants in downtown Stewart and wherever else. I'm sure most of us have been trying to do that as much as possible. But I also have parents that are in their mid-80s. I've had a family member who've passed away from this, so it's personal for me as well, so I get it. But I don't know if we should make this a misdemeanor issue. You've had an opportunity to see what a lot of the other communities are doing. I watched the Palm Beach County meeting. One of their commissioners was talking about more of a civil infraction, but they also talked about sheriff's deputies having a supply of masks in their vehicles so that it could be more of an engagement, a reasonable engagement versus something. Now, here's my point. If someone decides, and we've all seen the videos of people that were trying to storm their way into stores without a mask. And we've also seen the videos where people, look, everyone's frazzled for a multitude of reasons. The virus itself, the racial unrest in our country. So I think most people are on edge already. So with that in mind, you start doing the mask, no mask, which is, like Commissioner Hetherington said, very disappointing that we're so fractured. My vision of supporting this would be that if we already have a 60% compliance, I've been trying to look around in the stores that I've been at. I'd say more people are wearing masks voluntarily than not. So let's say we pass the mandatory requirement today. Let's just say, I don't know if it will, but if we were to. And that brings in from the 60% already wearing the mask, let's say it brings in another 20% of the people that said, I was waiting for the government to make a determination. I personally wish it was at the state level. And I will tell you that many of us probably by now have seen that the governor of the state of Texas has just today issued an order for masks to be worn statewide for any county in Texas that has a positive count of 20 people or higher in the state of Texas. So he's done that. But we're here locally making these determinations. So I would like to see if we brought in another 20% of the people that would start wearing the mask. Now we're up to 80. Now you get the folks, and I like that you went very carefully through the exemptions and the exceptions, because for a lot of people, that will settle it for them. They have a real passionate concern for their own health and safety, which I get, and all of the rationale, PTSD or victims of crime or breathing issues. And I also understand that not everybody wants to show a note to the cart boy at a supermarket before you can enter the store. So I think what we need to do is talk about that there has to be some calming down of the emotions. If someone comes into a store and says, I'm not able to wear a mask, I get it. Maybe that's 10% left. So if we go from 60 to 80 or 85%, I think our mandatory requirement today reaches its goal. I'm not personally looking for 100% compliance. There are plenty of people that have very legitimate reasons why they can't do it, and they should not have to wear it like a Medi-alert bracelet on their wrist. So I agree with my colleagues. I'm not interested in a misdemeanor. Do we have the ability to craft some type of language that would exclude a misdemeanor?
I don't have the ability currently to do an emergency order other than what the current state law does and what our county ordinance does. So those are the way they're enforced. That being said, and I know our sheriff will of course enforce the order. The idea of the enforcement, of course, is that we trust in our law enforcement that they would do this with the board's expression of how it would be enforced. I suppose we could take the section of the misdemeanor penalty. What I want everyone to understand is, this doesn't mean that if a citation were written, that it would mean you automatically have to pay $500. That isn't the way it works. It isn't the way works when you get a traffic ticket. You still go to court, and you still would have an ability to have your due process and to explain. So assuming for the sake of argument, someone, and that isn't optimum, I understand that, and I know we don't want citizens having that, but if law enforcement were to issue a violation, they then would have the opportunity to go to county court or whatever does misdemeanor, it's not, maybe circuit court, to have that hearing and to explain to a judge and have their due process. So this isn't automatic. It's not, that's not how it works. Whether or not we can just use a fine, a misdemeanor fine, and not put the penalty, I mean, the statute says, the statute, according to R, shall be enforced in accordance with 252, and it's a misdemeanor. 252.47 is the fine, up to $500, and 252.50 is the misdemeanor.
So can you leave out the 252.50?
I don't know.
To me, what I would like to see is obviously a de-escalation of a situation where a sheriff's deputy was called to engage a person. The only time I think that it would elevate itself to something that would have the responsibility of a deputy to have to really push this to the next level. I believe, like the sheriff has said to us in this room in the past, most of the time when a uniformed law enforcement officer shows up, 99% of the population is going to be like, okay, I understand, and they can de-escalate this situation. If you get pulled over for speeding, and it's exclusively speeding, the officer can write you a ticket. Now, you might say, I wasn't speeding, or I have a reason I was speeding, and you can, like you said, Ms. Woods, then take it to the next level and figure it out. But that's all I would like to see it to be, unless it was a situation where someone refused to leave private property and turned it into a situation and started questioning the deputy's authority, legal authority, then that's a different situation. We're not talking about masks anymore. We're talking about someone that has escalated it with law enforcement beyond just a regular interaction. I had asked you to take a look or find out if there was any history already within just the short week that Palm Beach County has been doing it. They have 1.5 million residents. I mean, it's a big county. I wonder how it's been going. But I would feel more comfortable if, like when you mentioned the two different state statutes, one is for a fine and one is for, a misdemeanor. If they are separate and we have the ability to just put in one and not both, I think you might see some more support and ease some of our residents' reasonable concerns that this is going to get out of control. My ultimate goal here is to keep small businesses open so that we don't have as many increases that the governor has forced to make a decision where he starts rolling back his opening orders, because the worst thing that can happen in Martin County is when our small businesses are closed. That's the worst. So if wearing masks by the majority, not everyone, of our population can keep small businesses open, then we've had a success today.
We could craft language that would encourage, of course, we cannot require the sheriff but to provide the county's preference that should persuasion, I don't know if I've got the language up there, that should education and persuasion not be achieved, that we then, and the dangers of not, however, in the event voluntary compliance is not achieved, we could say that we request, and I don't want to have to craft the language on the fly like this, but you could give me direction. We could say that it is our preference that the charges be a monetary penalty under Section 252.47, as and in the last degree, the other. I just don't have, I
And
can't,
removing the misdemeanor completely?
we can't remove the misdemeanor. 252 by
Right.
definition is the 252-47 is by definition, it's a misdemeanor. I mean, that's what they are. The only alternative that I can give you, yes, if you're convicted, not getting the citation, is that it's only if you're convicted. What I want to point out with Palm Beach County is they have the ability in their emergency management ordinance to have civil citations, code enforcement, for violations to be, it was already in their emergency management document. We didn't have that in there. I've been here a long time. I've never had a need or ever had that challenge here. So we did not have that in our ordinance. So using the emergency order, we're under Florida law stuck with what the Florida statute says, and we haven't added something in another layer into our code. Now, but it's a misdemeanor by definition. I've got an attorney looking into it, but I don't have that. One thing I do want to mention, and I just want you to know, the reason that we tied the validity of the order to the emergency declaration was because in Palm Beach County earlier this week, one of their they have a sunset clause in theirs, and that was one of the basis of the challenge to the emergency order, because in general, emergency orders are tied to the declaration of local emergency. Now, that's not always true because, for example, our beach closure was tied directly to what was posed because of the other counties closing their beaches during a distinct period of time. I'm happy to look into it. I can't give you the answer at this point, but it would still be a misdemeanor penalty, not a jail time, if they were found guilty.
I just wanted to say that the first sentence in the enforcement says that it is the intent of this order to seek voluntary compliance with the provisions contained herein and to educate and warn of the benefits of compliance and the dangers of noncompliance. That's de-escalating right there. You can't be more obvious. It is the intent of this order to seek voluntary compliance. We're not going after people with nightsticks for not wearing a mask. We're going to, if somebody is being bold and not wearing a mask, or we will say, please, you know, these masks are, we have a mandatory mask wearing requirement here. Could you please go, do you have one in your car? Can you please go get one? You know that our sheriff's department is not going to go in heavy-handed with this. And I think that this language gives us that confidence.
It's unfortunately not what it says.
That's what it says.
If it was
That's
the
what
first-
that's
no,
what
it
the
doesn't.
words say.
The first sentence, exactly. And if we
Yeah.
stop there, I'm in. However, we can't stop there, apparently. Go ahead, Mr. Smith.
Can you, and Sarah, I agree with you. I don't believe that our sheriff is going to go out of his way, nor is his department going to go out of their way to enforce in a strong arm way. However, whatever goes wrong, whatever happens, I cannot in good conscience believe that I approved something that is going to end up with a Martin County resident in front of a judge for not having a mask on. I just, and I know the severity of those that believe that this is like the very best we can do to curb all of this, but I am concerned that that's what will end up happening. And I guess, Sarah, so, you know, the alternative is an ordinance. And the alternative in the ordinance is that you would have someone like code enforcement, which We are not staffed up on a code enforcement level to manage the entire county with all of the instances that could occur one way or the other. But in the ordinance, you wouldn't have the penalty side of that other than they could, right? Code enforcement could write a code enforcement infraction.
In general, however, for example, a animal control citation, which is a violation of our code, as well as a parking ticket, you also end up in in front of a judge. When the infraction is written, our county attorneys out of our office appear. They get a notice to appear, and they show up before the county judge when that's written.
So can we take
That's a
that
violation of county. George, whether or not this could be heard before a code enforcement board, if that's what you were kind of referring to, and I don't know that that's what this.
So under any circumstances, I can't imagine that we have somebody end up before any board, judge, any something, defending themselves, feeling that they need to get an attorney because they didn't have a mask on. And I know that's overly simplified. I get it. I can't see it. I can't.
Commissioner Heatherington.
I guess I would just reiterate, encourage is certainly the language in there, but it leaves law enforcement with almost impossible interpretation. Maybe one, deputy is more strict and gives citations. Therefore, they go to the court for a misdemeanor. Maybe one deputy is not. It says clearly in there that the penalty is a misdemeanor. And I think an ordinance or some other language or document would alleviate that. I'm not in favor. I'm in favor of educating, not with a misdemeanor in place. It puts law enforcement in an absolutely impossible situation. That's all I have.
I think it's time to call the question.
Well, Sarah looks like she's doing something there.
Well, I've got folks in my office looking at this, and they're saying that, I think we could, I do believe that we could say, because the statute provides the order should be enforced pursuant to other statutes, we could just include the statute that provides for a monetary penalty. I understand that's but it takes the jail penalty out of that. And I'm looking at it, our emergency management ordinance just says that it should be enforced by law enforcement. It's really up to you. I know that there are other counties that don't necessarily put the enforcement provision in their emergency orders, but I'm telling you that under 252, which is what an emergency order gets its lawfulness from, the state law provides that it can be enforced as a misdemeanor, either by fine or by incarceration. If it
Can or must?
Can. That violations can.
Okay.
Can I ask one more question?
Please.
Sarah, and I know there's been some discussion because of some other issues we have with our emergency management ordinance. Is there anything we can do in our emergency management ordinance if we were to rewrite that spells out how we would handle a special emergency order outside of the parameters of what the state law directs us to in the absence of having emergency management orders? So if we had an ordinance in emergency management that called out and said, if you are to, under a declaration of emergency, you can pass an emergency order.
And it may be, if you had a provision in your emergency management ordinance which authorized enforcement through your which authorized that violation would be a county penalty, then we can enforce it through the county as a violation of a county ordinance as opposed to a state law. But again, any violation is going to, because we're the United States of America and we have due process, we issue a citation and then you go to court.
Right, but in that instance, couldn't it spell out a strategy that said your first occurrence was a warning? Your second occurrence or whatever was a
Certainly.
penalty up to $5 fine or something. You could spell that out. It wouldn't leave it at this somewhat open-ended, it could be from here to here, or it could be even jail time. But that has to get done through our emergency management ordinance.
Can I ask just a question? Because I think I know where you're going. So I know, Sarah Woods, I've heard you say that the board during this emergency declaration has the ability to do an emergency ordinance. Does that also give them the ability to modify our existing emergency management ordinance to do what Commissioner Smith is asking?
Yes,
it
you
allows
can do
us-
an emergency ordinance, but I don't have an emergency ordinance here.
Right,
have to-
I understand that, but it would allow us to step out of the state not guidance, the state laws that are driving you to the language you have. At least if I understood you correctly, we could create our own ordinance as a county ordinance and then spell out what that procedure looks like in that ordinance, that if we were to invoke an emergency order under our ordinance, we wouldn't be using the state 251 or 215, whatever applies.
You would be, what you would be doing is you would be crafting the penalty within the parameters of our code of ordinances, not under
Right.
252.
And that way, we could set those parameters as how we chose to set them versus being governed by the state law.
I believe so. I might have an alternative. Let me just, because we have added language about intent to seek voluntary compliance, to educate and warn of the benefits and the dangers, we could craft language in to say that, the first violation would be a warning, that for a first violation would be a warning. I believe Palm Beach County has some language like that the first instance would be a warning. I hesitate with this because these requirements are being put on the sheriff and other law enforcement, and I haven't talked with him.
Right, but that would give him the latitude.
He has that latitude.
I know, but but we're not being governed or driven by the state law at that point, which puts us in a box that I'm not comfortable with, and maybe one or two others aren't comfortable with. And so if there was a way for us to write our own emergency ordinance, or rewrite it, or add language to it, we could define how we wanted to. And that could give guidance to the sheriff as to what that would look like. Similar to, and I have no idea what governs the sheriff's law one way or the other, but I assume that a deputy, when they pull you over, have the ability to give you a ticket or a warning.
Absolutely.
I don't know what governs all of that, but somewhere along the line, you're given the ability to do one or the other, or nothing.
But the law enforcement has that activity, has that discretion
I
in
understand, but that's what I'm
how
saying.
they
If-
enforce the law. That's part of his constitutional role as the
Right,
sheriff.
but if we crafted that language into our emergency ordinance, then the sheriff could use that as guidance and backdrop versus having to follow the state law under the emergency declaration.
If we are, we're really getting into the weeds here. If we were crafting our emergency management ordinance, if it was a violation of the county code, we would more than likely, if we're just making it a fine, we would have enforcement under the, it could be the sheriff could enforce those violations. He has agreed to enforce our He has a parking unit, and he does our parking, and he does that. We could
Animal control,
perhaps
we
could
turned
have,
over.
it just, whether or not changing the emergency management ordinance as an emergency ordinance meets the criteria, I suppose so, because you would do that, and then you would then have to craft another emergency ordinance regarding faith. No, I guess you would want to do an emergency order then at that point.
So can I point out something? Ralph, I don't know where we're at. I've lost track of time with our thing. Would it help to take a 10 or 15-minute break
it
to
Yeah,
kind
and I'm not
of
sure-
gather
I
your
am-
thought? I see smoke starting to come out of your ear, so I'm thinking that maybe we take a breath here for a minute
Okay.
would help you.
Okay.
All right, and that would also help Ralph, and everybody's happy. So let's take 10, 15, how much you want?
10.
10? Okay.
10.
10-minute break.
Thank you, Harold. That was a lot.
Back, everybody. Ms. Woods.
So, I have a proposal or just an attempt to try to meld what the direction was given the existing emergency order. So it would begin as it is currently. It is the intent of this order to seek voluntary compliance with the provisions contained herein and to educate and warn of the benefits of compliance and the dangers of noncompliance. Any persons violating this order shall be given at least, and it could be one, it could be more, warnings prior to enforcement pursuant to Section 25247. However, in the event voluntary compliance is not achieved pursuant to Section 515, that's our emergency management county code, this emergency order shall be enforced by county law enforcement agencies in accordance with 25247, which is the 252, but then it goes on to say, violation of this emergency order is a misdemeanor of the second degree and shall be enforced pursuant to Section 775.083. That's the portion of the misdemeanor that's just a fine.
Okay.
So under the emergency management ordinance, the statute, a violation of an emergency order under Florida law is enforced as a misdemeanor of the second degree. A misdemeanor of the second degree has two components. It can have penalties once convicted. Again, once convicted, tried and convicted. One is up to 60 days in jail. That's one section. And there's another section that talks about an up to a $500 civil or a $500 penalty that you have to pay up to $500. So the one that is listed in the proposed order is the one that talks about a payment of money. It takes the jail out. The other change was to allow a warning, to require a warning prior to any violation being issued. Well, first is it's voluntary compliance and education and warning, and then we also layer in a warning prior to any, that would be by law enforcement, to warn someone. A warning doesn't carry any penalty to it. You're just advising people officially. I believe we did when the seatbelt law first was passed, that there were warnings issued to advise people when they weren't complying.
Is the warning a written warning or a verbal warning? You know how sometimes they say, I was going to give you a ticket, but instead I wrote you a warning? How would you track
I
warnings?
think that's up to you if you want them to.
No,
issue
we have a sheriff's deputy here. I'm just wondering if a warning is a written thing where you're getting a copy of it, like it's a little more than, hey, I'm giving you a warning.
Yay or?
Yeah.
Go ahead. Yes. Go ahead.
It doesn't. In this change, it's just a fine.
No, but it's still a misdemeanor. It's a misdemeanor.
That doesn't
but
help.
that's
Fine with no jail time.
with no jail time.
Okay,
It's
just
still a
fine.
misdemeanor. If they were convicted, it would still be a misdemeanor. If they've been warned and they've got a,
So it's a misdemeanor, does it one year record? It's a misdemeanor.
yes.
So at what point does it become, when does the misdemeanor become attached to you?
When you've been at the end of court. When you have been judged guilty of it and the court enters an order.
Okay, so
Against you.
there's absolutely nothing that attaches the misdemeanor offense or the designation to you when you are given the warning or when you are issued a citation?
When you're charged, you would be charged with that, but then you go to court and you either are found guilty of it, then it's on your record, or you're innocent, and then you're not.
Okay.
Commissioner Heatherington, did you have something to say?
I'm trying to find the raise the hand button, but my honest question is, how do you expect the general public to interpret this and understand what they do or have to not do when there's 8 of us are having this discussion back and forth? How do you expect the general public to understand it when we're having a hard time interpreting it? So I just think misdemeanor is not an option. That's all.
So he was going to answer the question of the,
For the record, Deputy Sheriff Andrew Pine, Martin County Sheriff's Office. I do feel compelled to say that, I'm not authorized to speak for the sheriff or on behalf of the sheriff's agency. I can only speak to my experience.
That's all we'd ask. Thank you.
The question for Commissioner Campy was for warnings. In my experience, when we write written warnings, I don't believe they are tracked. We do have the option of giving a verbal warning or a written warning.
Mr. Chair, may I ask the deputy another question? Just for the clarification's sake here, and I appreciate it, and I'll speak to the sheriff and say we asked you to come up because you're the guy here representing law enforcement. I understand we put you on the spot. You said that, and I've seen it happen, that you could write a written warning to a young driver that might have gotten pulled over speeding. But the concept that we're discussing here is that if we were going to issue 1 or 2 warnings prior to the escalation that might be a month apart, okay? Someone that's taking a stand on the fact that they're not going to wear a mask in a public place, sort of, pushing against what we could potentially do here tonight. Those 2 warnings would mean something, because for me, I'm not looking to throw the book at someone either. But if we create a mandate that has no teeth in it, has no real, what's the word I'm looking for?
Consequences.
Consequences, thank you. If it has no consequences, and we haven't really accomplished anything, because most people will be like, I'm out. So if it's a 2-warning process, and then you've gotten to the 3rd, we've basically given every citizen in Martin County, okay, look, we understand you didn't have a mask, you didn't want to take a free mask that the store or the deputy could have given you brand new, and you still decided, then you get the warning. And then 2 weeks later, you get another warning. We'd have to have the ability to track those in your system.
That's correct.
And so do you feel that if you wanted to track those warnings, that is an option? Or do you just write them in your own personal book, and at the end of the day, that's it?
The way it works, there's 3 copies. There's a white copy that goes back to the records department. The pink copy we keep, and then the yellow copy goes to the driver, the offender. As far as I know, traffic tickets, citations are tracked. They're numeric, they're numbered, so we know where those go and what they were written for. As far as the actual warnings go, whether or not they're tracked, I don't believe they are, but I don't know for certain.
Does it have a control number on that warning?
They are numbered, but again, I don't know if there's a system in place to track the warning citations.
But we're entering new territory every day as we progress with this. I'm just trying to run through the scenarios to see, what we could come up with that would pass, because I don't know where we are currently. Thank you very much. I appreciate it.
Yes, sir.
And your service.
Question line's up there.
One more.
go ahead.
Yes, ma'am.
So my question is that if you were to find someone in violation, is it at your pure discretion whether you find a warning, a written warning, a verbal warning, or the maximum violation? Is that at your discretion?
It depends.
Or are you mandated to do a verbal warning and then a written warning and then proceed forward? So are you mandated to go those 3 steps, written, or verbal, written, then citation, or do you have the discretion to go straight for the citation?
Because law enforcement is such a gray career, a gray area. the only thing I can relate to this is the traffic. And yes, generally, when we enforce traffic laws, we do have a wide discretion. Once it starts getting up into the felony area, that's where our discretion starts. The higher the crime that goes, the less discretion we have. But as far as something like speeding or something that is a civil infraction, which generally is what traffic is, we do have a wide array of discretion. As to whether we give them a written warning, a verbal warning, or a ticket is generally up to us.
Okay, thank you.
Any other questions?
I think we're good.
Okay, thank you.
Well, as Commissioner Campy was saying, is, I get the no teeth thing, but we're talking about passing something that people will comply. Not 100% people will comply, as he said, but I'm still hung up. I am not for giving somebody a criminal record over a face mask. I mean, I think that's where my line's at here. The rest of everything that we got going on, I think is 100%. I think the people that, at least half the people, if they actually read this and saw especially the medical exemptions, they couldn't, it's pretty logical, right? But that's where I'm at. I don't know if we want to call a vote. Okay, Commissioner Hurd?
Yes, call vote.
Or I'm willing to change my motion to alter it to be similar to what Ms. Woods suggested an alternative might be, which is there's a warning issued, and then there's a fine. It's subject to a fine, but not to time in jail. So it's not subject to 252.5, but rather it's section something else.
No, I swapped it, and I apologize.
Okay.
It's 775.083 is the misdemeanor fine.
Fine.
And that's what the language, the 252 is not it. It's
Okay.
773. Yes, ma'am.
And there was a sentence that you inserted about a
Any
warning.
person violating this order shall first be given at least, warning. Oh, wait a minute. Here, breaking news, I've got some more. Any person violating this order shall be giving a minimum of one written warning prior to enforcement pursuant to 252.47, and then it goes on to say violation of this emergency order is a misdemeanor of the second degree and shall be enforced under 775.083 Florida statutes, which is the
Fine up to $500.
Yes, ma'am.
I have no desire to incarcerate anybody either, so that's my substitute motion with that language. Amended, yes.
Commissioner Smith?
I'm going to try this, and it won't make anybody happy, but I'll try it. I'm going to make a substitute motion that we ask staff to pull out the emergency management ordinance that would give us an entirely different ability of structure to take the misdemeanor. You could take the misdemeanor clause all out of there altogether, right? If we were to redo our emergency order, our emergency management ordinance.
I would ask that we not necessarily do that, because in another circumstance, perhaps in the situation of a hurricane disaster, and we had looting, and we wanted to,
Right, but couldn't you define,
you can put an alternative, yes, sir.
could you not define in there, under hurricane standards, it's X,
Yes.
under all other declared emergencies, it would be Y?
I was speaking because you said take it completely out of the
I'm sorry.
emergency management ordinance, and I would be reticent to do that.
No, if there was a way to divide or set up categories of what would apply under certain circumstances, I would be way more comfortable that it would take the misdemeanor portion out of this thing. And it doesn't sound like what you just said to Sarah that we can do, I'm sorry, the Sarah Wood said to that Sarah Hurd, that you can do that under the other scenario. And I know that that would take a couple more days for you to pull that together, because that's certainly not going to get done tonight, and you certainly don't have it with you tonight. But I would be, we have a commission meeting Tuesday, correct?
Yes, sir.
No, it's a workshop. I don't want to do it again.
Call it a special, call it a
You can
emergency
vote on
meeting
it.
or a special meeting.
It's an advertised meeting that is, whether it's a workshop or not, you can vote on
Well,
ordinances.
typically, we don't take action at a workshop.
I want to do it.
I don't know that we ever redefined workshops as, because years past when we had workshops, we voted on stuff all the time.
Get your rules of procedure. That may be in our, that may not be in your rules of procedure. Here we go, 17.
Did you second my motion?
Not yet. He had his light on, so I was waiting to hear what he was going to say.
This is for cancellation of board meetings.
Agenda items for various county departments that require discussion by the board, but no vote. That's in the rules of procedure.
Where, what page are you on?
A 17.
13? 17?
Number 9.
Please. Yep. So we would have to we would probably have to, in order to meet the notice requirements, we would have to have
Sorry, you have
either,
to speak.
I'm sorry, we'd have to have a special meeting. Well, now, we have a meeting next, we have a meeting Tuesday, and we have another one on Friday, a COVID-19.
Can we do
meeting.
both? Can we have the meeting on Tuesday, since we've already told the Hope Heights folks we were going to do workshop, do that in the morning, and then call a special meeting at 1:30?
I'm not sure we can meet the notice requirements because of the holiday. I got to have at least,
I'm not sure, Commissioner, Mr. Chair, may I ask Commissioner Smith a question? Sure. Is your intent that we bring this back up Tuesday and we're not going to create some kind of a policy tonight?
Well, yeah, she doesn't have an ordinance with us for the emergency management ordinance. She can't do it on the fly. There's no way that that can happen.
Agreed.
And, you know, I am very uneasy with this whole, I'm sorry, what's the word? Misdemeanor stuff. And it's tied to state law, and unless you can separate it out from state law, which Sarah Woods has said to us multiple times, you can't. However, if we redo or reword our emergency management ordinance, we could create the set of rules that would apply to how this would be enforced, and you could mandate your masks, but the enforcement side would be how we describe it in the ordinance.
Thank you. Ms. Woods, can I ask you to restate the information that you gave to Commissioner Hurd that she made a motion to the effect of, please?
yes, it was to add
Can
to
you speak up?
section 5. It was to add to the existing section 5, so the first sentence would remain the same, and then it would state, any person violating this order shall be given a minimum of one written warning prior to enforcement pursuant to 25247. That's the emergency management ordinance. However, in the event voluntary compliance is not achieved, this emergency order shall be enforced by county law enforcement agency in accordance with 25247. Violation of this emergency order is a misdemeanor of the second degree and shall be enforced under section 775.083, which for everybody's benefit, is still a misdemeanor. I want everybody to understand that, but the penalty attached to it is just payment of a fine up to $500.
For my colleagues, I'd like to run a scenario. Someone decides they're not going to wear a mask. Not that they're missing it or forgot it, or they're not going to wear a mask, okay? So they go to a store and they're not going to wear a mask, and the employees or the owner says, look, you can't, we have a policy, you have to come into the store wearing a mask. The person says, well, I'm coming in anyway, or they came in with a mask and they took it off because they're making a point, okay? Sheriff's deputy is called. Now, the sheriff's deputy came, and we heard from one here that they do have a decent amount of leeway and discretion to try to de-escalate that situation. As the sheriff has said in this very room, quite often, no matter who the person is, when they have the interaction with a uniformed sheriff's deputy or anyone from the sheriff's office, that normally can settle it down for almost every single person. But if they still choose that they're going to make their point, the sheriff's deputy would issue a written warning. Okay? That is the end of that specific situation, unless it goes to a different breaking of a different rule or law. You know, public disorderly conduct or refusing to exit a store, whatever the case may be, they got a warning. Now, the next time the same thing happens, next day, week later, same person, deputy is called again, issues a second written warning. You said one, but it could be two if we wanted it to be, correct?
Yes.
That's a second written warning. Now they come and they're doing it again. Now they're going to be issued that official ticket, which would then require them to appear in court. And they would then have to plead their case. And if the judge says, look, after all of the set of evidence that we see here, it looks like you were doing this on purpose, and I'm going to find you guilty and charge you $25, $50, whatever he decides. There's a long lead up to that occurrence in the courtroom. There was a lot of opportunities there for a person. Anything less than that is mandatory in word only. It has nothing. So if Commissioner Hurd is okay with two warnings, two written warnings, I'll second her motion.
Okay, so we have a motion on the floor that I
No, we
can't.
don't.
No, we don't?
We have to figure out whether I'm
Oh,
okay with that.
that's right, okay.
I don't know. Do you want compliance? Do you want people to wear masks, or, I don't know.
Well, here's the thing. If the word leaves this room tonight that the commission, if it does happen, look, you need three of us to agree. If three of us agree and we make this mandatory, the information that leaves this room to the general public is that the commission made the masks mandatory, as they have in Palm Beach County and South Florida and all over the state of Florida and many other municipalities in the country. Most people will be like, okay, if 60% of our population, and that's just a number that I'm picking, anecdotally, 60% of the population is wearing it as a recommendation. Remember, we made a strong recommendation, and now it's mandatory, and we gain 20 more percent of our population. Now we're at 80%. Those are the people we're trying to capture. If the other people, there's a medical list of medical exemptions, so it's not like we're trying to punish people that have a medical issue or some other reason that they cannot wear a mask. I'm not looking to punish our general public. I'm looking to bring this somehow, as much as we can, a handle on the coronavirus, and give people that are afraid to come out some more reassurance that we're taking this issue seriously. I don't want to criminally punish people, but after a conversation with the sheriff's deputy involving de-escalation and then two written warnings and then the ticket, I think that's covers what we need to do, because without three votes, we've accomplished nothing. After an entire day at this, we've accomplished nothing if we can't get three. And I don't think any of us are doing this gladly. None of us brought coronavirus to the community, but I think it sends a message that we've made it mandatory. Our goal is for
Against my better
compliance.
judgment, I will agree, even though I think that it waters it down ridiculously.
I'm
Well, I'm your second, so it's not, I agree with you, but we're trying, leaving with nothing, we've
Okay.
accomplished nothing.
Let's call the question.
Still a misdemeanor. Commissioner Heatherington?
I guess that was my question. It's still a misdemeanor. The warning is discretion at best. Is that
Yeah, still
correct?
a
It's
misdemeanor.
still a misdemeanor. Okay. I'm good.
Okay, we have a motion on the floor by Commissioner Hurd, seconded by Commissioner Campy. All in favor?
Aye.
All opposed? Opposed. Okay. Motion fails 3-2. So back to your proposed motion, Commissioner Smith.
Yeah, I would restate my motion that we ask staff to come back to the next available meeting, which would hopefully be Tuesday. You say that we can't do it. I just,
There are notice requirements for an emergency meeting, even if it's an emergency meeting, and that is problematic for,
Well-
you know, if we got it out Friday,
is this,
meeting is on
so is
Tuesday, we may be
Tuesday,
able
is
to.
Tuesday an emergency meeting or is it something else?
Okay, Tuesday currently has been noticed as a workshop, and under your rules of procedure,
Okay, well, that's
no
another thing
action.
that's got to change because that's really stupid. And this is why we didn't do this years ago, because when you need a meeting, and we're bound because it's a workshop versus a county commission meeting. Me personally, I just think we didn't used to do that, and I don't know when we changed it, but we voted at workshops all the time. But I don't disagree that the language is there, but now our hands are tied until we can advertise a public
I'm
hearing.
not sure your hands are tied. I would, oh, well,
Commissioner Heatherington?
Yes, ma'am.
Not do an emergency meeting in the afternoon following the workshop? I mean, we have, if today is Thursday, we have,
you may have enough days. You need to give a no less than, I believe the statute is at least 48 hours. So if we had it out tomorrow, which is a
the
Friday.
workshop for the afternoon for Tuesday.
Yes.
I didn't know if you were free.
Emergency meeting.
Yeah, you would have advertising by Friday and then again on Monday to turn the afternoon into an emergency meeting.
Then I would amend my motion, or I would make a motion that we ask staff to advertise an emergency meeting for Tuesday afternoon following our workshop of Tuesday morning for the purpose of discussing the emergency management ordinance to make revisions to the ordinance that would allow us to write or craft a mandatory mask program, but without misdemeanors or penalties.
Without penalties? No fines? That's what we have now.
No, you don't.
No, what we have now is we strongly recommend.
No,
That's
it's
what
not.
you're
Mandatory,
suggesting
Sarah, there's a
again.
difference between the word mandatory and strongly encourage. Yes, ma'am.
I just need a clarification on your motion. Are you asking for staff to bring a draft emergency ordinance regarding the emergency management, amending the emergency management ordinance, or you just want a discussion?
No, if you can, I would be prepared so that, to Ed's point, we don't do this again, that we would be prepared to vote on or have something to vote on for Tuesday. But I believe also in there, Taryn, you also have the need to address some other issues that have recently arisen relative to the structure of
sure.
emergency management. So we could do all that at that time as well.
Same time.
Sure. And then just from a procedural standpoint, so everybody understands, we would, if the board passed an emergency ordinance, amending the emergency management ordinance, that requires a 4/5 vote because it's an emergency ordinance. So it requires by law a 4/5 approval of that. Once that's filed with the Department of State, then you could take action on an emergency order should that be the will of the board concerning face masks. I'm just taking it to the end of the...
And I would tell you at this time, so that the two that have the motion, the other motion that didn't pass, I am more than happy to support that if the misdemeanor portion comes out, and I am more than supportive of moving in that direction.
I concur. So we have a motion and we need a second. I'll pass the gavel, and I will second Commissioner Smith's motion. Who's the chair? Oh. Vice chair. Oh. I'm sorry, I'm sorry. I'm confused. Yes.
She can't see. I don't know.
You're in charge now, Commissioner Heatherington.
Okay, so we have a motion on the floor by Commissioner Smith, and that's to bring back language for an emergency ordinance and an emergency meeting on Tuesday afternoon. Seconded by Commissioner Jenkins. All those in favor say yay.
Aye.
Aye. Opposed?
Opposed?
Approved.
Motion carries 3-2 with Commissioner Campy and Hurd dissenting.
Commissioner Campy.
Mr. Chair, the reason I oppose the motion, not that I won't participate on Tuesday, is that, as many of our residents have said, we discussed this last Friday to get to today, and days are passing, weeks are passing, and I was very hopeful after it is officially 7:45 p.m. that we would have crafted some language that we could have sent out into the community today for the weekend and for everything else. So I appreciate the idea, and I will participate on Tuesday, but we brought, 300 or 400 comments for up, for, and against, and we didn't accomplish anything today. I'm disappointed.
Commissioner Smith.
I would respectfully disagree. I think the public allowed us to have, it certainly allowed me personally to have a very broad understanding of where our public is at. I don't think you can get to where we are at 7:45 tonight without having to go through what we went through today. I very much appreciate them hanging in and doing that with us. And secondarily to that, I would like to make a motion on the beach issue that we would support leaving for Martin County residents the Hutchinson Island beaches open for this weekend and close Hobe Sound because of its proximity to Palm Beach County and to the southern counties that clearly we had that same issue in the past.
Made that motion already.
I'm sorry? I'll second your motion.
Made that motion.
I'll second Commissioner Heatherington's motion from earlier.
Excuse me?
I believe this is a new motion. We can control Commissioner Harrington that.
Oh. Commissioner Heatherington, make the motion again, please.
I'll withdraw my motion. Let Stacy make it because she made it earlier.
Either way, we get to the same objective. The motion was that we would open the beaches on Hudson Island to Martin County residents only, July 3rd through to July 5th. Hobe Sound, because of the proximity and the parking, would be closed. And they would reopen Monday, I believe that's July 6th. And strict adherence to social distancing.
I'll second Commissioner Heatherington's motion.
Okay, Commissioner Campy.
No, it's on a different matter.
During the break, I had an opportunity to speak to the sheriff, and although obviously he is his own independent elected constitutional officer, we do work very, very closely with him. He said that whatever we would request of his department, he would work very diligently to make that happen. However, he said that a majority of the onus of literally checking the identifications and interacting with people within the vehicles that are going to come here in hordes for a 4th of July weekend would be on our Parks and Rec and other county staff members to interface with the general public. A sheriff's deputy would be in the vicinity, like right in the area, but won't be doing the actual work. So we're basically asking Ms. Krista with 1 day's notice to rework our entire Parks and Rec staff to make them work through the 4th of July weekend. The sheriff also told me that he believes that if we were to open the beaches in Martin County, we would be the only beaches open from the Keys to Fort Pierce, which would leave us in quite a spot for people that were going to try to come and get past that system of having licenses checked. I find that we're putting our staff and the sheriff's office in a tight spot. I wish we could keep the beaches open as well. I understand that it is the 4th of July and people would like to do that. I don't make that decision easily. It was the first thing that I asked Ms. Krista when we talked about it. St. Lucie County has also closed their beaches, so people will come from the north and the south to try to get onto our beaches. I think, under the set of circumstances, having a 3-day break, it's a terrible idea, but we're in a terrible situation, and we would be creating potentially quite a problem. I can't support the motion.
I would agree. Commissioner Hurd, do you have anything to say on this?
Not on this, no.
Okay, anybody else? Okay, we have a motion by Commissioner Hetherington.
I have one thing just to say. We just had about a 6-hour long conversation on enforcing a county-wide mask mandate. We're talking about 4 beaches. We have park staff. We've done it before. We've implemented where Martin County residents, the Sheriff's Department has done it before. With it, certainly we could do it for the 2-day period. We're talking about, today is Thursday, we're talking about Saturday and Sunday, keeping those beaches open Friday, Saturday, and Sunday. And we're talking about a provision that doesn't have any sunset countywide to implement these mask provisions, and we're saying we don't have enough enforcement to implement a beach for our residents. I respectfully disagree, and I respectfully disagree that the ordinance, we asked for an ordinance to come forward last week, and we could have had that provision this week on mask. So I just humbly disagree.
Okay, we need to go. Okay, once again, we have a motion by Commissioner Hetherington, seconded by Commissioner Smith. All in favor?
Aye.
Aye.
All opposed?
Opposed.
Motion fails 3-2.
Now, I have another question, and that is that the meeting on Tuesday, I hope is not a repeat of the meeting today. So I would ask that now that we have the availability of Zoom, and anyone with a phone or with a computer can access our meeting with Zoom, that the emailed comments to us, we will of course make them public comments, but they will not be read at the meeting. If you want to join the meeting and make public comments, it's going to be required to be via Zoom or in person.
And we will give those to the clerk to be part of the record.
Yeah,
That's a motion, I hope.
yes.
Second.
Okay. Any further discussion? I don't know why I keep looking back there. We have a motion by Commissioner Hurd, seconded by Commissioner Smith. All in favor?
Aye.
Aye.
All opposed? Motion carries unanimously. I don't know that I got any mileage out of my bringing up the emergency order from Miami-Dade about the hospital data. I sure would like to do that, because that's information that I think everybody in this county needs.
If I might offer a suggestion, we could reach out to the Cleveland Clinic in Martin County and ask whether they would be willing to provide us with that information. Karen and I, certainly the county administrator and I, could reach out if.
What happens if they don't agree to that? Because they're corporate, all the way in Cleveland, so who knows what some administrator in there, decision maker in there.
Harold?
Yes.
They,
Mr. Chair?
Yes.
Sorry. At the very least, could we be prepared if we don't get a positive response?
Okay. So would you look into crafting something similar to this? with the appropriate data request.
You're asking for an emergency order, or you're asking for just a
however-
request? Well, they,
I'm just saying, this is how they did it. I don't care how we do it, as long as
yes,
we
sir,
get the
I
same
just
information.
was pointing out, it will be received differently. A request is just a request, an order is an order. So,
Well, I think
you
what
know,
Commissioner Smith was, we're going to ask first, and if we don't get
Okay,
the right
then-
answer, then we're going to move on to, I'm just asking you to be prepared for Phase 2 if necessary.
Yes, sir.
Yeah.
Understood.
Okay. Okay, with that, any other comments? Anybody want to stay another hour? Okay, we are adjourned.